The Committee on Budget, Appropriations, and Finance is hereby called to order. I'm going to ask the Madam Clerk to please give the roll call.
Senator Marvin A. Blyden. Present. Senator Blyden present. Senator Samuel Carrion. Senator Samuel Carrion absent. Senator Dwayne M. DeGraff. Here. Senator DeGraff present. Senator Ray Fonseca. Present. Senator Fonseca present. Senator Donna A. Fred Gregory.
Here.
Senator Fred Gregory present. Senator Novelli Francis Jr. Senator Francis absent. Senator Javani James Sr.
Anybody say good?
I can't see. Senator James present. Francis is here.
Present.
Also.
Senator James present.
Senator James present. Is Senator Francis here? Madam Chair, 5 present, 2 absent.
Thank you, Madam Clerk. A quorum has been established. Is there any correspondence to be read into the record?
Yes, Madam Chair.
You may proceed.
August 2nd, 2023. Honorable Donna A. Fred Gregory, Chairwoman, Committee on Budget, Appropriations, and Finance, 35th Legislature of the Virgin Islands, Capitol Building, Shaltamalia, P.O. Box 1690, St. Thomas, Virgin Islands, 00804. Dear Chairwoman Fred Gregory, I'll be late to today's Committee on Budget, Appropriation, and Finance meeting, which will begin at 9 a.m. in the Earl B. Otley Legislative Hall in St. Thomas, as I am in transit. Please accept my apologies for my tardiness. I look forward to joining the meeting as soon as I arrive. Your patience and understanding will be greatly appreciated. Sincerely, Samuel Carrion, Senator, 35th Legislature of the Virgin Islands. That's in the correspondence.
Please read, thank you. Please read today's agenda into the record.
July 31st, 2023. Committee on Budget, Appropriation, and Finance Agenda, August 2nd, 2023. The Committee on Budget, Appropriations, and Finance has scheduled a meeting for Wednesday, August 2nd, 2023 at 9 a.m. in the Earl B. Otley Legislative Chambers on St. Thomas to receive testimony on the proposed fiscal year 2024 executive budget for the government of the Virgin Islands of the United States. Agenda, Block 1, Schneider Regional Medical Center. Invited testifier, Ms. Tina Commission Esquire, Chief Executive Officer, Schneider Regional Medical Center. Block 2, Fredericksted Healthcare, Inc. Invited testifier, Ms. Masseray Sproff Webster, Chief Executive Officer, Fredericksted Healthcare, Inc. Block 3, St. Thomas East End Medical Center Corporation. Invited testifier, Dr. Tess Richards, Acting Executive Director, St. Thomas East End Medical Center Corporation. Madam Chair, here ends the reading of the agenda.
Thank you, Madam Clerk. And good morning to the members of the Schneider Regional team. And as shared with us on today's agenda, we will hear from the members of the Schneider Regional team, the Fredericksted Health Center, and the East End Medical Center this afternoon. And they all will provide testimony in support of their 2024 budget. Good morning again to the listening and viewing audience and all those within the sound of my voice. Good morning. I'm going to ask the testifiers that's before us and that's the Schneider Regional family to please put their name and title on the record We're going to start with the Chief Executive Officer, Ms. Attorney Tina Commission. Then everyone else will follow suit. But before you begin, let me ask you, do you have anyone in St. Croix or anyone on Teams?
No, Senator Fred Gregory.
And all of the individuals that are here in front of us in the well, you don't have anyone that's outside of the well you wish to have in the well?
Senator, we have a few of our team members that are sitting in the audience that could be available to provide responses to questions if they're needed.
Okay,
Thank
very
you.
well. All right, you may proceed with your name and title on the record.
A pleasant good morning to all. Tina Commission, Chief Executive Officer of Schneider Regional Medical Center.
Good morning. Kenisha Angle, Director of Finance at Schneider Regional Medical Center.
Good morning. George Rosenberg, Acting Medical Director, Schneider Regional Medical Center.
Please repeat that, Dr. Rosenberg.
George Rosenberg, Acting Chief Medical Officer, Schneider Regional Medical Center.
I think you're going to have to do it one more time and get closer to the mic.
I'm going to get good at this. George Rosenberg, Acting Chief Medical Officer.
All right.
Good morning, Darrell Smalls. Good morning. Good morning, Darrell Smalls, Executive Director, Territorial Hospital Redevelopment Team.
Good morning, Delphine Olavachi, Chief Nursing Officer.
Thank you. Media, I think we're having some feedback on the mics that are the two mics that's on to my right, which would be your left. So we're going to go ahead and ask the CEO to please move forward with your testimony. You may proceed.
A pleasant good morning, Honorable Senator Fred Gregory, Chairwoman of the Budget, Appropriations, and Finance Committee, Honorable Senators of the Budget, Appropriations, and Finance Committee, Schneider Regional Medical Center staff, and the listening and viewing audience. I am Tina M. Commission, Chief Executive Officer of Schneider Regional Medical Center. I appear before this committee with members of Schneider Regional Medical Center's leadership team to present testimony on SRMC's fiscal year 2024 budget. Also appearing with us is Mr. Darrell Smalls, Executive Director of the Territorial Hospital Redevelopment Team, who may provide the committee with updates and respond to questions about the redevelopment efforts in the St. Thomas St. John District. I would like to begin by acknowledging our dedicated team of clinical and non-clinical employees at Schneider Regional Medical Center. Our team continues to provide excellent care to our community, impacting and improving the lives of those we serve every day. We have a team that is capable of seriously advancing healthcare and saving lives. We just need additional funding. At our testimony last year, I noted that we were in the open window for on-site accreditation surveys by the Joint Commission. I am happy to report that our Royal Esther Schneider Hospital, our Myra Keating Smith Community Health Center, and our laboratory facilities passed those Joint Commission surveys with flying colors. We received no major clinical findings, and we will continue to be fully accredited for the next 2 years. Additionally, our hemodialysis department, which currently cares for 75 of the approximate 135 dialysis patients in the St. Thomas St. John District, was surveyed by CMS, the Centers for Medicare and Medicaid Services, in May of this year and received an exceptional review with no major clinical quality findings. Kudos and thanks to our team members at SRMC, who are constantly pursuing improvements to the quality of care we provide and improvements in our patients' experience. Our SRMC team members and I are personally invested in improving the financial health of the organization and in expanding access to care for our community, because it's more than just a job, it's our calling. For FY 2024, SRMC presents a conservative operating budget of $105.7 million. The bulk of SRMC's operating funds, approximately 70%, are generated by the hard work that is done at SRMC, providing care and collecting for that care. We project generating $72.3 million in net patient revenues in FY 2024, up from the $59.5 million that we are on track to generate this year. Projected revenue improvement in FY 2024 is linked to efforts which have already begun over the past year to improve collections and to add profitable service lines. SRMC's FY 2024 operating budget includes the proposed GVI appropriation of $31 million. By law, the GVI appropriation should cover uncompensated care, which is defined in Title 19 of the Virgin Islands Code, Section 221, as the sum of charity care and bad debt resulting from healthcare services provided by the corporation after due diligence to collect. Contractual adjustments in reimbursement for services based on agreement with a payer to include, but not be limited to, Medicaid and Medicare are not included in our figure for uncompensated care. And it should also include the local Medicaid match, which is defined as 17% of the total of the approved Medicaid claims for FY 2024. SRMC's uncompensated care in FY 2024 is projected to be $27 million, and the local Medicaid match for SRMC for FY 2024 is projected to be at least $3.1 million. Salaries and fringe together represent approximately 68% of SRMC's total operating budget. Salaries and wages for FY 2024 are budgeted at $52.3 million, and fringe benefits are budgeted at $19.6 million. Our biweekly payroll is approximately $2.1 million. Salary and benefit expenses have increased due to the adjustment of the nursing salaries, the addition of staff in our business office to assist with collections, and the onboarding of physicians in specialty areas. Materials and supplies represent 11% of SRMC's total operating expenses at a proposed cost of $11.9 million. Other services and charges, which include freight, professional services, and temporary staffing agency expenses, are budgeted at $14.4 million and represent 14% of our total operating budget. Utility costs are budgeted at $5.6 million, which is 5.3% of our total operating expenses. SRMC has solid strategic plans to improve our financial position. SRMC's most important strategic initiative is to improve our financial position, as that will in turn allow us to continue our mission of providing access to high-quality healthcare. SRMC has specific, measurable plans for increasing our revenue and reducing our expenses. For increasing revenue, SRMC is very focused on collecting more for the work we already do. Our revenue cycle team has been focused over the last year on improving every part of revenue cycle, from initial registration to final bill, and we will continue to do so. We have been studying our denials and have been strategically attacking opportunities to improve our documentation, coding, and billing processes. Currently, cash collections are up 17% from FY 2022 and continue to improve. Monthly cash collections over the past 6 months have averaged $4.5 million per month, up from previous historical months of $3.5 to $4 million. SRMC has had one of its best months of collection ever on record recently, with $5.7 million in collections in May of 2023. SRMC has doubled down on its efforts at collecting revenues by investing in training and supporting our existing staff, as well as adding new permanent staff and resources dedicated to billing and collecting. We have implemented an online bill pay option, and we are now sending bill notifications and reminders via text messages. SRMC will be working with JFL to renegotiate payment rates with payers to more adequately reimburse us for care, which will allow us to collect more for the work we are already doing. In addition to collecting more for the work we're already doing, Schneider Regional Medical Center is very focused on generating new revenue. We must optimize patient volumes, improve our payer mix, and introduce new profitable service lines to generate new revenue for SRMC. We've invested in expanding service options that our community has demonstrated a need for. We've onboarded a psychiatrist, and we now have a wellness clinic where patients can receive outpatient behavioral health services to include transcranial magnetic stimulation. We have also engaged a full-time interventional cardiologist who will begin working at Schneider Regional Medical Center this year. This interventional cardiologist will provide both emergency and routine cardiac services and will treat conditions that in the past have required patients to travel off-island. For FY 2023 so far, we have had 148 off-island transfers, of which 53 were related to cardiac conditions. We will be able to treat those patients at home with the addition of this service line. In expanding this service line, we are reducing expenses of flying patients out, and we're increasing our revenue-generating procedures. We are also opening both dermatology and gastroenterology clinics this year, which will provide critical screening and treatment and will generate additional revenue for the organization. At Myra Keating Smith, we will be expanding services to keep pace with the increased utilization of the clinic. Historically, we see more than 6,000 visits annually at Myra Keating Smith. For 2023, we have already had 5,986 patient visits, well on track to surpass our annual average. We will start rotating specialists to Myra Keating Smith to expand their outpatient offerings. And we are also in talks now with a nephrologist who will help us to advance our plans of introducing options for home dialysis care, which will allow St. Johnians to receive their dialysis treatments on St. John, which has long been requested and desired. In addition to increasing revenue, we will be working at reducing expenses. We are working hard at replacing expensive contract labor with permanent staff. In FY 2022, our organization spent over $11.4 million in staffing agency costs for critical positions such as registered nurses, midwives, locums, and allied health professionals. SRMC was also supplemented during that time with temporary agency staff from Pafford, which are not included in that total as they were not direct expenses of SRMC. SRMC continued to rely heavily on agency labor to fill critical vacancies through the beginning of FY 2023, and especially with the end of the Pafford contract, continued to need to supplement with temporary staff. We are projected to spend a total of $12.5 million on temporary contract labor in FY 2023. But for FY 2024, our overall contract labor expenses are expected to decrease significantly, down to $9.2 million, because we have completed negotiations with staff nurses and licensed practical nurses, and we have implemented our new pay plans. We do expect to see an associated increase on the salary and benefits side for permanent staff members for FY 2023 to FY 2024. Implementation of the new salary plans led to the onboarding or commitment of more than 46 permanent nurses that will join our team this year, 12 of whom are UVI grads. We congratulate our Chief Nursing Officer, Dr. Delfino Lavacci, and the nursing leadership team for their success in the recruitment efforts for nurses. Based on our average daily census and robust outpatient services, Schneider Regional Medical Center requires 130 nurses, and we are on track to achieve our full complement of permanent nurses by the end of February 2024. The average annual salary and benefits of the newly onboarded and committed registered nursing staff is $116,892, as compared to $260,000 per year for an agency nurse. We would like to highlight that of the new permanent nurses that have been added and selected, 8 are stationed at Myra Keating Smith, which will bring Myra Keating Smith up to its full complement of permanent nursing staff required for the clinic. SRMC is also actively recruiting for permanent medical staff to reduce our reliance on expensive locums staffing. Between January and June, we had a monthly average of 12 locum tenens on site. JFL and SRMC are working together to restructure our physician contracts and to renegotiate with AHEP, the physicians union. We know that turnover is expensive, and therefore, at Schneider Regional, we are very focused on the retention of our permanent employees. We have been working diligently to make sure our employees are being compensated appropriately and that they have opportunities for growth within our organization. In FY 2022, RN turnover was at 20%. For 2023, thus far, it is down to 4.7%. Another initiative towards reducing expenses for Schneider Regional is controlling our spending and finding savings in supply and pharmaceutical purchases. In FY 2023, SRMC rolled out department budgets and empowered each department head to become active in finding efficiencies and cost savings for their areas. SRMC is continuing to work through its new group purchasing organization to seek better pricing on supplies and pharmaceuticals. SRMC has also begun to jointly negotiate some purchases with the Juan F. Louis Hospital to achieve overall cost savings for the corporation and the territory. SRMC has its financial challenges. Although we have made progress in advancing our strategic initiatives over the past year, our organization continues to be challenged by several national and local factors that must be considered. Nationally, per the March 2023 Kaufman Hall report, inflation and pricing pressures are leading to significant cost increases across the board in healthcare. In addition to the national pressures, SRMC faces 3 major local challenges that play a significant role in our ability to maintain our operations. The first being our payer mix, the second being the number of unsafe discharges or boarders that we care for, and the third being deferred maintenance of our facility due to a lack of a capital budget. SRMC has outstanding accounts payable and accrued liability of $29.8 million. In terms of our payer mix, it's one of the biggest challenges to improving our financial situation at SRMC. We provide a significant amount of undercompensated and uncompensated care. Almost 80% of the care that Schneider Regional Medical Center provides to our community is either completely uncompensated or significantly underpaid. 64% of our services are provided to patients with payers that reimburse at a rate below the actual cost of taking care of that patient. 39% of our payer mix is Medicare, and 24% of our payer mix is Medicaid. Another 14% of the care we provide is to persons who fall into the self-pay and uninsured category. Commercial insurance business accounts for only 19% of SRMC's reimbursements. Our payer mix continues to be unfavorable, with it worsening over the last few years as the percentage of self-pay patients has increased. SRMC is also handicapped by the fact that many who are above the threshold to qualify for Medicaid are not enrolled in individual insurance plans. The total uncompensated care for FY 2023 is trending to exceed $24 million. The bulk of our uninsured patients are seen in our emergency room and at Myra Keating Smith, where we are required to provide services to anyone who walks through our doors. Self-pay accounts are a challenge to collect on. In FY 2022, SRMC's self-pay accounts totaled more than $17.3 million. Of that, SRMC collected just over $1.2 million, which is only approximately 7% of the total billed charges. Thus far, for FY 2023, SRMC has billed out over $14.7 million in charges for self-pay patients, and only $556,000, or 4%, has been collected. We do offer hospital presumptive eligibility, otherwise known as HPE, as a short-term coverage option to the full Medicaid coverage to as many patients as possible who can qualify who present as self-pay. Another challenge for our organization is our unsafe discharges and boarders. At any given time, our hospital provides care for 10 unsafe discharges, some of whom have been at the hospital since 2018. These are persons who are no longer in need of acute care that our hospital provides. We receive $0 for caring for a boarder. The annual cost of caring for an adult boarder at the daily Medicare rate, which is lower than the cost of care, is $1,475.83. With 10 boarders currently at the hospital, SRMC will accumulate more than $5.3 million in expenses for which we will receive no reimbursement for caring for these boarders. Our unsafe discharges and boarders continue to be a drain on our resources and cost the hospital millions of dollars per year. Moreover, these patients occupy rooms on the inpatient units that are needed for the acutely ill, which then contributes to extended stays in the ER for acute patients due to our inability to move admitted patients to an open bed on the inpatient units. Because the agencies charged with caring for these individuals cannot immediately place these patients, this body might reconsider reappropriating some of the funding that's available for long-term care to the hospital as compensation for the care that we are already currently providing. Another major challenge for our hospital is deferred maintenance due to a lack of capital funding. We are extremely challenged by having an aging facility. And although we struggle with lack of funding to complete many of the needed replacements and enhancements, the skilled staff of our facilities department and our facilities team under the leadership of Mr. Peter John Baptiste have made great progress this year with maintaining our facilities. We have resealed our roof to stop water intrusion into the building, and we have repaired the fence for the outdoor space on the behavioral health unit, now allowing our behavioral health unit patients to be able to go outside and experience fresh air and that be a part of their treatment. Though FEMA has obligated the funding for a complete rebuild, it will be at least 5 years before a new facility for patient care is realized. Based on the size and age of our buildings and our equipment, SRMC should be investing $3.9 million annually into maintenance, repair, and replacement. We cannot defer needed repairs, as those items have a direct impact on patient care, on regulatory compliance, and on our ability to provide revenue-generating services. Many of the necessary repairs cannot be completed because our operational budget is insufficient to accommodate the required purchases. Among our many projects, we need to replace our air handlers for the building. The AC system was severely damaged in the 2017 storms. A complete replacement would cost upwards of $1 million, but we have developed a short-term and more economical solution that will cost approximately $250,000. We have a proposed $10 million capital budget, and we seriously consider that this body will consider each item included. In terms of SRMC's intra-agency obligations, we are collaborating with other GVI agencies to resolve outstanding balances. As of June 2023, according to SRMC's records, SRMC is owed more than $2 million from other agencies, such as the Department of Labor's Workman's Comp Program, the Bureau of Corrections, the Department of Health, the Department of Human Services, and the Department of Education. When received, These funds can be applied to our outstanding obligations to GERS, GESC, and WAPA. Schneider Regional Medical Center continues to pursue new opportunities. One of our opportunities that we are pursuing is leveraging technology. We are working to expand our technological infrastructure, including adding a patient portal, which will allow our patients to access their own health data. And we're implementing a virtual nursing and sitter platform, which will help us to save on labor costs. Our new Meditech Expanse platform will improve our billing and charge capture practices. The new system will allow for better clinical decisions, which will lead to better outcomes for patients. The project began on October 26th of 2022, and it is 82% complete to date. The new system will allow SRMC to increase collections annually by approximately $2.5 million. We say a special thank you to this body for the funding that was provided through Act 8473, and the upgrade was also supported by a grant through the Department of Health and ARPA funding appropriated by Governor Bryan. Thank you, thank you. We have already exhausted those funds and will require a total of $3.5 million in additional funding to complete this project, as well as put into place a disaster recovery solution. The alternative to not having a disaster recovery solution is expensive. We will continue to seek resources for a complete cloud-based recovery system, but in the meantime, we will be collaborating with VINGN and the Bureau of Information Technology to seek solutions for backing up our data with local point-to-point connections. We are also reviving the Foundation for Schneider Regional Medical Center. The Schneider Regional Medical Center Foundation is now very active again. We have secured a substantial donation of $350,000 from a private donor for equipment that we need for our cardiac catheterization laboratory. That will be coming online by the end of this year. We have also received several other donations from the community, and we would like to say thank you to all of our donors. At Schneider Regional Medical Center, we continue to engage the community. We continue to offer our Dinner with a Doctor series, which is an educational outreach event that is free, where our doctors do short educational sessions with the public to inform them about important health topics. We are also putting forth an Apple a Day preventative health message on the radio and online. We want the community to have accurate information about preventative health practices, as well as have the knowledge of where to go should they need to access resources for their health care. SRMC provides a significant portion of the care needed by those who require hemodialysis in our community, and we are aware of the expanding need for dialysis among our population. We are continually monitoring and preparing to respond to the need to expand our dialysis service offerings. It is our goal that we can always respond to the community's healthcare needs. Ensuring a safe place for visitors and employees is always a priority for us. We congratulate our Chief of Security, Mr. Gideon Garfield, on his recent promotion to police officer status. We are actively working to elevate our entire security staff through training and education and elevating them to peace officer status. In conclusion, our team at SRMC is working hard to provide high-quality care to the residents of the Virgin Islands. We are focused on increasing the community's trust in our hospital system. We are committed to improving and enhancing our physical infrastructure as best as we can while we wait for our new hospital. We want you, the community, to come to us for your care. Choose to come to SRMC when you have a choice in where to go, not just when you have to come to our emergency department. I cannot thank our senior leadership team, our entire clinical team, all of our employees, and our support teams for their continued hard work and dedication to our agency and to the community at large. We will continue to aggressively recruit permanent staffing for SRMC. We are hiring nurses, allied health technicians, and medical staff members. If you know anyone interested in joining our team, they can visit our website at www.srmedicalcenter.org for information on our openings. The budget we presented here today is conservative. Schneider Regional Medical Center will continue to be aggressive with our billing and collections. We're committed to expanding our service lines and to improving our financial position. We are cleaning up our bad debt, and we're reducing our AP. We're working tirelessly to help ourselves. But this body and the government must work with us to adequately fund the hospital system so that we can deliver the health care that our community needs and deserves. We're an aged population. We are underinsured and uninsured. The hospital must receive meaningful financial support to continue to provide high-quality health care to the territory. We'd like to thank this committee for the opportunity to present our budget to you today. I'd like to thank Governor Bryan and his administration and our territorial and district governing boards for their continued support of our healthcare system. Our team is committed to ensuring that Schneider Regional Medical Center is the best hospital on any small island in the Caribbean. The senior leadership team and I are available to answer any questions you may have. This concludes my testimony. Thank you very much.
Thank you, CEO Commission. I want to take this opportunity to recognize the Vice Chair of this committee, Senator Novalee Francis Jr. Madam Clerk, please mark Senator Francis as present. Also, I want to take this opportunity to recognize Senator Carla J. Joseph, non-committee member, but also we consider her an honorary member of this committee. She's always here with us. So thank you for being here, Senator Joseph. I almost want to say mark her as present. All right. So we're going to proceed with our discussion today with the Schneider Regional Medical Center family. But before we begin, I have to seek some clarification. CEO Commission. I'm very disturbed by the fact that the Post-Audit Division requested the financials from the Schneider Regional Medical Center. It was due on May 5th, and we received them yesterday. It is difficult to impossible for us to ask our staff in the Post-Audit Division to provide a analysis that makes sense and to help us to make the decisions that we need to make. So I need to understand what was the challenge, because what we've done, frankly, is individuals, departments, agencies who have not submitted their reports in a timely fashion to allow our staff here at the legislature to do their due diligence so we can make the right decisions, we've sent them home. So I need to understand from you, what is the challenge with us? I mean, May, June, July, we're literally in August, 2 months. And it was sent out since April. So I need to understand what the challenge is.
Yes, Senator Fred Gregory, and I apologize in advance that the committee and that yourself did not have the post-audit submissions that were required. We do submit our financial statements monthly, and we submitted an entire budget package, and I don't know that it got to the post-audit division the way it should be, but we do report monthly, and so those reports were available and should have been submitted more timely so they could be evaluated and so that you could be prepared for today. And on behalf of the organization, I apologize that that was not done.
But I still don't understand why it was due on May, and we only got it yesterday when I was supposed to be coming on here today. That's the question. I understand you to do your financials monthly, but I'm trying to understand why we have an issue. That's what I hear what you're saying, what happens in your shop, but what's the challenge with submitting information to this institution timely? And this is not a new request. We've been doing budgets year in, year out. I mean, I'm new as far as being the chair, so I don't know what happened with the previous chair. But we cannot provide our analysis to our committee members with late reporting like this. And you're a very technical agency. So I'm just going to ask that when it comes to this particular committee, when we ask for information, please provide it in a timely fashion. Otherwise, we're not going to be able to have the discussions. If we're going to have a discussion that is a meaningful one, then we need information in order for us to have an intelligent discussion and for us to understand what's in front of us. And today we are going to struggle with that. Okay? I had colleagues, we're going to go to a four-minute round. There was something that you said in your testimony. I want to say it's on page 2. You indicated that you said by law, the government of the Virgin Islands appropriations should cover uncompensated care as defined in Title 19 VIC Section 2212 as the sum of charity care and bad debts resulting from healthcare services provided by the corporation after due diligence to collect. And I think what jumped out at me is you noted that you are projecting an uncompensated care of approximately 24 million. Is that FY23 or FY24?
Yes, Senator Fred Gregory, it's 24 million for FY 2023 and projected to be 27 million in FY 2024.
Okay, so 27 million for 24. Now, there is some responsibility that would fall on the corporation, right? And it says after due diligence to collect. So share with us, what are your due diligence that you're performing to collect outstanding debt? What does that look like? And I think somewhere in your testimony you did share there was improvement, but share with us, what does your due diligence look like?
Yes, Senator Fred Gregory, and thank you for the question. So we need to diligently bill for services timely after the patient has been discharged, which includes dropping the bill to the payer within a reasonable time period, I'd say of less than 60 days, and then continuing to follow up with the payer. They have usually 30 to 60 days to review the claim, and following up with them diligently on being paid for that. And same thing for self-pay accounts. So we need to timely drop a bill for self-pay accounts, and then at a reasonable period after the patient has received the bill or the payer has received the bill, we need to follow up multiple times to collect on that bill. So that's sending an initial statement, sending another billing statement 30 days later, sending another billing statement 60 days later. And we have a formal write-off process and a bad debt policy that guides when we can officially then claim that as bad debt. And it shows that we've exhausted due diligence in trying to collect.
Okay. Thank you for that. But based on your statement, have you been diligently sending out your billing in 60 days? Have you been diligently doing the necessary follow-ups with those outstanding debt?
Yes, Senator, we're working to improve that every day, and we have been. The number actually is pulled from the cost report, which is a formal way of accounting for the bad debt that's provided by the organization.
So will you say that, because you said that you're working towards it, so you're not there. So if you were to grade yourself from a, let's use a scale from, let's just say A being what we know an A is, an F being what we know an F is in terms of our schooling, what would you grade yourself as it relates to your billing and collection practices?
So I would say we're probably at a B, moving towards a B plus, A minus. What we have claimed here is what we can legitimately claim. So we probably could claim more bad debt and more uncompensated care if we were at an A plus. What we are giving you is the figures that we can legitimately, accurately claim and go back and show that due diligence efforts were exhausted on these accounts.
You wouldn't give yourself a B?
Yeah, a B. From where we were 6 months to a year ago, we probably were at a C, and I think we've moved into B range.
I think the jury out on that one.
Okay.
I think the jury is still out on that. As far as timely collections, the follow-up component, do you have the appropriate staffing to follow up? I think there was a question that was asked, I believe when you were here the last time, as it relates to, I don't know if it was asked of you or we had a sidebar on it, but you're using a collection company, correct?
We use a third-party company that does help us with following up on our claims and working on denials management. We also have added staff internally and done training with our staff internally to have them improve their collection practices. And so we have seen over the past 6 months a notable change of more than $500,000 additional being collected every month at Schneider Regional, which is
And
very,
who's doing
very
the-
impressive.
And who's responsible for the quality assurance on that?
So that's all under the Department of Finance, and our Director of Finance, Ms. Kenesha Engel, can speak to the specifics, but we have a training manager that reviews and assigns claims,
No,
and we have a
that's not what I'm
business op-
asking. Quality assurance meaning, based on your representation here, that you would give the organization a B as it relates to diligently sending out billing and the follow-ups as it relates to collections. Who's providing that quality assurance on that?
So we get feedback in terms of the quality assurance from the clearinghouse that we submit through. So they give us a score in terms of how many claims you've submitted are clean and will be accepted by the payer, and that number for us exceeds 93%.
So you're using the word submitted. You understand my challenge? You're using the word submitted. Quality assurance internally. Who's assuring or ensuring that the the billing is done timely? Where is that internal audit check? Is that occurring?
Yes. So we have a whole revenue cycle team. We meet weekly with our revenue cycle team. Each of the areas within revenue cycle present their statistics, their KPIs. That's monitored by Ms. Kenesha Engel, who's our Director of Finance, who attends that meeting, as well as myself.
So let's hear
and we
from
are
her.
keeping them on track with in terms of the numbers of discharges, how many bills have we dropped, what are the days from discharge to dropping that final bill. And so we're tracking statistics internally to ensure that we're meeting the mark.
Okay, so let's hear from Miss, I don't want to say the name right, Miss Engel, Director of Finance. Let's hear from you with regards to the question that I asked and the quality assurance component, and what is your comfort level with what's occurring at the hospital now?
Good morning. Thank you for the question, Senator. I would also rate the work that's being done through the revenue cycle as a B. I've seen drastic improvement with the collections that is being done through that body. We're tracking denial rates, and we're looking at our payer clean claim rates, where we were at 85% or 87%. We're now at 90. The highest we've been is about 95% of claims that are actually gone through the door and has gone through clean, which has been done by looking at processes and ensuring that documentation is drafted and that your physician notes are adequately noted and that you're coding everything that you need to code. We're looking at uncoded versus coded charts, the timing of when those are turned around, and how fast the bill can drop through. How fast the bill is able to automatically drop to those payers. So there has been drastic improvement through that body.
So next year when you come back, the reason why I asked the question, I'll tell you why. I asked the question because of you indicated in your testimony that you anticipate 24 million in FY23, but in 24 you anticipate a higher number of 27. So what is causing you to see that $3 million difference, which is higher in the year? If we are improving, then we should be moving in the other direction.
Sure, and thank you for that very good question, Senator Fred Gregory. That reflects a change, a projected change to our payer mix. As we know, with the ending of the public health emergency, there are going to be a significant number of persons that are going to drop off of the Medicaid coverage. And so that's going to increase our number of uninsured patients. As we reported earlier, we only collect at best 7 to 10% on our self-pay accounts. So losing somewhere up to 10,000 potentially of the 39,000 or so that are enrolled in Medicaid will have a significant impact on the uncompensated care that comes to Schneider and the resulting bad debt after due diligence to collect.
So basically, we're saying that at about 90% of our self-pay individuals do not pay in this territory. So internally, what can we do from a legislative perspective other than us talking about providing funding? Because we have to keep it real here. Our revenues are what they are. And of course, we have a whole number of other agencies that we have to support. We do recognize, I in particular, recognize that there's something that we have to do in order to address the challenges that we have in our healthcare system as it relates to your ability to do your job, your ability to provide the basic supplies for our for the patients. But what can we do on this side of the aisle to address this 90% issue that we have as it relates to uncompensated care? Or let's just use self-pay. Let's just self-pay this 90% challenge that we have of individuals who are not paying once they leave the hospital. What we can do from a legislative perspective and from the perspective of the hospital proper.
Thank you, Senator. And I think there are a number of things that we can do. We need to try to continue to expand the insurance coverage that's available locally so we have more people covered and less self-pay. And we definitely appreciate the efforts that the Lieutenant Governor's office has started in terms of getting more insurance coverage available for the territory. We need more plans, better plans. In terms of self-pay patients who do come and present, many of them have the resources and ability to pay, and how do we put some teeth in there from a legislative standpoint to force them to pay or to go after their assets where they don't pay. I'd love to have more conversation with the committee at appropriate time about things that we can do together. I think really importantly, we can work together to try to improve the rates that we receive from Medicare and Medicaid. As you know, our Medicare rate is very low. It's tied to TEFRA. It's set at 1982 level. It doesn't cover the cost of care. And it's a significant portion of our patient population. So if we could work together to increase that rate, that would help us a lot. Same, applies on the Medicaid side. So if we could work together to get the cap removed with the delegate, that would be great. We've done a good job of increasing the percentage of the FMAP now to 8317, and so that's really positive, but it hurts that we have a cap. If we can get rid of the cap, we can cover more people under Medicaid. There would be less self-pay people presenting to the hospital. So lots we can do together.
And thank you for your response. I'm very happy that it is clear that you have the perspective on what we really need to do. I know on this end we have a subcommittee that should be dealing with health matters, and I've sat here, I've been in this institution since 2019, and the conversation around our healthcare challenges as far as what's impacting you in particular at your hospitals. We want better healthcare, but we don't really want to pay for it. So we got to decide as a people what we want to do. So, government can't take care of everything. However, if we are on this end responsible for legislating, then we should do what we have to do. On your end, then we do what we have. You do what you have to do. We have there are a number of agencies or departments that impact what you do. We have the Department of Human Services. They were here a few weeks ago, last week, and we asked them about. This is a question that I continue to ask about this whole TEFRA rebasing, the Medicaid, the Medicaid care, the Medicaid aid, the Medicaid cap, etc. But we are not doing this. We're not getting together and making sure that we are able to begin to truly flesh out these issues. So we leave you in a situation where you have to fend for yourselves, and then we have these expectations. So I'm not coming at you in any way other than to make sure that we understand as a community what's happening at our hospitals, what the challenges at our hospitals. We cannot provide care if we are not paying our bills. So there's something that we have to do here from an institution. We have to figure out what's constitutional from what's not constitutional to make sure that we are able to do what's necessary. I mean, it's time that we really stand up on some of these issues. So I'm prepared to do what I have to do and to work with my colleagues and work with you and Human Services, Department of Health, et cetera, so we could get this stuff done. But we can't keep talking about it. It's time for us to move on. We've talked enough. All right, colleagues. I'll ask my other questions. I think I've been on my little soapbox long enough, and it's your turn. So Senator Marvin Blyden. Is there anyone else that came in sync? Right? Okay, Senator Blyden, you are recognized for your 4 minutes.
Thank you, Madam Chair. Good morning to my colleagues, viewing and listening audiences, staff, central staff. Good morning, CEO, Commission, and your supporting team there with you. And thank you so much for your testimony.
Good morning, Senator Bladden.
In respect to my line of questioning, I usually use the post-audit report to do my inquiry, but as was stated, we did not get the information needed to query, but nonetheless, let me speak to your ask, which is, well, let me ask first, your fund balance, what's your fund balance to date? Because I note that you're requesting $750,000 less than 2023. So what's your fund balance to date from the general fund?
I will thank you, Senator Blyden, for the question. I will defer to Ms. Kenesha Engel, who has the specific numbers and data in front of her.
Good morning, and thank you for the question, Senator.
Good morning.
Currently, we are at $31 million. That's $28,250,000 for just the general fund, and we have an additional $750,000 for the disaster recovery fund, and then an additional $2 million was allotted to this body for supplemental raises.
How much have you expended to date? That's my question, really.
The full allotment, how much we've spent today?
You have?
Everything.
So you have already surpassed?
We've only gotten the months.
Well, we've gotten everything that we've received.
Clarify for me, please.
We've received our allotment through the month of July. We're still pending August and September releases. We have expended fully the allotment funds we've received for this fiscal year.
Okay, so I've spent it all. Okay, very well. Let's go to your patient revenue. Because in your testimony you spoke to some increase of $13.5 million increase in patient revenue. Succinctly, what have you done to project that amount in increase?
Yes, Senator Blyden, thanks for the question. That's those projections are due to a lot of the hard work that's happening within our revenue cycle that we were discussing in terms of billing and collecting better for the work that we do, making sure that we're not leaving any money on the table, making sure that our providers are documenting everything they're doing so we can bill and collect for everything that we should be collecting for. In addition to billing and collecting better, we're going to be adding more profitable services. So we plan to do more outpatient procedures. We plan to try to expand the offerings from our lab. We have a very busy radiology and rehab departments that we are working to increase volumes and productivity there. So we're driving a lot of clinical service line expansion as well as revenue collection efforts over the next year, which will help us get more money in revenue.
Okay, very well. Let me ask in respect to your contracts and professional service listing, you have any outstanding vendor payments when it comes to your professional service contracts?
Yes, Senator Blyden, we actually have a significant amount of vendor payments that are outstanding. We have a significant AP listing. We very much appreciate our vendors, and we try to work very diligently to ensure that we are paying them timely according to the contract terms.
What's the total amount in outstanding debt?
Our AP is currently at approximately $29 million.
$29 million in outstanding debt. What's the plan? In respect to collections.
I'm sorry, can you
Is
repeat
there
the
a
question?
plan?
30 seconds.
There is a plan to continue to work down our AP. As we increase collections, we plan to work at paying our vendors for the valuable services and goods they provide to us. as well as we are doing a cleanup of our AP to make sure that all of the things that are listed within our AP are really true payables. We have a sense that some of the AP listing may be adjusted over the next year to come downward. So we're projecting coming back to this committee with a much better AP number at our next hearing.
Time.
Very well, close them, Madam Chair. Okay. Let me actually, in terms of your peer mix, that chart that you have, it's very interesting because in discussing it, you spoke to 90% of reimbursement, which comes from insurance such as Cigna, etc. That leaves 81% in other categories. So it means a lot of things in terms of our tax base and in terms of affordability with other insurance companies, etc. Now, my question is, because as we know, many locals go off island and or they go to other areas in terms of local providers. So you're losing business in two categories. So my question is, what are you doing to attract our people here to the local hospitals in order to support your operations? What's being done in that space?
Yeah, I think that's a great question, Senator Blyden. We are working very hard at Schneider Regional to build the community's trust in the care that we give. We have excellent providers, very, very talented physicians, nurses, techs, support staff, as good as or better than anywhere in the United States, and we want our people to come to us for their care. You have a choice in where you go. All of our government employees have Cigna, which provides great coverage. We want to be able to provide services to our community, and we want people to choose us instead of going away to Cleveland Clinic or any other facility, Baptist, anywhere else for care. Come to Schneider Regional.
How much you think you're losing in that respect?
We've seen reports of what the insurance dollars are that go out of the territory, and I think it's exceeded $30 million according to some number that I've seen. So we'd love to capture some of that here. I think there's some great work happening with our medical staff and under Dr. Rosenberg to recruit highly qualified specialists that can compete with anyone that's on island, anyone that's off island. And so we just want to build our business, build the community's trust in what we do, and continue to expand and provide profitable services.
Well, thank you so much for your responses, Madam Chair. I want to thank you so much for the time.
Thank you, Senator Blyden. Senator DeGraff, you're recognized for your 4 minutes.
Thank you, Madam Chair. Good morning, colleagues. Good morning, testifiers, all viewers, listeners, and present. I was going by your numbers, and first of all, thank you for what the hospital does. Priceless, really. But your numbers said 68% for personal and fringe, 5.3% for utilities, other services 14%, supplies 11%. That comes to 98.3%. So you got $1.7 million floating. Where is that money?
In smaller subcategories, sir, and I'm sorry, we just highlighted some of the larger categories. We didn't include every line item in that paragraph, but good catch. There's a little bit more that's out there for smaller line items.
Okay, no, because I trying to see where I could help you find money too, but it's so that 1.7. Okay, so you're aware of it and it's out there.
Yes.
So when you say it's out there where?
I will defer
need
to
know
Ms. Engel, who has the detailed line item.
Okay, good.
Good morning. Thank you
Good
again
morning.
for the question, Senator. Looking at the budget, we do have about a 1.8 that we kind of put out there for any capital upgrades or repairs that we may need during fiscal year 2024, which we will need during fiscal year 2024.
Okay, so then again, you could give us a listen as to what? Now, I see the 68% is up 4% from 23. Now, you had wage increases for nurses only? Did anyone else receive wage increases?
Yes, Senator DeGraff. We've done primarily the staff nurses' salary increases. We also did LPN salary increases. We look forward to getting back to the table with the Registered Nurses Leadership Union to do their negotiations. And then immediately following that, we're going to be restructuring our physician contracts along with JFL, working on the AHEP contract. So we do project significant, 4%, as you noted, increase to salary and benefit and fringe for FY 2024.
Okay, and any other support staff?
We have increased some other support staff. We've done incremental. We've tried to create some career ladders within some of our divisions. So within the business office, we've created some career ladders within materials management. We're looking at how we can do it within security. So there have been some other smaller incremental moves as we try to adequately and fairly compensate our staff and retain our staff.
Okay, then, sorry to cut you off, but
That's okay.
I don't see that with a 4% increase in your personal and fringe to cover all what you're saying.
We built in some of the increase in 23, so it's
Okay.
already there a little bit in 23, and then it continues to increase in 24.
Okay, so for 24 going forward, this 4% increase in personal and fringe would be able to cover what? Who? Or I shouldn't say what, whom?
We're hoping that will cover the incremental increases for the RNLU and what we need to do in terms of AHEP and some other incremental moves. We may get back to the table with our security union, and we're at the guidance and direction of OCB for other negotiations that may come up in FY 2024.
So the 4% will
1
cover
minute.
security and all the other entities?
And it may be a little higher in terms of planned increases, and there are some decreases that are built into that number too. So we're working hard to control overtime, so that would have been an offset to the increases that we planned. So we can certainly continue to discuss with you some of the other movements within salary and benefit, but we do see fringe going up a little bit in some areas.
Okay.
All of that is being offset by what we're reducing in contract labor, and we're spending much more on contract labor. So this is a much better
30
investment.
seconds.
Okay, so so to wrap, the $250 for the air handlers, take it out to 1.8, that cover your air handlers. You have that money floated for capital project, that should cover that. How much money are you collecting on a monthly basis, you said? Or annually? How much money are you collecting? Because right now your Meditech Expanse platform is, as of October
Time.
22, if I may just complete, Madam Chair, it is at 82% complete. And you can add an increase of 2.5 million to your collections. So how much you say you're collecting on a monthly basis?
We're collecting in excess of 5.5 million, trending to 6 million per month in terms of our collections.
Okay, so then with completing this Meditech Expanse platform, could add 2.5 million to you, you could look at 7.5, almost 8 million in collections. So where you need 3.1 million, to me that's high priority. So again, factor that into the 24, and do you have the staff in for that? So you could just talk about, on the chair's time, this Meditech Expanse platform a little more in detail, please. Thank you. Thank you, Madam Chair.
Thank you, Senator DeGraff, for the question. The Meditech, the improvements that we're going to get off of the Meditech Expanse platform, which are itemized in the testimony, are what are helping to drive the increase in collections that you see on the revenue line for FY 2024. So concluding the Meditech Expanse upgrade, getting better physician documentation, better coding, better billing, better denials management practices in place is going to help us achieve that $6 million in collections per month. Okay? Thank you, sir.
Thank you, Senator DeGraff. So just to follow on with the line of questioning, are you representing that with the onboarding of Meditech in earnest, that you're going to see an additional $500,000 a month? What are you projecting there? Because based on your responses, it seems like it's $500,000 give or take.
That's our goal, yes, Senator Fred Gregory. We are planning to increase our collections. We've come from being an organization that collects on average $3.5 to $4 million a month historically, to now being an organization that collects upwards of 5.2, approaching 5.5 million every month. And we plan, through all of our efforts as outlined today, to continue that work, to be hitting $6 million a month as an organization in our collections, which is major, major improvement. And I have to give thanks and kudos to our clinical teams and our revenue cycle team for all the work that they're doing to get us there, and our medical staff team.
So that's huge. So if you are collecting, give or take, 5.5 million a month, that's mean you're collecting about 66 million a year. And you receive about 31 million from the government?
Yes, Senator Fred
So
Gregory.
that's 97 million.
Yes, Senator Fred Gregory.
Okay, but you're asking, you're in your opening, you said that you need more money. What is your, you probably have it in here, but I just need it to be clearly placed on the record.
Yes,
What
Senator
is
Fred-
your current, what are your current expenses? I have it here, you know.
That's it exactly, Senator Fred Gregory. You hit it exactly on. So our expenses continue to increase, and that is typical of any small community hospital right now.
No, what's that number? What is that number that you're projecting for FY '23? Your expense that you see at the end of the year, you're going to,
105.
your cost?
No, that's for 24.
For this year.
Yeah, 23.
The question for FY 2023, Senator Fred Gregory?
You want me to answer?
Sure. I'll defer to Director Engel.
Good morning again, Senator, and thank you for the question. Currently, projected for 2023, we are anticipating that expenses to exceed about $98 million.
Okay, so if you're, when you say exceed,
Roughly around $98 million, not on the dot 98, but roughly.
so give or take 98, so you're gonna, and you're projecting to be short how much? Because if you're saying that, then you're only projecting to be short somewhere about $1.5 million for FY '23. 1.5 million. About, based on the numbers that you shared.
I think that's correct, Senator Fred Gregory, and I think that that is what turns into deferred payments and then is growing our AP. And we have to collect more and cut our expenses so that we are fully able to cover our obligations.
I'm saying this because then you and, is it your testimony that you are in, I don't want to use the word dire straits, but I'm going to use it. Because it doesn't seem that you are in dire straits based on the numbers that we've calculated thus far. And based on the improvement that you've made where you're giving yourself a B. So when I said the jury is still out on it, I have to pull that back based on what you're saying, because I'm seeing, based on your what you're representing, I'm seeing that you have, which is significantly improved from prior years. You seem to have like 1.5, let's say 2 million, 1.5, give or take, shortage.
I think that's correct, and you do note the improvements. Thank you for what we are doing on the revenue side, but our expenses have also increased tremendously, and so we have to continue to keep pace with those, and we are still short at the end of the day, and it is still tight in terms of our cash management as an organization, and we do have to make decisions about competing priorities in terms of vendors that we really need for staffing, for supplies, for pharmaceuticals, for blood. I mean, we make very difficult decisions in how we manage cash. Even though we're working to improve ourselves right now, there is a little bit of a time period where we need that additional investment from the government to help us get there. And right now we're adding to the payroll in terms of properly recognizing and reimbursing our nurses and our other staff. We're adding physicians that are very highly qualified, and we have to compensate them. And it's going to take a little while until we start to realize those revenues and until we start to fully come off of the contract labor, because now we have everybody oriented. And so we need some investment at the hospital for this period of time as we work to continue to help ourselves. And that will result in the government having to give us as much of an appropriation and allotment year over year in the future.
So based on what you said, the presumptive eligibility. So when a patient comes to the hospital, what does your check-in look like in order to ensure that we are capturing those individuals that may qualify for presumptive eligibility?
Sure. So at every visit, we should be and are instructing our patient access reps to ask for the patient's insurance information. And if they report that they don't have any insurance coverage, we inform them about the HPE program and invite them to enroll. It's a self-attestation process where they have to go through a number of questions in terms of their citizenship, how much money they make, and other demographic information. And based on their responses, a decision is made to either qualify them for the temporary coverage or deny them for the temporary coverage. And although we'd like everybody to be approved for the temporary coverage, the reality is that some folks don't fit within the box, and so then they cannot get that coverage, and they remain as self-pay. And that number is larger than we'd like it to be.
Okay, so let's go back to the quality assurance conversation. Because again, and I think I've said it to every single meeting, what gets monitored gets done, right? So quality assurance, do you have a system in place where that's being checked? While your staff, I don't remember the title that you gave earlier, but while your staff is responsible for, that desk is responsible for making those checks, how do we know that that's occurring?
Yes, Senator Fred Gregory, and that's a perfect example of one of the things that we look at our revenue cycle meeting. So our patient access manager has to come to that meeting with statistics of everybody who was registered as self-pay, whether or not they were offered HPE, what the reason was that they were denied. Is it because of citizenship? Is it because of income, et cetera? So that we can go back, review that data, ensure it is being offered, and then respond to the Medicaid program. And that's something that we've put into place under Ms. Engel and myself within the past year. That is leading to change.
Okay, and then I'm going to go to the next senator. The next senator is Senator Fonseca. But let me ask you, so how often, what's the turnaround time for your payments? You're receiving your payments from the Medicaid program.
From my level, I think it has improved over the past year, but some months we don't get the deposit as smoothly as we need to. I will defer to Ms. Engel, who is more intimately involved with that schedule, so she can give her impression. But my sense is that it's improved over the past years.
Thank you again for the question, Senator. Good morning. For the Medicaid program overall, or I just want to clarify, for the Medicaid program overall, or is it just for the Medicaid P, Medicaid presumptive eligibility piece of it?
Both. Just both, because we want to know that once the well, let's start with the presumptive eligibility, and then you could give me the other piece. Okay. What's important to us is to ensure that once those documentation is submitted, that you are now seeing your denials or your payment in a timely fashion.
So for fiscal year 2022, we had about 257 accounts that received, that individuals who received Medicaid P, totaling the bill charges for that was about $3.3 million. Collected from the Medicaid P program was only $741,000. So we do have a bit of a gap between claims being paid out. However, Medicaid do make monthly payments. They make about 2 payments every month.
So we move into Medicaid now?
Yes, I moved over to Medicaid.
Okay, so let's stay right here. So let's be clear. So you shared with us that your submission is about $3.3 million.
Yes.
And this is for FY23?
2022.
Okay,
2023, I have a different number. Yes.
22, okay? Yes. So you're saying that in FY 2022, you submitted on or about $3.3 million in presumptive eligibility applications, for lack of a better word, right?
Yes.
And to date, you have only received 743,000 of that 3.3.
741,000.
741, right? So then my next question is, of that amount, how much was did not qualify? I guess what I'm trying to figure out is you would have those that didn't qualify. So what's the difference, the true difference that's owed to you?
I'll tell you now, 2023.
Take your time.
Yeah, I'm trying to find it here. I have it here. Oh, there it is.
Okay.
Yeah, okay. So so this is 2023, actually. I don't have 2022. But 2023, I'll start with 2023. Can I do 2023? Because I have that number present.
Okay, so we're going to have to start over there.
Yes, we'll start.
No problem. So give me, so what's concerning to me, though, before you give me 23, is the fact that the submission is 3.3 million. You've only received 743K.
Right.
We don't want to make any assumptions before you provide us with the eligibility, because you would get back some sort of information saying Donna is not eligible, correct?
Right.
Okay, so let's go to 23. 24, 23.
23. So 2023, what we see is a total of 249 applications filed, 180 approved, and 69 denied. The 180 represented gross charges of $1.2 million. And collected from the Medicaid P portion of the program has been, for 2023, $121,000.
CEO, Commission, what is that collaboration between the hospitals and the Department of Human Services? This is crippling. It's crippling. And I really need to get the information, and you could send it back, or if you could get it before we leave on 2022, because we need to show the correlation between what, if you don't have it on you today, that's fine, but please send it back. We need to show the correlation between why we have challenges, because in our community, we talk about our hospitals and what they're not doing, but we need to show the correlation between the challenges that we have with your ability to operate and your operating dollars that's not coming into you. So what our collaboration is.
Yes, Senator Gregory. So we do have opportunities around the HPE program, and we do need to sit with Medicaid and work through those, both in terms of our registrations, interaction with the patient and getting them enrolled, and what can be approved, and the timeliness of payment for patients that are approved for HPE. That there is opportunity for work there. In terms of my earlier response, just for clarifying the record, I was responding more to the monthly payments that we receive for all the Medicaid care we provide. And from Medicaid, we have been receiving almost every month 2 payments a month from Medicaid for our approved claims. So that money is flowing better than it had in the past. The HPE program, we do still have opportunity. So I just want to clarify your response there.
Okay,
Thanks.
so I know you don't want to throw anyone under the bus, but you have to operate too. So you have to survive, and all of us that are here need to feel comfortable when we come to our hospitals that the supplies and the services are available to us. So we got to pay to play, basically. But before I go to the next senator, let me recognize a non-committee member, Senator Diane Capehart. Thank you for being here. And committee member, Senator Samuel Carrion. Good morning, and please mark Senator Carrion as present. Senator Joseph, Senator Fonseca, you're recognized for your 4 minutes.
Yes, thank you, and pleasant good morning to all of the distinguished panel of testifiers here today. Blessings to the community, everyone listening. I must first big up the whole Schneider Regional Medical Center staff and the leadership team. I've been a senator now about 6-7 months or so, but I was getting nurse. They were stopping me in the parking lot, in the post office line and thing, I have not received one single nurse salary complaint since the big raise was approved. So congratulations to the governor's chief negotiator, Ms. Josh Springett. Excellent job. So now the average nurse salary now, your testimony is about $116,792 a year. So that's about $10,000 a month. Great. And all of them deserve it. Nurses, thank you. We want to keep you in our community. Nursing profession is very important. So now I want to specifically talk to the nurse in Azra Harris Court. I ain't going to say the building number, but you were telling me that you're going to move to Florida because you want to get a home. So we need you to get qualified for the VI Slice program because you would be a perfect person to now qualify. So don't spend that big salary increase with no bad ride and 800 cotton sheet and thing, So Virgin Islands, let's concentrate on obtaining a home. This is very, very, very important. Okay, so now I wanted to get into some numbers here, particularly on page, you mentioned that on page 1 of your testimony, you mentioned that you can treat 75 of the 135 dialysis patients on St. Thomas. And now I want to mention this again because people in the community listen to this testimony. Schneider Regional Center is telling us that they can treat 75 of the 135 dialysis patients on St. Thomas. That means that there are 60 patients that cannot be treated by the hospital. There are 60 kidney dialysis patients. So I want to remind the government officials that are involved with the negotiating. The legislature recently appropriated $700,000 to continue to pay for these nurses. If this negotiation is not completed, it's an emergency because the hospital is here telling us they cannot treat 44% of the kidney dialysis patients on St. Thomas. This is very, very, very important. So let's get the purchase done. We cannot afford to lose any lives, to have our locals be uprooted and be sent off island for dialysis patient. Your uncompensated care is $27.7 million. And this is an area that we have to improve upon, but it involves the payer mix. Tina Commission, we've discussed this, where there's some particular changes that we want to be done for the Virgin Islands health insurance, the group health insurance. It has to be where people like us, government employees, when we go to the hospital, our insurance needs to be no copay. So that would encourage us to go to the hospital and get treated. Because if I can go to another clinic and I have nothing to pay, I'm going to be inclined to go to that other clinic. Let's get the VI government insurance fixed so that we can go to the hospital and have no copay.
30 seconds.
It's going to help with that mix. Borders, I want to quickly discuss borders. I have one quick question. How many borders do you have? I noticed that you didn't put it in your testimony. About 10 or 13?
Yes, Senator Fonseca, we have 10 boarders presently at the hospital.
Okay, good. You see, borders are those elderly folks who cannot provide for their self-care. It's gotten to the stage where they need 24-hour care and they're now in the hospital and they're the ones taking up the emergency room beds. So in defense of the hospital, sometimes you go to the hospital. Madam Chair, can I be allowed to finish, Madam Chair? Sometimes you go to the hospital and you have to wait in the emergency room is because of the borders. So Human Services, like I have you on notice, we need to build more senior elderly beds for our seniors because the hospital is not the appropriate environment for the borders. It ends up being a huge bill. Now let's go quickly to your income. Your projected revenues went up from $59.5 million to $72.3 million. That's a $12.8 million increase in revenues. So that's commendable. Explain to me how come your revenues have gone up $12.8 million?
Sure, and thank you for recognizing the strong work being done at Schneider Regional by our clinical teams and our revenue cycle teams. Our planned expansion of services and our planned improvements in billing and collecting are going to get us to that $72.3 million number in FY24. And we're just very, very thankful to our teams for all of the work that they are doing to push us to get us there, because when we collect that revenue, we can turn that back into recognizing our staff, and taking care of patients.
Okay, good. I think I give you a B2. You're doing good. I can see the improvement. Thank you very much, Madam Chair, for the time.
Thank you, Senator.
Thank you, Senator Fonseca. You have me looking to the right. You look like you want to move to the right. I got to watch you. I always look for you on the left. All right. So you have the revenue increases. We are seeing the clear increase in your revenues, but your expense have increased significantly as well. And I'm going to ask through the chair that you submit to us why we're seeing that significant increase in your expenses. You did make reference to the fact that you've made some increases to to the nurses, you're looking for new doctors, etc. So we need to see what that look like.
Okay, yes,
Because
Senator.
your increases are also showing that you are projecting a $10 million, give or take, increase for FY '23, and of course carrying out to '24. Okay, so we need to see what that represents. And then you talked about the increases for nurses, I believe doctors, but I didn't hear anything about rank and file like CNAs and those types of employees. So how are we ensuring that those types of employees who really do, the deep dive work outside of the medical work are also are also being appropriately compensated?
Yes. Thank you for the question, Senator Fred Gregory. It takes all of us at Schneider Regional to provide the kind of care that we do. Our CNAs, our support staff, our technical staff, everyone is really, really integral to our end product, which is taking care of patients. And so we belong, almost all of our employees belong to unions. We have 9 unions at our organization, and we belong, for example, to SIU, where a lot of our rank and file members are. And when that government-wide negotiation comes up, we participate very actively there, and we actually lobby and negotiate for increases to our employee salaries at the table because we know how valuable they are and how value-added they are, and we need them
So
to be
your
part of our
SIU,
team.
so your CNAs fall under the SIU?
Our CNAs, I believe, are under SIU. I will defer to Dr. Vashi. Yes?
Yes,
And
yes,
I think
Senator.
they,
Put your name on the record when you respond for the
Yes. Thank you for the
reporter.
question. Delphine Olavachi, Chief Nursing Officer. And yes, the unit secretaries and the certified nursing assistants are members of SIU.
And when was the last time they saw a salary increase?
I'm not sure.
Senator Fred Gregory, we renegotiated SIU, I think about 3 years ago, and I think that their CBA is, if not still active, just very recently expired. And so they will be coming up in the series of CBAs that get called as they get to their expiration date. But I believe offhand that CBA is still under the
But
active
when
period.
was
I
the
can
last
verify.
time they got a salary increase? Where's your HR?
Our HR rep is here. Our HR manager, Ms. Lisa Williams-Norman, can come in and respond
Absolutely,
to those.
and that's
Sure.
an important part of our discussion. So,
Thank you. Williams-Norman?
Sergeant at Arms, could you please escort the HR manager into the well? Good morning.
Good morning.
Please put your name and title on the record.
Good morning. My name is Lisa Williams-Norman.
You have to
I'm the
speak
HR
into the mic.
manager. Good to see you too.
Speak into the mic.
My name is Lisa Williams-Norman. I'm the HR manager at Schneider Regional Medical Center. Thank you for having me.
Very well. So based on the question that I just asked, could you provide a response as it relates to the SIU and particularly the employees that fall under that particular contract? When was the last time they saw a salary increase?
The last salary increase that they saw, I believe, was in 2018. 2018
Yeah.
for SIU.
And is it because the SIU contract is expired since 2018? What is the pay plan for the SIU? How many years did it go out? Up to what year?
I would have to get back to you on that.
Yeah, that's important because, one of the things that we do is we continue to talk about our nurses and our doctors, and I appreciate that because my daughter is a doctor. However, we also have to remember the employees who do the lower level work that but for them, we cannot survive. So 2018, they've been listening to our hearings, I'm certain, and I don't know any CNAs that have made any contact with me. I'm just asking because I understand, I know the type of employee my mother was. So I understand the importance of taking care of those types of employees.
I absolutely agree with you.
Yes, so if we have employees who have not received salary increases since 2018, I know that throughout our government, and this one is for Senator DeGraff, the Savanero. If we have employees, I know that the SIU has been negotiated since then. So why would the hospital not pay those employees since 2018? We need to get a response to that prior to us leaving here today.
Senator,
Please.
no, Senator Fred Gregory, we are on track with paying our employees according to the negotiated CBA that's in effect. So our employees are being compensated according to the current plan.
Okay, so we're gonna have to make a call to our OCB.
It expires, it's still current. It expires this September, is my understanding, Senator Fred Gregory. It was negotiated again in 2018. We belong to the master CBA for the whole government. We negotiate along with them, and my understanding is that it's coming up for renegotiation very soon.
Okay, so is
and
it that?
we do want to push for those wages.
So is it that that particular contract did not have room for salary increases from 2018? That's what we're saying?
For step increases. The contract is built with step increases. and
Correct.
Okay. Some of our employees have been moved to step year to year. I don't know that every single employee on the plan has been moved to step year to year, but we have done increases according to the plan.
Why wouldn't that be receive salary increase? We don't do I forget what you call it. We don't do merit-based increases in the territory. So why? We need clear
Historically-
clarification on ensuring that once there's a CBA in place, that those employees are receiving their salary increases. We've spent a lot of time in this institution, and we've given a lot to our nurses and our doctors, and we have not really focused on those employees. We need to clearly understand what's the status of their pay and whether or not their pay is up to date, and we need to have that information prior to us leaving our meeting today. That is important to us. Senator DeGraff, point of information. You're recognized.
Thank you, Madam Chair. Thank you twice, Madam Chair. CEO, to your HR person, that's what I was looking at the numbers in terms of personal and fringe. And going forward, I know some of those contracts supposed, like you say, end in September or so. That's what I was wondering, Larry, about the numbers with the 4% increase in personal and fringe. Mm-hmm. Would it really be covering all the employees, not just the nurses, but does it cover all those other employees that make the hospital the great thing place it is to work? That's my main question I was asking, and with now your HR person is here, not to supersede you, but does that 4% cover the acts going forward for everyone in the 24 budget?
So in looking at the budget for our staffing, we have to project out for what we have, the negotiations that we have upcoming. So yes, it would be including the negotiations that are upcoming.
Okay, good. I don't want to make sure everybody was covered. So thank you for that, Madam Chair. And your follow-up would be pertinent for us. When we get that information, I think we'll know a little better too.
Yeah, I have to go to the next senator, but I am not comfortable with the responses that I have received with regards to those employees that fall under the SIU contract. Do we have any other non-medical type employee contracts? Ms. Aja?
So the contracts that we have would be SIU, as well as security and transportation.
What's
Those
the name
would
of
be
the
the two.
union? That's the name of it?
That's IAMW.
And have they received their salary increases? And when does their contract expire?
Their contract is expired and it's up for negotiation.
How long has it expired?
I would have to verify that number.
Please provide that information before we leave, because
Will do.
all of the ask has always been for higher level type employees, not the rank and file. And we got to take care of our rank and file. But for rank and file, nothing don't get done.
Senator Fred Gregory, we moved, if I may, just for the record, we moved security officers in IAMAW to step this year, and we have done other step increases this year for our unionized members. SIU is the largest block, and they have not moved, but they're still current within their CBA. We expect those negotiations to come this fiscal year.
Okay, so, what we would prefer to see in our committee meetings is that's why you have supporting staff, supporting team members. We have to be able to answer the questions that's related to what you do every day on the ground. And I have to commend Miss Kenisha Angle. You come consistently prepared. Consistently. Okay? We need to get information with regards to SIU. Whether or not those employees have been paid up to date on their contract. The contract is expiring this year, so we need to have that information before we leave. So we'll give you an opportunity to find the information and get back to us, all right?
Thank you.
Thank you so much. All right, Senator Joseph, you're recognized for your 4 minutes.
Thank you kindly, Madam Chair. A pleasant good day to everyone, especially the hardworking men and women who are part of the Schneider Regional Medical Centers. I just want to really follow up on a question regarding our rank and file individuals pertaining to premium pay. That's a question that's normally asked by our majority leader, but I don't see him present. And I have received calls, all of us do, relative to the status of paying those individuals who worked during the COVID and what they're entitled to as far as premium pay. Where are we with that?
Yes, Senator Joseph, thank you so much for the question. And we want to be sure that all of our employees do receive that premium pay because, as you note, they worked tirelessly through COVID, and we feel that all of them deserve to receive that pay. We had, according to how it was rolled out, some of our employees were included in the first pass, but not all. And so we continue to lobby for all to be included. We've recently submitted the balance of those employees who we understand are now approved to be recipients of that pay.
Okay,
so
how many-
hopefully everybody will get it.
How many persons do you have who are in that category that are outstanding for premium pay?
I think only about 50% were initially included.
Number?
I don't have the number directly in front of me, but we can certainly get that
yes,
for you. 'Cause
get
we
me
just
the
submitted
exact
balance.
number of persons who are in that category to receive the premium pay and the total cost that is expected to be paid out to, because that is our commitment based on using that ARPA funding and the like to pay our employees. Many of us have already, I know I received my premium pay from working in human services. Okay, so they are also entitled for that premium pay, and they were at the front line of the COVID, helping our citizenry, as well as, sacrificing for themselves and their family and placing themselves in danger. So they definitely need it. I know the nurses have received theirs, correct?
Some.
Some as well?
Yeah. Some are on the list that we just submitted for the second batch.
Okay, when did you submit that?
We just were requested for it this past month, and we submitted it timely. So we are hoping that everybody will be included in the next batch of payments that are released.
Okay, so I will expect that to see that information sent to the chair. Now, let's get into some of your other items, especially going far as your uncompensated care. Now, I'm sure you recall that the Lieutenant Governor mentioned earlier this year, maybe it was in March or May, about a company that's coming in, that has come in to provide individual medical insurance. How are you working with that company?
Thank you, Senator Joseph. So we're very glad to know that there's new insurance products in the territory. I have not directly worked with them, but I have gotten feedback from other persons who are looking for insurance coverage who have evaluated the product. And some have indicated to me that it still doesn't
30
meet
seconds.
their needs in terms of the cost of paying for it and then what it covers. So I hope that we will continue to work to add more insurance products to to be available for persons in the territory.
Okay. And you also mentioned that you have outstanding account receivables from different agencies. believe that was stated on page 8 of your testimony. You mentioned you have outstanding receivables from the Bureau of Corrections, Department of Labor, Human Services, and the Department of Education. Kindly indicate for us the total amount that you have outstanding in receivables for those.
Time.
Madam Chair?
Yes, Senator Joseph. So our total outstanding receivables from the GVI entities exceeds $2 million. We are happy to submit through the chair the breakdown of exactly how much is owed by each agency, but we have started to diligently work with those agency heads, request meetings, send their statements, and follow up with them about paying us.
Okay, but how long has these receivables been outstanding?
These receivables tie back to patient care that's been delivered for many years.
Many
We
years
track-
aged?
back to 2013 and beyond. We track and record only the most recent 5 years for our financial statements, but we, according to our records, maintain the amount of care we have provided over the years for which we've received no payment.
this $2 million only reflects 5 years?
Yes, Senator
So if you
Joseph.
had to give the overall, would you be able to let us know what the overall is? Because this is money that they probably have gotten appropriated and they just may not have sent it and allotted and they may have not transferred to you. Now let's look, Madam Chair, I am going to wrap up with this last question because I do not want to abuse my time. Kindly indicate for us the amounts that you owe now to GRS, GESC, and WAPA.
Yes, Senator Joseph.
And or you could send it through the chair, but
I would
we
be
want
happy to
to
send it through the chair. But
we would like to hear it.
We acknowledge our obligations to these very important agencies, and we are working to catch up on our payments. So GERS, I will defer to Ms. Engel to give you the exact numbers as of the last pay
don't
period.
you're pulling up a whole bunch of my time, but the chair is very lenient with me because we need to get these numbers.
All right, thank you for the question, Senator. For GERS, obligation owed as of June 2023 is $1.7 million.
For which one? GRS?
GRS.
1.7 mil, and this is the employer contribution or the employee?
For GERS, it's both the employee and the employer's
What a thing.
contribution.
Now, how much, you're going to break that down for us because you're supposed to be putting in the employee on, you're taking it out of their checks.
Right, and we've gotten word from GERS, which is what we were doing previously. We were sending just the employee's contribution. We've gotten word from GERS that they will not accept it that way. They will not post it to the accounts that way, and that we are required to send it as a batch, both employee and employer portion.
That's a discussion we'll have with them because that's a discussion. Anyhow, GESC, kindly indicate for us.
GESC obligation owed for it's $5.6 million for the employer's portion only,
5.6.
and zero for the employee's portion.
Employees?
Zero for the employee's portion.
Okay. That's just for the employee. And now WAPA.
Total owed for WAPA as of June 2023 is $2.7 million.
2.7 million June. Okay. Thank you so much. We will need the breakdown for GERS portion, okay, as far as how much the employee, because one of the things that we learned is that, and this is from WAPA, is that some of the employees, their deductibles to pay for their personal loans and their mortgages were not being sent to GERS. You are giving GERS, sending them those deductibles.
Just to put on the record, yes, for GRS loans contribution, that is all paid and zero is owed to GRS for that portion.
Okay, wonderful. Thank you kindly, Ms. Angle, for putting that on the record. Thank you, Madam Chair, for your leeway.
Thank you, Senator Joseph. Please be reminded when I come to your committee, you give me the same courtesies. So you have a $10 million outstanding bill, basically to government. Was it to government agencies between WAPA, GRS, and what was the other one? GESC?
Yes, Senator Fredericksted.
So that's your help payment? What's GESC?
Health insurance premiums, Senator.
So you are not paying your health insurance premiums?
We're behind by several months in the health insurance premium. We recently made a sizable catch-up, and we are on track to continue to reduce that liability.
So let's understand. This debt goes back. These debts go back how far? Well, how far does your GRS debt go?
I'll defer to Ms. Engel. This year, though.
Thank you again for the question, Senator. GRS is about 4 pay periods behind.
No.
GERS?
Oh, so it's not
this
years.
fiscal year.
It's within this year.
For GERS, yes,
4
it's
pay
this
periods.
fiscal year.
Okay.
WAPA is from 2022, and the Cigna is also from 2022. Think about August of 2022.
Okay. So this is my concern. So you have a $10 million debt for the most part. You shared with us earlier that you're seeing a significant increase in your collections. So you give yourself a B for your collections, but you ain't paying your outstanding debt. Was the debt higher? I mean, how much money did you give of the to GSC for the year? That dates back to the 2022 year.
At one point, that balance, Senator Fred Gregory, exceeded $7 million, and we have worked to pay that down. So we're
Are you current on the
trying
current
to move
year?
in the right direction.
Are you current WAPA? Are you current with your current WAPA payments? Are you current with your current GSC payments?
We make payments to those entities every month. The payment that we make to WAPA does not fully cover the bill. So we make a payment of $275,000 each month to WAPA. And the
Of
WAPA
what?
bill exceeds, it's about $325,000, rough estimate, per month. So that difference has accumulated over time.
So, $10 million. So you make a hard payment to WAPA every month,
Yes,
regardless of
Senator
what the
Fred
bill is.
Yes.
So if your bill is 300,000, you still pay what?
275.
275. So you pay 275, and your health insurance premiums. What is that amount that's outstanding for this fiscal year?
I don't have it broken out, but yeah, probably around 4 million. Yeah. So for Cigna, I probably say I estimate about from the 5.6, I'd probably say 4 million of that probably from fiscal year 2023, because we roughly pay let's say 350 biweekly, so about 700,000 for the month just for the Cigna for both employee and employers.
So you have not paid about $4 million for your health insurance premiums. What is that for you? Because I know that a lot of agencies look different. What's your match for your employees? 60-40, 80-20, what is it?
What's the split for? I think we pay 2/3 and they pay 1/3, but I don't have the exact split. Do you have the split?
But somebody gotta have that. That's a regular payment.
I know the numbers. So
We know the numbers, but
What is it?
so in the employees portion of the health insurance group, we pay about $94,000 for the employees.
No. I'm saying, for instance, in some agencies, some of the agencies pay 60%. And when I say agencies, I think central government, we've kind of changed that. We're all over the place with that. Well, 70-30 or something right now. We've seen 80-20. We've seen where agencies pay the employee portion is only 15%. Some agencies like for example, Water and Power Authority, I believe single is 100%. What is your percentage? Does it vary? What is it? And a lot of it is outlined in the union contracts. So that's another HR question that is important, because you have to put that in the system per employee, so when it hits the check, you know what that looks like.
Senator Fred Gregory, we weren't aware that there were different percentages splits for different
So
agencies
what's yours?
in government.
What's
My
yours,
understanding
though?
of ours is that we pay 2/3 as the organization and the employee pays 1/3, but I'd have to defer to HR to give us confirmation of that split.
What's your benefit package? When you hire employees, I mean, it's clear you gotta know what that is. HR.
We follow the government plan for Cigna.
You got
terms
to
of the-
speak into the mic, please.
We do follow the government plan for Cigna as far as what has been mapped out from Division of Personnel. I'd have to get you the exact percentage.
Listen, the hospital have their own financials. Who makes your payroll payments? Does the Department of Finance make your payroll payments? No. You're responsible for your payroll payments. So that's a question that should be easily answered. 60/40, 80/20, what is it? That's important. That's the only way you're going to understand what challenges you have as it relates to your financials. I'll give you an example. Virgin's Port Authority, I was a CFO there, so I could tell you the employees paid only 15%. There was an issue. I think now we had to dial it back. Now I think it's back to 100%. So you have to know what a number is, because if you have a $5.6 million outstanding amount, and of that amount, $4 million is associated with this fiscal year, you're contributing to our challenges that we have with the rising increase of our healthcare costs in the territory. Healthcare costs meaning what comes out of my check, my colleague's check, all of these other government employees. $4 million is not a little bit of money to bat your eye at. So we need a clear understanding of that, CEO. Please, we have to have that. You're asking for additional funding, but we need to be able to justify why. And we have to have information in order to understand why. And if we can't get this simple information on that, because when you calculate it, you don't calculate it 2/3 in your payroll. Right, you do it as a percentage. So what is it? All right, we need that information, please. We have to understand that y'all are doing your due diligence in that area, so we could be clear on what are those benefits. Those are associated fringe benefits. Okay, the committee stands in recess for 2 minutes. The committee is back on the record. I believe that the HR, she probably went to the ladies' room. no problem. We'll wait for her to come back. So it seems as if your number is about 6634. Health insurance, 34 employees, 66 the hospital.
So we pulled the actual number, Senator Fred Gregory, during the recess. Tina Cummins-Young, CEO for Schneider Regional. For a single employee, their deduction is $131, and the employer contribution is $359, so it's about a 30-70 split. And on the family side, it's $232 approximately comes out the employee check, and the organization makes a payment of $634 approximately.
So with your
employee.
increases, and I have to go to the next senator, but with your increases that you're seeing in your revenues, we got to do better in paying the health insurance associated costs.
Yes, Senator Fred Gregory.
Please. I mean, I guess you've established what your priorities are. And I guess one of the ways to get the attention of the GVI is to, and when I say GVI, I mean GVI proper, the executive branch leadership, is to not pay these expenses, but these expenses gotta get paid. I mean, we continue to fuss about the challenges that we have with WAPA and the like, but we gotta figure out how to balance this. So I'm gonna go to the next senator, Senator Novalee Francis Jr. You're recognized for your 4 minutes.
Thank you very much, Madam Chair, and morning to everyone, and thank you for your testimony from the Royal Leicester Schneider Hospital. Obviously, we're very challenged by being able to adequately vet this budget because, of course, we don't have the post-audit information, which is very critical to it. But I wanted to ask you, Madam CEO, what is your total revenue so far to date for FY23?
I will defer to the exact number to date to Ms. Kenesha Engel. We are on track, though, to collect a total of $57 million this fiscal year. Ms. Engel?
Actual collection.
Actual collection.
Let's see. Hold on a second. I have it in the visual. Jesus. It's right here.
And time is running.
I'm so sorry. Thank you for the question, Senator. As of June of 2023, our total collections, total intake has been $67.5 million.
That's inclusive of the appropriation, Senator Francis.
Very well. And any other funding that you have received, whether it's federal funding or local funding that you have received, philanthropy or any other means?
Yes, Senator Francis, our foundation has been very active. We've received probably a total of almost $400,000 in very generous donations from the community for our foundation. We received one grant last year for improving technology, specifically telemedicine, and creating connections to other providers. We have not expended those funds yet, and that's the total of our federal and other receipts outside of patient collections and the GVI allotment. And
very well.
funds.
Can you provide to the chair a listing of all those fundings and the amount, as well as the original amount, as well as the balances? And the $400,000, is that cash assets or in kind?
Those were cash donations towards the purchase of specific equipment for Schneider Regional, Senator Francis.
Very well. Thank you very much for that. And real quickly, in regards to, I know that there were some challenges earlier this year in respect to being able to procure basic supplies for the medical staff. Have you been able to stabilize that situation?
Yes, Senator Francis, I think we've been able to stabilize that situation considerably. We have much better supply chain management in place right now. It is still a challenge in terms of managing our vendor payments, as was discussed earlier, our AP, our obligations to the GVI, which we take very seriously, and we don't intentionally delay those, but we have very, very important competing priorities at times. Earlier this fiscal year, we were spending $260,000 to one nursing staffing agency alone to cover the contract nursing staffing that we needed. So there were a lot of expenses demands on the organization.
You're running out of my time, and I have a lot of questions. You're running out. I'm sorry.
Apologize.
You're running out of my time. In respect to the $5.3 million in borders, what is the level of conversation engagement with DHS, Department of Human Services, in regards to recouping, some of this unfunded mandate that's levied against the hospital?
Yes,
30
Senator Francis.
seconds.
So myself and Doug Cook, CEO of JFL, meet with the commissioner every week. We meet with the commissioner of Human Services, the commissioner of Health, and other stakeholders to try to explore placement options for the borders that are at Schneider Regional and JFL. To date, we have not been successful, or they have not been successful in securing additional funding to open additional bed space. So we meet regularly, but we haven't had many concrete solutions come from those efforts.
Very well. My question was really in terms of the funding and being able to address that. I'm aware of the other negotiable item, but I'll move on from there real quickly in the sense of time. Madam Chair, I have two other points if you'll allow it, please.
Absolutely, Mr. President.
Thank you. Thank you very much. In regards to KPIs, Madam CEO, can you submit have you submitted the KPIs in that information packet that you sent through yesterday?
I believe that some of our performance measures were included, Senator Francis, but we will look back at that package and we can supplement it with additional KPIs as were discussed that we track in our revenue cycle. And to the transfer of funding, I'm sorry I didn't completely answer your last question. In those meetings, there's no discussion or there has not been any transfer of funds to the hospital from Human Services or Health or any other entity to pay for the care we are providing to the borders.
Do you have any pending, thank you for that. Do you have any pending litigation? Of course, I'm sure that there's some litigation, but any judgment against the Schneider Hospital at this time that need to be made a part of this discussion in regards to consideration of your budget?
Senator Francis, none to put on record at this time. We did have one outstanding obligation that we have since met since the last time we reported at this body. We do have some outstanding cases that are in active stages of litigation on the MedMal side.
And my final question on this is in regards to a nephrologist on St. John. What is being done to support and assist our dialysis patient on the island of St. John? Can you put that on the chair's time, please?
Yes, Senator Francis. So we have a really great hemodialysis team under the leadership of Ms. Vernesta Hodge and Ms. Monique Casey. And we have nephrologist support right now for our program, but we're really looking for a highly skilled nephrologist to join our team as our permanent medical director for our hemodialysis program. And the candidate that we're looking for is going to help us introduce new modalities such as home dialysis and peritoneal dialysis, which will allow patients to receive their dialysis treatments from the comfort of their own home and will allow us to provide that option to residents of St. John so they can do their own dialysis treatments right on St. John without having to come to St. Thomas 3 times a week for that care.
Senator Francis Jr., does that satisfy your question?
No, I kind of heard what's in the plan but right now, what is currently being done to minimize the travels of these patients to come over to St. Thomas? Is there anything being done to address at least being able to dialyze them on St. John?
Yes, Senator Francis. I believe we only have one patient currently in our census from St. John, and we do plan to add the nephrologist this fall. So We hope that that will be an option in the very near future. The goal is, I think, within the next 6 to 8 months to be able to offer that modality, which will greatly assist the one patient and future patients that we will get from St. John.
Thank you for your response, and thank you, Senator Francis Jr. So we have to be fair, right? We talked about your $10 million outstanding amounts that's owed to various entities within the GVI. But there's also expenses that's owed by the GVI. Well, not expenses, but obligations, invoices, etc. I believe that my colleague, I haven't figured out how to refer to you yet, Senator J. But we will figure that out. Yeah, we haven't figured that out. Did touch on those outstanding amounts, and you said that, did you provide us with a breakdown of what, I think you made mention about the Bureau of Corrections, the Department of Labor, whom else?
The Workman's Comp Program, the Bureau of Corrections, the Department of Human Services, the Department of Health. I think are the largest agencies,
and those
largest
outstanding. Those outstanding amounts stem back how far, and what are those amounts? So let's start with the Bureau of Corrections. I think it totals some $2 million.
I will defer to Ms. Engel, who has the list and has the dates associated with the amounts outstanding.
Good morning, Kenesha Angle, Director of Finance. I want to apologize, I don't have the exact dates for all of them, but according to SRMC records, Bureau of Corrections, we have a balance of $866,000. Department of Health, a total of $8,317. Department of Human Services, $9,309. Department of Labor, $1.2 million.
And you didn't give us education.
Corrections, 700.
Oh, I don't have education.
You don't have
I missed
education.
education, my apologies. I do know for Department of Labor, the claims go back to 2013.
Okay, so we need to get the information from you around the outstanding amounts, clearly, and how far these date back to, and what's those current amounts from 2022 to 2023. And then you could give us a lump sum for the others, okay? So BOC, and I think we asked this question a few years ago. I think I asked it, but I am having a little hard time remembering. So those individuals who come to the hospital who are inmates, if you will, do they qualify for presumptive eligibility?
I think they can. I think we've registered some.
We registered them as BOC.
We register them, Senator Fred Gregory, we register them under BOC. I think that we have explored that, and I think that they are eligible, but I will verify that and get that answer back to you.
Yeah, because if they have a 866 amount, we have to make sure that we circle the wagon. We discussed this before.
Yeah.
This was discussed, I believe, last year, the year before, with regards to how we can make sure that you are getting all that you should get when the inmates, in particular, come from the Bureau of Corrections to the hospital. So if that's not something that y'all have circled the wagon on, you need to make sure that we understand what's happening there. Because 866 is almost $1 million.
Mm-hmm.
Okay? Senator Capehart, you're recognized for your 4 minutes.
Good morning, colleagues. Good morning to the people of the Virgin Islands. Good morning, Ms. Commission CEO and your team. On page 4 of your testimony, I'm excited to see you're onboarding a psychiatrist, a cardiologist, dermatology, gastro. I'm excited because individuals from island of St. Croix who may not have some of these services can then travel to St. Thomas. But my question is, who completes the credentialing of the doctors to ensure that they are qualified to perform the procedures they are hired for?
Thank you for the question, Senator Capehart. Good morning. We have a very robust credentialing process in place at Schneider Regional. We have a credentialing committee that reports up to our medical staff, and then those credentials and files are then forwarded to the district board and then to the territorial board for approval. So there's a lot of oversight over the credentialing of our physicians. We keep physician scorecards where we review their performance and ensure that they have the skills and the educational requirements and the board certifications that are needed to care for our residents. And to your earlier comment, we're happy to provide services to the people of St. Croix as well for anything that's not available on St. Croix. We'd love to keep it within the territory. I would defer on your time, if you'd like, to Dr. Rosenberg to expound, if you'd like, on the medical specialists that we're adding.
If I get to ask my other questions, then I'll go back to the doctor. Page 5, where you have in the post-audit report, why is the Medicaid bill and the environmental impact tax assessed together? Why are they added together? Can you tell me how they correlate? So I would want to know, what is the Medicaid bill and what is your environmental impact tax? Because you have 200,000 with the two of them combined. Can you explain that, please?
Senator Capehart, I'd like to do a little research on that line item and get back to you, but my sense is that that's a special assessment, that the hospital is a beneficiary of that assessment, and we get that annually. But I will do the research and submit it through the chair if that's acceptable.
So when you can't tell me the Medicaid bill, is that the Medicaid bill for presumptive eligibility, uncompensated care? So at this moment you're saying that you don't know what that is.
It wouldn't refer directly to our Medicaid billing. For example, our Medicaid billing would be reflected in the first line item under patient revenue. Our receipts from Medicaid would be included up there. So this is some special assessment and transfer to the hospital that we get annually that I would have to research the origin of for you.
Yes, I guess you can provide that information through the chair. Back to the post-audit report. You have a cost here, or you don't even have a cost. You have an item here. It's Paragon Surgical Center. It says emergency use of cleaning equipment. You have no payment agreement.
1 minute.
What is the cost? Emergency use of cleaning equipment, because you have to clean equipments every day. You have a month-to-month payment agreement. Why don't you have a yearly agreement? I think something as important as this, you should have secured a 6-month agreement,
30
1 year
seconds.
agreement. Why no payment agreement?
Yes, Senator Capehart, thank you for that question. That actually refers to just a backup that we have in place. We have our own sterilization equipment and process within our hospital. But in the event one of our sterilizers or washers go down and we need to use one that's available on island, that is our agreement with one of the ASCs on island who has sterilization equipment for backup use in an emergency. So there is an agreement to cover it, but we don't routinely use it.
Time.
So even if you have to use it on emergency purposes, you're saying that you don't have an agreement or you have an agreement?
We have an agreement. Should we need to lean on the ASC, we have an agreement in place to govern how that would happen. And then if funds need to flow, there's a contract in place for that to happen, but it's not routine. That would really be an emergency because we have redundancy within our organization for the cleaning and sterilization of our equipment and our surgical tools.
Okay, Madam Chair, if I may.
Of course, Senator.
Thank you. If we are not able, so we have a debt with our uncompensated care, right? Can you say that you can probably go to a collection agency to recoup that fraction of that amount owed? Is that a possibility?
I think we can use our internal teams and our business office extenders to more aggressively pursue that self-pay collectible amount. And we continue to pursue like our denials management and our collection efforts. But I don't know that there is an agency necessarily that would buy the debt from us and then collect on our behalf, if that's the question.
So your internal process probably needs to be ramped up then, because that would help you tremendously with your uncompensated care, trying to recoup the losses of individuals who weren't able to pay on that day, because you just mentioned it might be too much for a collection agency to be able to recoup that. Thank you, Madam Chair, for your leniency.
So, Senator, that's the amount that remains after the diligent efforts to collect. And that's more reflective of our environment, our population, person's ability to pay. So it's not a matter of not going after those collections. It's that even with pursuing those collections, we are not able to get the cash in the door because persons are unable to pay.
All right, thank you, Senator Kepa. Does that satisfy your question?
For now, yes, Senator, thank you.
All right. So just know that the information, this is for my colleagues in particular and for Schneider Regional, the information that we have on page 5 of the post-audit report, we pull that down from your website. So your financials that's here, we pull that down from your website. So the Medicaid bill and the environmental impact tax, I suspect that we have legislation that a portion of the environmental tax goes to the hospital. I don't know what the percentage is. And the Medicaid bill, if you basically your financials represent $200,000 for 2022 over the years, which like I said, I urge you to go back and look at your financials because you talk about increase in revenues. However, I see that you have an issue with cash. Cash is your challenge. So while you're talking about revenue improvement on your revenues, your cash remains an issue. Same thing with the GVA.
Yeah.
So you have to figure out how to address your cash management.
Yeah.
So that brings me to this question. What is the status? I know that Ms. Angle is your Director of Finance. What's the status of a Chief Financial Officer? This is an organization that needs financial leadership. I'm certain that Ms. Angle is doing her best. Mm-hmm. And how long has that position been vacant? That's not a position to take lightly. That is the backbone, literally, of your operations and your ability to manage your financials, to make the best decisions. And some of what we're seeing here, as far as what's outstanding, what's not being paid for this fiscal year, clearly is of concern. So what's the status of your CFO?
Yes, Senator Fred Gregory. Our CFO position remains open and vacant. We are actively following up and reviewing candidates for interviews for the CFO position. We want to commend and thank Ms. Kenesha Angle for all the work that she's doing at the helm of our finance team. We did have 2 candidates that were in the pipeline for CFO, one that got all the way to the last stage of potentially onboarding with our team, and that ended up not working out. So we had to go back to the drawing board, which we are now reviewing new candidates and hope to, within the next quarter, identify a candidate to come on board for our CFO position.
Yeah, you need to really get a CFO on board.
Agreed.
Please. It's critical to your operations. Mr. Smalls, I believe Senator Mr. Savanero alluded to it earlier about this, or I don't know if it was Ms. Angle, where we talked about projections with regards to your capital outlay. I think it was some 1.4 million, give or take. 1.8 million in capital outlay. And I know that you are in the rebuild stages. Correct, Mr. Smalls?
Good afternoon, Senator. Darrell Smalls, Executive Director, Territorial Hospital Redevelopment Team. Yes, we are.
You're in the rebuilding stages, and you have 1.8, and of course, you still have to make sure that there are things that you have to spend capital outlay money. It's called sunk costs. I get it. You spend it, then when you're doing a rebuild, you may have to tear it down, but the hospital have to operate as we speak, right? So this $1.8 million, what do you anticipate utilizing those funds for in FY 2024?
Good afternoon, Senator. Unfortunately, I'm not the VP of Facilities, so I'm unable to answer that question.
Good. So we need to have the Sergeant at Arms. Do we have the VP of Facilities here with us?
Yes, Senator Fred Gregory.
Please come forward. Sergeant at Arms, please bring the VP of Facilities up so we could have this question answered. Please put your name and title on the record.
Peter John Baptiste, Vice President of Facilities. We have several projects for the $1.8 million. We have completed certain projects like roof repairs, BHU sealing, fire suppression system for the Expanse project, AC installations, several projects like the doctor's locker room, medical gas repair. We had to do some repairs on the BHU ligature handles for CMS. We also had medical records move, medical records renovations, fourth floor uplift, radiology, UPS room renovations, and the installation of the old X-ray system and installation of the old X-ray system.
Okay, so I'm certain that is much more than 1.8 million. Correct? Or no?
It's about it's about 1.8 million.
Okay, so that's based on what you just laid out, roof repairs, fire suppression, HVAC, etc., falls within on about $1.8 million, give or take.
About that, yes.
Okay, and when do you anticipate getting these projects
Some of the projects are completed already. Some of them are in process.
Okay, then I didn't ask you what completed, I asked you what you have that's within this 1.8.
Some of them are capital purchases too. I refer to Ms. Angle to see which ones are exactly in the capital purchase stages.
Okay, so
Senator Fred Gregory, we have a capital list that totals about $10 million. We've submitted that, and it itemizes both the facilities, the capital equipment that's needed, and the facilities improvements that are needed are included in that $10 million amount. And Ms. Engel has the list in front of her, and she can elaborate further.
Okay, so before you go to that, we are in the rebuild stages, correct, Mr. Smalls?
That is correct.
Please recognize the mic of Mr. Smalls, my far right.
Yes, Senator, yes, we are commencing with the process for reconstructing the Schneider Hospital.
So we can't have a $10 million facility conversation that is outside of our general fund money. We just have to figure out how to manage this. So then my question then is, what is the conversation that's occurring between, give me that title again, Mr. Smalls.
Keep it simple, THRT.
What is the conversation between THRT and the VP of Facilities?
Senator, one of the challenges that we are slowly overcoming, initially the FEMA plan was going to be a renovation project. That plan has since changed since now we have funding for a complete replacement. So initially we were looking at a renovation. Now the fact that we are going towards a permanent replacement, we anticipate receiving a fixed cost offer hopefully within the next 30 to 60 days. Once we receive that, we will be poised in a better position to really start to develop the planning stages for the new facility. Initially, we were looking at a swing space to do some temporary repairs. Now obviously we need to collaborate and move forward in a different direction.
Right, so then a lot of what is in this CFO's office, if you will, then that requires collaboration between yourself and the facilities. So you have to determine what you can consider as sunk costs for now that you need funding to repair now, and what are those things that can wait for you to do your complete rebuild. Do you agree?
Right, you're absolutely correct. And I being a former VP, I recognize the challenges of an age building. There are a number of systems that, let's say if our construction process lasted, let's say 5 to 7 years. There's some upgrade, not necessarily, I don't want to necessarily call it upgrades. There's some maintenance that we have to do to maintain the operation of the current systems. It may require procuring newer systems, replacing some of the age systems to be able to get through that stopgap. So there is some collaboration that we need to coordinate going forward.
Absolutely.
But
So 1 second.
Sure.
So absolutely, I am in full concurrence with you that in order for you to be successful, in order for us to utilize our funding appropriately, we have to collaborate between yourself and your facilities lead in both hospitals, correct?
That is correct. And again, one of the challenges, you cannot utilize those federal funds for maintenance
Correct.
or temporary repairs. So that's where I would say the funding shortfall is how do we cover those expenses between now until we can actually.
So when those decisions are being made on the facilities level with the facilities VP, your current CEO, is there coordination between the three, if you will?
I would say that it needs to go off on a different tangent right now from where we were before, yes.
Okay, and that's because of the
renovation to
rebuild?
Yes.
All right, so I get it. You wanted to say something, CEO?
Yes, Senator Fred Gregory, because I think it's important to put on the record, we will continue to collaborate very closely with THRT because we don't want to spend money on anything that we don't have to spend money on right now that's going to be replaced. But we need to keep in mind that the $10 million that we are sharing with you today is after having that reflective conversation with THRT. Those are things that we need to add now to keep our hospital going for the next 5 to 7 years until the new hospital opens. And it's really important for everyone to recognize that the money that's coming for the new building, the new hospital, cannot be applied to this interim 5 to 7 year period
Absolutely.
of maintenance that's needed. So we need that additional investment and support to keep the hospital safe for patient care until we get the new hospital that's very nicely being designed by the hard work of the THRT under the leadership of Mr. Smalls.
Well, you sound like you need a $10 million modular, because I don't know how that is going to align. I'm not sure. So now that we're having a complete rebuild conversation, is there a conversation around a possibility of some sort of a modular to support whatever those wings are that are clearly challenged?
Senator, unfortunately here on St. Thomas, we are limited in space. So that was one of the earlier decisions, developing a swing space versus a modular. A decision was made early on opposed to a modular. Nonetheless, we do have a project worksheet that will avail for interim measures. Meaning, so if we were going to do the temporary space or to be able to construct something or to be able to lease property to be able to perform some of those functions in the interim. One of the discussions that we're currently having right now is some of the non-clinical areas, perhaps relocating those entities outside to a lease facility or lease structure, thus enabling those areas to begin demolishing to facilitate the construction of the new facility. So it's almost like a chess chess match, I should say checkers, being able to move things around and to be able to maintain operations for the patients here in the St. Thomas St. John district.
And all of that will fall under the fixed costs.
Absolutely.
I
Well, a
see.
combination of the fixed costs as well as a PW for the interim.
Okay, so there's a separate PW for the fixed costs and what we'll consider the sunk costs.
That's correct.
I see.
So once we develop that out, so there's like a placeholder that was done immediately after the hurricane. Once we come up with a comprehensive plan and a cost estimate, we will do a cost alignment with FEMA to be able to fund that interim plan.
I see. Okay. I'm going to have to ask that you send back to the committee, because based on the information that we have in our post-audit report, we do not have your clear projected budget for FY 2024. And that's the overall. We pulled this information from your financials on your website. So we need to get your clear projections for 24 in order for us to make a decision as to how we will move forward with supporting the Schneider Regional Medical Center. And I don't know if we have any other questions. Senator Fonseca, you're recognized for your point of information.
Yes, thank you, Madam Chair. You know, it's the responsibility of the government of the Virgin Islands to try to help the Schneider Regional Medical Center to the greatest extent possible. And I wanted to ask on the chair's time for you to just detail 3 specific items, Director Commission, because I see a way how the government, if this was done, will actually have to reimburse you less money. So can you explain to me how the waiver of co-insurance for all diagnostic testing and elective outpatient procedures, and also the $5,000 copay for surgical procedures, and the updated fee schedules, the outdated fee schedules. Can you detail how those 3 items can help the hospital?
Sure, Senator Fonseca, and thank you for the question and bringing that up. So at the hospital, we want to be a preferred place where government employees with Cigna insurance come to receive their care. We know it's really important to the overall health plan and the health of our population that we do screening early, and then we do preventive health practices, and that we get routine checkups with our docs. So we want to be the place where Virgin Islanders come to get their care, and we think changing some of the incentives in the health insurance plan, the Cigna plan, will help to encourage that. So we don't necessarily want to advocate for putting in the carrot and the stick. We don't want to put in the stick. We don't necessarily want to advocate for a penalty for people who want to leave island or need to leave island because we don't offer something. But to the extent that you want to stay on island and you have the government health insurance plan, we want to be able to offer the service to you at a discount or at less of a burden to you. So if we waive the co-insurance on things like screening exams, colonoscopies, and other things, and other work that we can do, lab work, physician office visits, it would encourage persons to come to us for care. If you have a surgery that you need to get done right now, let's say as a government employee, maybe it's not urgent, but you need to have it done, your copay might be $5,000. And while we can put you on a pay plan, it still is
$5,000.
It's still $5,000. And so to the extent that we can work with the government health insurance plan to be able to reduce that burden for the government employee, we want to do that. And we hope to have those discussions coming up.
The outdated
fee schedule, yes. So we are going to be with JFL, getting back to the table with all of our payers, and it's time to renegotiate the fee schedule so that the payers are adequately covering the cost of care at the hospitals. We know that everything in healthcare has gotten more expensive. Inflation in healthcare is at record levels, and we need to get to the table with the insurers and the payers and make sure that the hospital is being reimbursed fairly for taking care of their members.
Thank you, Madam Chair. I definitely support those initiatives.
Thank you, Senator Fonseca. You spoke about the co-insurance. Are you having any discussions with the GSC
Yes,
with regards to these concerns?
Yes, Senator Fred Gregory, we have had conversations with the GESC directly. We are advisory members to their board, and so we have started to become engaged in their board meetings, and we're going to be having direct conversation with Cigna as the payer, and we hope that there will be encouragement and support from GESC, from the legislature, from the central government, for better options for government employees with the government hospitals.
Thank you, and I am forgetting that I have more senators here. I did not, Senator Javon James, you're recognized for your 4 minutes. My apologies.
Greetings to the people of the U.S. Thank you, Madam Chair. Thank you, testifiers, for being here. My question is regarding the oxygen supply vendor. And I see here where you have the vendor name, you have the amount, and it shows that it's to be renegotiated after oxygen generator installation. Explain to me what's going on there.
We have
That's in the post.
Thank you for the question, Senator James. We have a contract with Oxymax, who supports the maintenance and operation of our oxygen generator on St. Thomas. As you know, over the past couple of years, we've implemented and turned on our oxygen generator, where we're now able to produce our own hospital-grade oxygen on site, which has reduced our need to purchase liquid oxygen. That vendor provides maintenance and operation in terms of filling tanks for us from our oxygen generator, and it's active. There's no renewal currently pending, so I'll look at that line item on the contract listing, and if it needs to be updated, I'll ensure that that's done.
Okay, so my question, what's the problem internally that you can't be able to get the oxygen and you have to depend on these individuals? What's the internal problem? What's it?
So we do supply oxygen ourselves. We use this vendor to assist us with the maintenance and operation. Our staff is being trained by the manufacturer on the operation of the machine and the filling of the tanks, and it's our hope to be able to do that work ourselves at some point, or have the redundancy where we do it and we're still supported by an outside vendor. I can defer to Mr. John Baptiste, our VP of Facilities, if he would like to add anything with regard to the oxygen generator.
Peter John Baptiste, Vice President of Facilities. When the oxygen generator was installed, there was a negotiated contract with a vendor to service the oxygen generator and also to fill. Our staff have been trained on the operation of the oxygen generator, but on the filling portion of it, they're not trained on, and it's very critical. And
okay, so when we fully trained, when will they be fully trained? By?
Well, we've been trying to get our staff trained on the filling part of it, but there's some legal matters we have to address. We contacted the manufacturer directly, but they keep referring back to Oxymax. So there's a challenge here trying to get our staff to get trained to fill the oxygen. So that's in process.
And of course, I'm assuming your legal counsel is on top of that.
We're diligently working to get that resolved.
All right, the reason why I'm asking about this, because, oxygen is very important. I see in the interim you're working on getting things up and running, but I just want to make sure that, number one, the status of the renegotiation based on the post-study report, and some timelines, but it seems like there are some issues there. So I will move on to the next question there, and hopefully you guys stay on top of that. VI regulated waste management, medical waste disposal, to be negotiated, $277,000. It ended on June 30, 2022. What is being done in the interim while you guys are being negotiated, and what's the status of the negotiation?
Yes, Senator James. So we continue to use VI regulated waste management to help us with the disposal of our medical waste. This is actually a unique challenge for us being a hospital on an island.
30
we
seconds.
have to package and then ship at a very high price our medical waste off island to be appropriately disposed. So we have a relationship that's ongoing with VI regulated waste management. It's part of where it says to be renewed. It's part of our ongoing process of reviewing our contracts that are in place, moving everything onto our new template, and making sure that we're getting the best pricing available on all of our contracts as we move forward.
And I'm assuming that these medical waste disposal, these are being dealt with in a timely manner and being removed from the facility by the VA waste management system?
Time.
Agency?
Yes, sir. The medical waste is packed, stored, and then removed and shipped via boat to the states to be disposed of. And that is occurring regularly.
Okay, I will just wrap up by saying I hope and pray that the authority in which this body mandated and put together find creative ways to deal with the disposal of the medical waste. And I really hope and pray that you guys get on top of that negotiation so we can know what's the path moving forward. So thank you, Madam Chair, for the time. I'm not sure if there will be a second round, but thank you.
Senator James, do you have another question you wish to ask?
Oh, yes, sure. And that's regarding the testimony. I saw here in the testimony where the testimony where you mentioned you require 130 nurses and you are on track to achieve full complement by the end of February 2024. Can you just explain to me the strategy that you have used in place? There's a simple version and how many you have currently right now.
Yes, Senator James, thank you for the question. I'll start it out and then I will have Dr. Olivaci, who's been very intimately involved in the process, answer. But we have, since renegotiating and putting in place the new wage plan for our staff nurses, we have really put together a very aggressive marketing and advertising campaign to encourage staff to join our teams. And we've successfully onboarded or gotten commitments from 46 registered nurses, which is significantly closing the gap of what we need to have a full complement of nurses. It's going to get us a significant reduction in our use of expensive contract nurses and provide us with more stability as an organization. And I really want to compliment Dr. Olivaci and the nursing team for the work that they've done, and she can share some of the specific strategies they've employed to get these permanent nurses committed to Schneider Regional.
Yes, so thank you, Senator, for the question. Delphine Olivaci, Chief Nursing Officer. Before I answer that question, I really need to thank the entire nursing leadership team. So currently, SRMC has 86 permanent registered nurses on staff that are being supplemented by 26 agency staff for a total of 112 registered nurses. The strategies that we have used to get the commitment for the 46 registered nurses is naturally the competitive salaries and benefit packages. We also use social media, online advertising, phone calls, text messaging to target potential new hires and invite local nurses to return home. We also have a focus on work-life balance through the creative scheduling and appropriate staffing levels. And we have a personal communication strategy, and we're building a culture of generally communicating with new and experienced nurses who want to be a part of our team. We have decreased the time from application to initial contact and interview. I think I may be going and saying a little bit more than you want. You just really, for my clarification, want to know how many nurses we currently, full-time nurses. We have 86, and we're supported by 26 agency nurses for a total of 112. And we have 24 nurses in the pipeline.
Okay, so the first part of the question was the strategy used. So obviously you answered that. So thank you for placing that on the record. And I asked you how many nurses total do you have? Because I want to make sure I keep track of what you have now when you speak about requiring 130 nurses and being fully complemented by February 2024. So I think you did an awesome job. You threw me off a bit when you paused because you were onto something and you stopped and then you went. But it's still good. Thank you. Thank you, Madam Chair, for the time.
Thank you, Senator James. So let's get our number clear. You have 86 full-time nurses.
Yes, ma'am.
Give us the rest.
We have 86 full-time nurses as of the time of the testimony submitted. 86 full-time nurses. We have committed and signed offer letters and dates for 21 registered nurses. And we have currently 26 agency nurses, temporary.
And that totals what, 112, you said?
It's 112 currently, and then committed in the pipeline is 21.
So you have another 21 to be added to that, so that's 133?
Yes, ma'am.
So you're anticipating seeing 133 nurses at the Roy Schneider Hospital by when?
Fully trained and functioning February 2024.
Okay, so by February 2024, if no one drops out, we're going to see 121 121 staffed up nurses at Roy Schneider Hospital.
At a minimum, yes.
At a minimum. All right. I think it's a lot clearer for the senator. Thank you, Senator James. We're now going to go to Senator Samuel Carrion. You're recognized for your 4 minutes.
Thank you, Madam Chair. Good afternoon to my colleagues, viewing and listening audience, and to the testifiers. Good afternoon. CEO, Attorney Commission, did you provide to this body a breakdown that justify your $10 million in capital project?
Yes, Senator Carrion, we have the entire list broken down item by item of our $10 million in capital needs. I do believe that's been submitted. I will resubmit it through the chair if you have not received it, Senator Carrion.
Please do. With regards to your collections, what do you contribute your improvement in collections?
I attribute that to the very hard work of our revenue cycle team, better documentation from the physician, better coding, better follow-up on our denials management, as well as adding more services and volumes.
And I see you added staff. How many staff did you add to, and are those new positions that you added within your collection department?
Yes, we've added at least 5 members within our business office staff. We are really focusing on denials management and collections. We want to make sure that we have trained representatives working each of our payers and that we have cross-training amongst our staff so that we don't experience any drop-off in billing any of our payers.
Well, I commend you for that. But let me ask you, do you outsource collections at any point, and at what period would you outsource collection?
Yes, we do use a third-party extension of our business office, Senator Carrion. We are engaging one group that's helping us follow up on our denials management, follow up with payers, and then there's another group that's assisting us with our self-pay accounts and our aged accounts.
The billing for the patient revenues, the billing collection, is that after 90 days, 180 days? When do you do the transfer to that third-party collection, and what's the cost of that contract?
So after they primarily work accounts more than 120 days. They receive a percentage of the collected amount, and it depends on how old the account is. So if it's a newer account, they might receive somewhere in the nature of 6 to 8%. If it's an older account, they might receive as much as 25% for a very old account, let's say that we've not been paid on for 3+ years.
Total of new employees in FY23. Will you get that information?
For that question to our director of HR, we've added a significant number of nurses and other technical staff, as well as persons in our business office. We have had some resignations, but as I mentioned earlier, our retention rate has been much, much better this year. So we do moving something from 20% to down to 4.5%. So
1 minute.
We do expect an increase in both the number of permanent staff and the permanent SMB expense, but we expect to see an associated decrease in contract staff. Lisa, do you have the total number of permanent staff added this year?
One moment.
And is that new positions, or those were vacancies that were filled? So if you could tell me the difference from those two. And then while she
30
looks for
seconds.
that, federal grants, what's your status? Do you have any federal grants?
We only have one federal.
Not related to recovery. I'm sorry.
Yeah, so aside from the recovery funds that are coming, we also have one grant that we received last year that's for telemedicine that we're working to identify the specific equipment that we'd want to employ to do that telemedicine exchange. So we're very excited to have those funds, and we look forward to expending them. We do want to do much more in the area of pursuing grants in this fiscal year, and we are right now looking at the resource that we would need to be able to pursue those grants. To your earlier question of filling vacancies versus new positions, mostly filled vacancies, but we did add a few new positions within the business office, as I mentioned, where we found it to be necessary to have more hands to work the accounts and the denials. We have added some new positions there, and we've seen the value of adding those.
I just would like the numbers. On the chair's time, my time has been called. Thank you, Madam Chair. If they could provide the numbers of vacancies filled and versus new positions that have been created.
Thank you, Senator Carrion. So we just look back at the information that you provided yesterday. We do not have a personnel listing. A personnel listing was not submitted for your agency. So we need to, this is why it's important to submit the information on time. There's no personnel listing, so we do not even know what your true personnel cost is for Schneider Regional. So we need to have that personnel listing inclusive of the associated fringe benefits for each one of those employees, so we can understand what your true cost is. Because as of today, we are kind of operating from the dark. We're asking questions based on the information from our 23 budget information that was provided, but we really don't have any information to make a decision with regards to Roy Schneider Hospital. Okay? And there's a point by Senator DeGraff. You're recognized for your point of information, Senator DeGraff.
Okay, thank you, Madam Chair. You asked for all personnel fringe. Okay, that was one of my questions. And then the second one was, is there any retro money owed to any of the employees?
Senator DeGraff, we have a small amount of retro that's owed to our LPN staff. I believe that dates back to from putting their increased wage into effect back to the date of the signing of that agreement. So a period of less than 6 months, but there is some retro that's owed to that subgroup.
You have a number? Are you able to pay it? Or you have a number?
We haven't paid it yet due to cash flow concerns, but we will. I mean, it is there as a priority to make sure that we do
How much?
catch our LPNs up to where they should be. And I believe offhand that number is less than 100. Maybe a little bit less than 100,000 offhand. We can get you the exact number through the chair.
Thank you. Thank you, Madam Chair.
All right, Senator Marvin Blyden, you're recognized for your point of information.
Thank you. Thank you so much, Madam Chair. Let me speak to the budget, right? And with all of the challenges that we have heard today, you know, my colleague spoke to our co-pay. There have been other recommendations, but it all leads to one thing within the budget and the hospital: trust and the image of the hospital. That's why so much people leave and go to other outpatient centers here in the Virgin Islands, where even some of the doctors work at those centers. That's a challenge. That's a big challenge. So my question is, what funding do you have in the 24 budget to help to change that perception moving forward? Because I can tell you of my own experience and what COPs do you have in place. I can tell you my own experience at the hospital lately, whereas I'm not going to go into detail, but I was told that I need to go home, where I was incapacitated, I couldn't walk, I couldn't do anything. So what's in place in terms of your policy to assure that for your own liability and for the patient, that certain checklists, certain things are checked off? Because I know when I went off island, even though we're doing 10 times better, I could not leave until I went through certain checklists. So explain to me in terms of what's being done to address that immediately, so moving forward, people can gain a trust of our local hospital. And Dr. Rosenberg can address that situation.
Sure.
If she can, please. Thank you so much.
It's George Rosenberg, Acting Chief Medical Officer. I don't know what specific problems you encountered when you were in the hospital, but one of the challenges that we do have is the use of locum tenens physicians. Although they're carefully screened before we bring them in, it's a mixed bag of what we can get. That's why we're working very diligently to replace all those positions with permanent staff who we can that will more conform to the standards of Schneider Regional Medical Center. The situation that you encountered, I think, is actually quite rare. The medical staff and the ancillary staff that provide care in the emergency room are very diligent about not discharging patients who are not ready to be discharged. It's monitored by both the physicians that are there and the nurses. All we can do is continue to monitor it and train and coach the staff in the emergency room.
Isn't it? One second. You have to be identified in order to speak for the sake of the reporter. Dr. Olavachi, you wish to say something?
To apologize. I know that Senator Blyden has said, Dr. O, if I could comment, so.
Certainly.
Yes. So, Senator Blyden, as I spoke with you before, we do apologize in any way that the care that you receive did not meet the expectations or the standards of care. We have a very robust quality and PI team that does case reviews and monitors for any safety concerns. We also have a patient safety officer that is on staff. Truly, some processes failed, and that's what we look at, the process versus individual performance. So we did look at the processes, as we will continue to do, as far as the care received in the emergency room and throughout the hospital. When we do those reviews or we do a complete analysis, we identify where the process failed, and then we provide education and training if there was a deficit to ensure that it does not occur again. In instances where individuals willingly went outside of the process or the policy, we do hold those individuals accountable. I will say that these cases, to our knowledge, are rare, though they shouldn't happen at all. So we are committed to ensuring that every individual who comes to Schneider Regional Medical Center receives that care. We encourage our staff, physicians, and patients and families, which they do, to voice their concerns. So we are in the process of, I became aware when you spoke with me, and we are in the process and looking at what happened in your care and everyone else's care that has a concern, and we are committed to shoring up those processes and holding individuals accountable for adhering to that.
Thank you for your response. In closing, Madam Chair, I am not satisfied with Dr. Rosenberg's response at all. And I know you're on the board also. And honestly, unfortunately, I've received a lot of calls in respect to individuals who went through the same experiences like I did. So I'm just trying to be honest here and see what is going to be in place to assure that this does not happen to anyone else. And CEO Commission, I want to thank you for coming downstairs and making that decision at that time, because God knows what could have happened to me if he did not do that at that time. So I appreciate it. Thank you so much.
Thank you, Senator
Madam Chair, for the
Blyden.
time.
Thank you, Senator Blyden. And, you know, a lot of what we spoke about today briefs well. It sounds good. But when we have these types of situations, my colleague have a voice. We have individuals in our community who don't necessarily have a voice on a platform. And we don't know what they've experienced unless we hear it here and there. And as we are having these discussions, somebody would send a note saying, hey, you know, my mom experienced this, my dad. Some people go home and they never come back. And that's why I kept asking the question about quality assurance. Quality assurance have to be throughout all of your systems. And you guys are really good about talking around the question. But the senator asked specifically, what do you have in place? You talk everything else except what you have in place. That's the issue. That is the issue. What is it that's in place to ensure this quality assurance? So he knows firsthand now, because he's experienced what lots of folks have been saying to us. It briefs well, but we have a problem. We have a problem. So the process have to be established. If there isn't a clear process, as it relates to quality assurance, please put one in place, because it is happening throughout the territory. So I don't know that that requires a response at this point. So let's go back to the HR. Did you get the information with regards to the SIU contract, the expiration, and the payments as far as the step increases for those employees? You have to speak into the mic, please. Please recognize the mic of the testifier, please.
Lisa Williams-Norman, HR Manager. The SIU contract was in place September 1st of 2018. It is set to expire September 30th, 2023. So it is going to be up for renegotiation shortly. The employees on that plan are slated correctly and would be moved once we renegotiate it and establish a new pay plan.
Okay, so basically, what are the years of their pay plan? If it were 2018?
So with the masters, they are
Go ahead.
grade and step. So they are in their correct grade and step for the contract that is in place.
So everyone has been promoted to their moved rather, it's not promoted, moved to the appropriate grade and step.
Yes, for the masters, yes.
For the SIU?
SIU masters.
SIU masters. And the other what was that union? The security you said those are also on the appropriate grade and step?
Yes, they are.
And their contract has expired as well, or you're looking to those negotiations?
So the security guard contract is expired. We are waiting for renegotiations through OCB. They were recently put on their correct step.
Okay. All right, very well. Senator, we're going to close in a few. Senator Francis Jr., Senator Joseph, do you have a quick point of information?
Thank you kindly, Madam Chair. I wanted to ask the facilities director rather if there is any plan, because I heard your plan for the next fiscal year, but I also note the increase in your utilities over the span of 2 years. Are you looking at any mechanism to put in place to reduce the cost of the electrical bill? Is that including in retrofitting the hospitals with LED lights or whatever those types of lights are to help reduce the cost of the electricity, or putting in solar panels, etc.?
Peter Jean Baptiste, Vice President of Facilities. Currently, there is no plan in place to reduce cost of utilities. And I think that's due to the rebuilding of the hospital. So we haven't approached that from that perspective.
Have you had any conversations with the office, the energy office, because they have a sizable amount of funding and it goes towards those costs to help reduce our overall electrical costs? Because you owe $2 million. We should be having some level of proactive discussion with the office of the energy office so that we can really reduce the amount of utilities that we're paying out. So I definitely would recommend that they have a lot of technical expertise and also grant funding available. Thank you kindly, Madam Chair.
Thank you for that suggestion, Senator Joseph.
Thank you, Senator Joseph. Mr. Smalls, based on that question, I'm certain that some of what the senator just referenced should be included in your rebuild plan, correct? The mic.
Hello. Okay, good afternoon. Absolutely, when it comes to the rebuilding of our facilities, energy efficiency is paramount. I will offer some suggestions to the VP of Facilities, some recommendations that we could possibly look at. I know we had a presentation just last week with I forget the young lady's name, that for a sister hospital in the States. And one of the things, as you just alluded to, was retrofitting all the light fixtures just to LEDs. It will see a reduction. That's not necessarily a improvement or a new product. It's just a retrofit to the existing. So I will continue to work with the team and offer some suggestions.
Thank you, Mr. Smalls. Senator Novell Francis Jr., your point of information.
Thank you very much, Madam Chair. CEO Commission, are you required to pay workman compensation?
Yes, Senator Francis. We pay annual assessment to workmen's compensation in excess of $120,000 per year to cover our employees.
Are you up to date on that payment at this time?
Yes, sir. We made the payment for 2023.
When did you make that payment?
We made that payment in full as required during the first quarter of this year. I believe.
Very well. What about the budget? What about this budget that gives you reason for pause or concern?
We know our expenses trend upwards in line with what all hospitals in the country are facing, and we know our reimbursement rates for Medicare and Medicaid are low and below the cost of care, and we know that the amount of uncompensated, uninsured care that we provide is going to increase in the next fiscal year. So when we look at our budget for the next year, we know it's going to be tight in terms of managing cash, continuing to manage our vendors, but we have to keep pushing on the expense reduction items we discussed here today, and we got to keep pushing on improving our collections and not leaving any money on the table, really taking in everything we can for the good work that we do.
Thank you very much for the response. Thank you very much for the time, Madam Chair.
Thank you, Senator Francis Jr. Colleagues, we are going to allow, we did ask for some information and we will send you correspondence for that information to be provided. And I think we need to make ourselves abundantly clear that providing financial information the day before does not satisfy this committee at all, because there is no way that we can true up all of this the day before. I did look at the information that you provided, and I'm not certain that you submitted your contracts and updated professional services for FY 2023 through 24. So we're going to need to get that as well, because in front of us, the post-audit report reflects a number of contracts that you have that has long since expired and is saying negotiation in process. So we need to make sure that we get that updated information if it was not provided in the information that was just shared with us yesterday. And I believe that's it. if we have additional requests, we will be reaching out to you for that information. So going to allow you a 30-second close.
Thank you. Thank you, Madam Chair, Fred Gregory, and esteemed senators on the Committee of Finance, Budget Appropriations. Thanks for the opportunity to present testimony on SRMC's 2024 budget today. I hope you witnessed our team's unwavering dedication to improving the financial outlook of SRMC and to enhancing the care and specialty care that's provided to the people of the Virgin Islands. We are very thankful for the support and the appropriations from the government and that the legislature have already provided to SRMC over the years. With the resources that have been provided, we have accomplished remarkable feats, even given that conservative budget. Together, with your support, we've made strides to improve the healthcare services for our territory. Yet we know our mission is far from complete, and our service is not yet perfect, and so we need to continue to invest and work together to strengthen healthcare in the territory, and specifically in our district. To meet the ever-growing healthcare needs of our citizens, and to deliver the highest level of care that we all expect, we must receive additional support. As we described to you today, our vision includes expanding access to critical health services, to attracting and retaining talented professionals, and to incorporating essential technology to advance our healthcare. We are a semi-autonomous agency, and we rely very heavily on the government.
Time.
We want to continue to operate across our multiple facilities and provide the best care that we can. Our team is dedicated to our patients. We cannot accomplish this alone, and so we humbly appeal to you, our esteemed senators, for your continuing support and generous funding so that we can provide patient care. I extend gratitude again to our territorial and district governing boards and to the entire team at SRMC who work hard every single day. I want to recognize our partners at the THRT for the work that they're doing to restore our facilities. I want to give special thanks to our legal counsel, Attorney Walker and Ms. Stephanie Oriole, who assisted with drafting today's presentation, as well as the valuable contributions from all of our administrators and leaders. In closing, I want to thank you again for the appropriations to Schneider Regional Medical Center, and I hope that we will continue to have your support in fiscal year 2024. Thanks for the opportunity to present our testimony today. Have a great rest of the day.
Thank you, and thank you for your testimony. You do owe this committee some information, and we need to get that information ASAP, meaning today's, Wednesday? Please provide the information by Friday so we can begin to do our necessary true-ups. The committee stands in recess for 10 minutes. The Committee on Budget, Appropriations, and Finance is back on the record. Madam Clerk, can you please call up the second block on today's agenda?
Yes, Madam Chair. The second block is Fredericksted Healthcare, Inc. Ms. Massare Sprov Webster, Chief Executive Officer, Fredericksted Healthcare, Inc. That concludes the reading of the second block.
Thank you, Madam Clerk. And we are prepared to move forward. We will now hear from the representative of the Fredericksted Health Center. Please put your name and title on the record.
Good afternoon. I'm Jacqueline Ryan George, the Chief Financial Officer. Ms. Webster is still coming through the security process.
See, this is exactly the concern that we have here in the legislature. This meeting was supposed to start at 1:30. It is now 1:50 and 45, and we are still waiting for the Chief Executive for the Fredericksted Health Center. So we're going to wait on the record. The committee, let's get back on the record. Ms. Webster, please put your name and title on the record.
Good afternoon. Hi, Mercedes Sproul Webster. I'm the Chief Executive Officer of Fredericksted Healthcare, Inc., and my apologies on my tardiness.
Please move forward with your testimony.
I had a PowerPoint to go along with it. I think the media was going to give us a clicker.
Excuse me, you're going to have to move forward without your PowerPoint because you are almost a half an hour late. So we have to move forward. We have another department that's coming before us this afternoon. So please,
Thank you. I'm
please
sorry.
move forward with your testimony.
Good afternoon, Honorable Senator Donna Fred Gregory, Chairwoman of the Committee on Finance, other committee members, all other senators, and our listening and viewing audience. My name is Mercedes Sproul Webster. I'm the Chief Executive Officer of Fredericksted Healthcare, Inc., otherwise referred to as FHC. I'm here today to testify on behalf of the Board of Directors of Fredericksted Healthcare, our staff, and our patients.
Is she fast?
With me today is Ms. Jacqueline Reimer George, our Chief Financial Officer. FHC is a nonprofit organization which was created in 2000 to provide primary care services on St. Croix. FHC is a community health center funded under Section 330 of the Public Health Service Act. Recently, the Board of Directors and staff of Fredericksted Healthcare completed a 3-year strategic plan, and we rewrote our vision for St. Croix. We chose a vision that focuses on the health of our community, but also acknowledges the spirit of our Caribbean people and the challenges of living in a tropical environment. Our work is to help our community reach this vision: a healthy, vibrant, resilient community. FHC will spend the next 3 years increasing access to services with dental and mental health as our top priorities. Our goal is to create comprehensive, one-stop shop health centers with medical, dental, and behavioral health services all available at the same location and integrating services more fully. When we developed our vision, we included resilient as part of the statement in recognition of the many challenges our community faces. Little did we know that just a few weeks later, we would come to work to find pipes had burst on the second floor of the Ingeborg Nesbitt Community Health Center building in the heart of Fredericksted. We would like to publicly thank our staff who jumped in with buckets and mops and worked tirelessly to clean up the damages. Unfortunately, our contractor has informed us that the repairs will not be completed until the end of this month. We have routed our patients to our other FHC locations. We are fortunate that we had recently opened the Lena Schulterbrand Community Health Center in the Sunshine Mall. Thus, we are not creating too much of a challenge for our patients that reside on the west end of St. Croix. We also offer thanks to Steristill International and the VI Partners for Healthy Communities, who have accommodated some of our staff in their offices. We are happy to report that our operations have returned to near normal following the COVID-19 public health emergency. Although our patient population has not fully recovered, we expect to return to 2019 levels, both in patients and visits, by the end of 2023. We are proud to inform you that 1 in 4 residents on the island of St. Croix are patients of Fredericksted Healthcare. Our expansion of new locations over the past several years has resulted in an even distribution of patients across the 3 major population areas in St. Croix, with about 1/3 of our patients living in Christiansted, 1/3 in Kings Hill, and 1/3 in Fredericksted. We believe that healthcare should be available around the corner for our patients. Patients that are sick, pregnant, or elderly should not have additional challenges of traversing across the island to seek health care. FHC is available to provide services to everyone, with a particular focus on those whose income or insurance status limits their options. Our payer sources represent 53% have Medicaid coverage,
15% Medicare, and 17% commercial insurance. The revenue that we generate from providing services to these individuals, added to our federal grants and the VI allotment, enable us to provide care to the remaining 25% of our patients who are uninsured. In 2022, this included almost 1,500 individuals who paid very little or nothing for their care. Because Medicare and many commercial insurance policies do not cover dental, the uninsured rate rises to 35% of our dental patients with no insurance. Fredericksted Healthcare never turns away a patient due to inability to pay for services. When I last presented to you, I was proud to discuss our comprehensive services and our 5 service delivery locations. Since that time, we were notified by our landlord that the lease for our dental lease location would not be renewed. This location had 4 dental operatories and was critical to our dental services. We are shifting much of those services to our new dental suite at the Lena Schulterbrandt Community Health Center. However, Lena Schulterbrandt only has 3 operatories. We are in the process of renovating our dental suite at the Ingeborg Nesbitt Community Health Center from 2 operatories to 3 operatories. However, the water line break has interrupted progress on the dental suite renovation. As a result, we are currently down 6 dental operatories across our system. This is a crucial loss that our community cannot afford, as dental is the highest unmet healthcare need on the island of St. Croix. We are currently working to identify a new location in the Christiansted area for dental services. We continue to provide comprehensive services. Within our patient population, there were several subpopulations of individuals who are even more vulnerable, including 85 individuals who are treated for HIV or AIDS, and 128 individuals who are chronically homeless. FHC is known to be a safe and welcoming environment for all, including these marginalized groups. We provide prenatal care to about 400 women as they prepare to give birth to the next generation of Crucians. We cared for almost 160 children under the age of 1 and almost 2,000 individuals aged 65 and over. It is our honor and our responsibility to provide care to the most vulnerable among us. The past few months have been very busy for us at Fredericksted Healthcare. The Health Resources and Service Administration, otherwise known as HRSA, conducted an operational site visit as part of the Health Center program last month. This 3-day compliance inspection evaluated all aspects of our operations. We are happy to share that we are fully compliant with all healthcare program requirements. We are proud to inform you that we were awarded from HRSA a Health Disparity Reducer Award in 2021, and in 2022, we were awarded from HRSA the Access Enhancer Award. The 2023 awards won't be announced until September. We were also inspected by the Commission on Dental Accreditation, otherwise known as CODA, as a clinical training site for the New York Langone University Dental Medicine Doctoral Residency Program. This program allows us to stretch our capacity as our dental preceptors provide valuable training to the next generation of safety net dental providers. We are the only certified dental residency program in the Virgin Islands. We completed the patient-centered medical home recertification process for Ingeborg Nesbitt, the Mid-Island, and North Shore locations, and we submitted an initial application for the Lena Schulterbrandt. We are proud to share that the 3 sites were renewed and our initial application for Lena Schulterbrandt was approved. These 4 locations are the only patient-centered medical homes certified by the National Committee on Quality Assurance in the Virgin Islands. We also submitted our annual renewal application for Federal Tort Claims Act coverage, which has been awarded through the end of 2024. This coverage requires extensive risk management and quality improvement systems in the health center to ensure high-quality outcomes for our patients. These positive reviews and accreditations would not be possible without a commitment to quality from our board of directors and our staff. We monitor over 20 outcome measures on a regular basis as part of our regular quality assessment process. We take active steps when our outcomes fall below our high standards. This has resulted in several of our outcomes ranked in the top quartile of health centers in the United States, including early entry into prenatal care, low birth weight, depression remission, and diabetes outcomes. We are presently in the midst of our financial audits, which have always been clean. We expect the same report at the completion of this audit. While we have realized much successes over the past year, our challenges remain great. HRSA has estimated there are approximately 15,000 low-income individuals living on St. Croix who are without access to care. FHC would have to more than double in size to reach all of these additional individuals. HRSA has developed a tool to measure and map unmet needs for health services in the United States. This map virtually shows all of St. Croix to be in the highest category of need. This score considers a variety of factors, including poverty levels, diabetes prevalence, childhood immunization rates, health center penetration rate, life expectancy, low birth weight, lack of a high school diploma, obesity, smoking, early childhood mortality, and a lack of health insurance, to name a few. News from the 2020 census has not been good. It shows the median household income in the Virgin Islands has actually decreased by 9% from the previous census. Our median household income is only 60% of that of the United States national median household income. The behavioral risk factors surveillance system found that 22% of adults in the Virgin Islands have deferred health care due to cost compared to just 12% in the United States. 31% have had no routine checkup in the last 12 months, compared to only 23% in the United States. 35% of the adults aged 18 to 65 in the Virgin Islands do not have health care coverage, compared to only 13% in the United States without health coverage. A study published in 2022 by the National Hazard Center mapped the socioeconomic vulnerability on St. Croix. The darker areas indicate higher socioeconomic vulnerabilities in the population. Our sites are all located in the darker areas to make access easy for the most vulnerable among us. We expect to see more demand for our services as a result of these declining socioeconomic conditions. We are also proud to share that you will soon see construction activity at our North Shore location as we break ground on a new building. This building will house behavioral health services, outreach services, and administrative offices. This will make available valuable space in our North Shore and our Ingeborg Nesbitt Health Centers. This will allow us to increase clinical services to meet the increasing need. Some of you may remember that I shared this slide with you last year in my budget testimony. In the past year, we at Fredericksted Healthcare have given considerable thought to this picture. At our strategic planning retreat, we rewrote our vision and mission statements, and we reconsidered our values as an organization. The knowledge that our island is faced with many health disparities weighs heavy on our organization. Thus, we consider the concepts of equality and equity as it applies to healthcare. Our strategic planning group originally included equity as one of our core organizational values. However, by the end of the retreat, we reconsidered and replaced equity with liberation, as we strive to remove all barriers to healthcare on St. Croix for everyone. We close today by requesting an ongoing funding allotment in the amount of $2.7 million. We seek this funding without requesting an increase over the 2023 allotment. FHC pledges to continue to stretch our limited resources to the maximum extent possible. We do not ask for the allotment as a grant or as a gift, but as payment for the services that we provide. We take this opportunity to remind this body that the allotment provided has not kept pace with the level of services we provide in response to the needs of our community. Senators, your support is paramount as we seek to continue to provide services and do our part to move our community from disadvantage through equality and equity towards the ultimate goal of liberation. We look forward to working with this body on our important mission. Ms. Reimer George and I remain poised to answer any questions you may have. Thank you.
Thank you, Mrs. Sproul-Webster, for your testimony. I looked in the PowerPoint that you shared with the committee, and I'm still not seeing that information. So you did not provide us in your testimony your breakout of your projected personnel services, associated fringe benefits, supplies, other services and charges, utilities, capital outlays for FY 2024. So I'm going to need for you to please place that information on the record so we can have a conversation with regards to your FY 2024 budget requests.
The financial information we submitted earlier, so I don't normally have that in my testimony. It was provided to the, at least to post-audit.
Can you please have your CFO provide the information with regards to your projections? We need to ensure that what we have in front of us marries up with what you're thinking or what you are projecting is more like it. So we can start with the personnel services projections for FY 24.
Good afternoon again. For fiscal year 2024 personnel services, total request was $1,941,946. Fringe benefits was $408,054.
One second. We're writing this down. So if you could just be a little slower in your delivery. So
$1,941,946.
And that's for personnel?
Yes. Fringe benefits, 408,054. Medical supplies, 175,000. Professional fees, 75,000. Utilities, 100,000. That's the 2.7.
And that comes back to 2.7 million, correct?
Yes.
All right. And do you have a breakdown of your personnel listing for Fredericksted Health Center?
With me? Or
Correct.
what was provided?
Correct. With you. You have it in, do you have it in an exhibit that you presented to the committee?
No, but it was sent to the post-audit division. I don't have it here with me.
You don't have a copy of your personnel listing with you?
I do not have it here, no.
How many vacancies do you have?
We didn't have any vacancy on the local funding.
In total, so this is not only about the local funding. We need to see the overall information so we can make an informed decision. So it's not about your local funding, it's about the overall program. We have to be able to look at the overall program in order for us to make a decision. Or to help us to make the decision. No?
No, I didn't. I do not have the personnel list.
Okay, so then let me ask you. Could you please forward your personal listing to this committee? Do you have someone in your office that can send this over to us as we have this discussion this afternoon?
I do not have staff at the office right now. The two young ladies that work with me are out today. But I can forward it to you tomorrow.
Very well. And we would need to have that breakdown for all of the other categories. So your overall budget projections for FY 2024 is what number? Outside of the 2.7, inclusive rather, of the 2.7 million.
I would have to calculate that total. Normally, we're provided the post-auditor's report that kind of just groups everything, so I did not walk without anticipating that. We were told we would receive it today, but
So the post-audit report is the report for the senators. We need to get from you what your anticipated revenues are, your anticipated revenues for FY '24, and your anticipated expenses for FY '24, as well as what's happening now in 2023 as it relates to your revenues, as well as your anticipated expenses out to FY 2023. And the post-audit report should have been sent to you, was sent to you rather, I believe this morning. But it is not the responsibility of the legislature to provide the post-audit report. That's really for the senators. We provide it as a courtesy. However, we need to know what that overall revenues is from each department, each agency, each entity, and the overall revenues, as well as the overall projected expenses. So
the total is $14,832,312.
and your projected expenses for FY '24.
Would match the same revenue, $14,832,000.
So you're getting this information from the post-audit report, I assume. So what we're going to need to get from Fredericksted Health Center, please, is your projected revenues for FY 2023, your projected expenses for '23, as well as your projected revenues for FY '24, and your projected revenues for and your expenses for FY '24 projections. That's the only way we could make an informed decision as it relates to our 2024 budget. We have to see how agencies, departments, others that we're providing funding to, how they're doing in order for us to make a decision. So we are not, we can't just make a decision based on what came down from the executive branch. Our job is to scrub the numbers and make sure that we are in fact doing our due diligence to ensure that we're doing right by each respective entity that comes before the Finance Committee. Okay?
So I do have the audit report that I submitted that has the actual, the projected, and the requested. These numbers are given to OMB, but it's also sent to the post-audit division here at the legislature.
Okay, so please, again, what's important is this information has to be read on the record of the legislature so we could have the information. This is not only for us, but our community needs to understand how we are coming up with our final decisions at the end of the day. So that's why it's important for the information to be especially the ask for the year that's in front of us, which would be 2024. So your projected revenues for 24, you indicated is 14.8, and you said that your expenses is 14.8. I am going to move to the next senator and figure out how we could flesh this out. But in order to make a decision, we have to have information so we could scrub these numbers and provide the best we can for each respective agency. So the executive branch sends a budget down, and it's our job to scrub the numbers to determine whether or not that satisfies our interests, it satisfies what your ask is, and it satisfies the work that you're doing, in all fairness. Senator Blyden, you're recognized for your 4 minutes.
Thank you so much, Madam Chair. Good afternoon to you, CEO Webster, and your supporting staff there with you, and thank you so much for your testimony. I'm going to start off with the numbers in the post-audit report. Let's go to professional service contract. You have an amount of, on page 6 of 8, $1.2 million in contracts. All of the contracts are paid up and up to date. Everything good?
Yes, Fredericksted Healthcare, Inc. is current in all of its payments.
There's the one contract for security for $200,000. How much bodies does that represent? Do you know? In terms of security?
So the security service that we had at that time represented about 8 security guards, but we have now brought those security guard in 2023 on staff.
Oh, very well. With the same number represented on staff?
Yes.
What the cost, do you know? Is there a decrease in payout?
We anticipated it would be about the same.
Okay,
We've hired all of the security guards that we had posted at our sites.
Okay, very well, no problem. Under your federal grants, you have a total of $4.1 million. And on all of your federal grant payment in terms of payouts, will all of those funds be expended by the end of the fiscal year?
Yes, for the most part, they are all spent, and if they are not, we do request to carry forward the monies, but no funds are returned.
Okay, and your leased properties also, I see they're on an annual, are they on an annual basis or month to month? What's the square foot, payment per square foot, especially for Shelterburn Health Center in Sunshine at $5,189 a month? What's the amount per square foot for that lease? And is it in a competitive range or bracket?
I'm not aware, or I do not know what is a square foot cost for the rent at any of these sites.
Okay, I guess
that is something that we can get off the lease.
I guess through the chair, you can send all 4 of those different clinics amount in terms of square feet, so we can know what we are dealing with. And in closing, Madam Chair, in the testimony, CEO Webster, you mentioned you mentioned
1 minute.
Oh, a minute. Okay, good. You mentioned one of your challenges, right? And you spoke to just a few weeks after you went into that area, the pipe burst on the 2nd floor at the Nesbitt Community Health Clinic. My question is, was that clinic insured for incidents like that or not? And if not, are you planning to have insurance to cover those type of costs? Because, when you go into a new building, you never know what's
30 seconds.
What's there. Can you speak to that briefly?
Yes, it is, and yes, we have submitted a claim with our insurance agency. And I did want to share that the rent is about the same that we pay for all sites. Lena Schulterbrand in particularly, we have 4 suites. So it seems costly, but it's actually 4 different suites that we've combined together.
Okay, very
But
well.
it goes in line with the rent we pay at our other sites. Thank you.
Time.
Very well. And in closing, in respect to your dental care, and you spoke to having a reduction because of challenges. When do you anticipate basically dealing with those issues in respect to services? Because as you stated, that it is critical, it's a critical loss to our community, who cannot afford that, because at the highest unmet health care on St. Croix, not only St. Croix, in my opinion, in the whole Virgin Islands. So can you speak to that briefly, please?
So as far as the Ingeborg Nesbitt, we hope to have those 3 chairs completed and up and running by the end of this year. As far as identifying a new site, we are looking for that. We really didn't expect the, when we opened Lena Schulterbrand, it wasn't to replace the Dental East site. It was to be an expansion to the Dental East site. However, where we were renting, the property was sold, and the new landlord has other plans for that site. So that was out of our control. But we are looking, and hopefully, probably in 2024, we may find a new site. Another challenge for us has been finding dentists and dental hygienists. So it's not just getting a site, it's also getting the manpower or people power to provide the services.
What does those 3 chairs represent in revenue? And that's it for me. Thank you, Madam Chair. What do those 3 chairs represent in revenue for the clinic?
We have never really looked at our revenue like that. That's an interesting question that we probably would have to go back and do the math on. For us, it's just more about providing access to care, but we haven't broken down to what each chair would generate.
Okay, thank you so much.
Thank you, Senator Blyden. Senator DeGraff, you're recognized for your 4 minutes.
Thank you, Madam Chair. Good afternoon, colleagues. Good afternoon, testifiers. FHC is requesting a budget of $1,941,946 for FY 2024 personnel services. This represents an increase of $46,946 above the 2023 personnel services. Is that $46,946 for wage increases? Good afternoon. You can hold my time, Mr. Chair. I don't know if they heard.
The $1,941,000 reflects the salaries of the employees who are currently being paid from local, and it would include the increase that they would have already received in comparison to fiscal year 2022.
Okay, so when did they receive wage increases?
Was it February of last year? February this year? February of this year.
February this year. Okay, so the $1,941,946 is for the 24 budget, covers the $46,946 from what they receive in the 23 budget going forward. No, I'm saying the actual you're asking for in 24, that $46,009 increase covers all the wage increases going into 24 that you got from 23.
That is correct.
Okay, just making sure. Okay, now how many vacancies do you have? You said 0?
So we're saying there's no vacancies on the local budget.
Okay, on the federal budget, how many vacancies do you have?
There's no vacancies on the federal budget as well. We have vacancies for providers that would be paid from our program income.
They'll be paid from your what? I didn't hear.
Program income.
Program income. Okay, good. Sorry for the, I guess the communication, I didn't hear that well. Now, for maintenance, what's your amount you have funds for maintenance of all your facilities that you're rented and the one you own?
So the maintenance is not broken out by all of our sites.
Okay.
Are you asking me from the total budget?
Total budget, since you don't have it
1 minute.
Total budget, since you don't have it broken down.
The repairs and maintenance, based on the actual for fiscal year 2022, is budgeted at $250,000.
Okay,
The actual was $42,185 from the previous year.
Okay, for 42,185 and up, and that
30
covers-
seconds.
No, the property that you own. What is the status of that property that you own for maintenance? Anything particular for that building that you own?
The general upkeep, painting, cleaning, those regular upkeeps is what we have budgeted for that.
Okay, and your vehicles, the listing that we have for your vehicle, I think we have 7 vehicles.
That's correct.
Okay, and what are your current numbers for maintenance and
Time.
fuel? Maintenance and fuel for those vehicles. What are your current numbers right now?
I don't know if I have that. Hold on. I did not walk with the sheet that was provided to post audit again that broke down the maintenance by maintenance and fuel for each vehicle. This process has changed in this year. I'm sorry about that, but have always been provided that in summary in the post audit report.
Okay, we do have that information, but I was just asking for the more updated one because I know this information is sent a couple months ago. So I was just wondering if you had updated numbers in terms of your maintenance and fuel. So if you don't have that, you could always get that and forward it through the chair. Thank you for the time, Mr. Chair.
Thank you so much, Senator DeGraff. Senator Fonseca, you're recognized for your 4 minutes.
Yes, thank you very much, Mr. Chair. Pleasant good afternoon to the listening audience. My Director Sproul Webster, I've been reviewing your testimony, and I have to say congratulations to you on the good accolades for the operational site visits and the award, HRSA, the Health Services Administration. Also accolades for the post-audit report. I noticed that you're requesting the same operational budget this fiscal as last, 2.7 million. And also your audits. It's a clean bill of health in the audits, and that's also very noteworthy. I want to go to the dental health services in Christiansted because I read in your testimony that the dental services is the greatest unmet need on St. Croix. So how soon do you plan to open that new center in Christiansted?
I don't have a new center identified for Christiansted as yet. I was sharing that the Ingeborg Nesbitt, we're doing renovations, and that should be open by the end of the year. We're expanding our dental services in the Ingeborg Nesbitt site. But I was sharing in Christiansted, we are now in need of a site, and we're looking for a site to provide services.
Okay, I want to go
We
to
presently
page.
have a site. I'm sorry, we presently have dental services at the North Shore
Christian site.
site, which is in Grand Princess. We have 8 chairs there.
Okay, I want to go to page 4 of your budget. On the total fringe benefits, there was a decrease of 21,946. Explain to me how that went down. The total fringe benefits. Why did that decrease 21,946? Mr. Chair, can you hold my time?
Please hold the Senator's time.
Yes, page 4, it was 431,364. Now it went down to 408,054.
So to stay within the 2.7 million, I'm assuming I don't have the whole breakout, that the difference is covered by program income. And I know for sure on our federal grants and on local, we've moved our health insurance payments all to program income.
Okay, I'm not so certain I understand that, but let's move on. So what's your total accounts payables now and your total accounts receivables?
Those as well I would have to provide to the committee.
Okay.
We do not have accounts payables, anything that we have on our books within 30 days are paid. But I do not have the accounts receivable right now. I would have to.
Okay. I wanted you to explain.
1 minute.
I also want you to explain, in your testimony, you're saying that 15,000 low-income individuals on St. Croix are without access to health care. So I'm assuming this is the population that you're targeting, or this is an unmet group that we're not addressing. Explain that to me, clarify it to me.
Yes, thank you, Senator. Yes, our target group is the underserved. It is persons who don't have insurance, as well as persons
30
who
seconds.
are Medicaid or underinsured. We're here for everyone. Anyone can come to us, but in terms of like the funding we get from the federal government and the funding we get from the local government is to help the underserved community. What I shared in my testimony is HRSA, not us, but HRSA, the federal government, has done research and collected data, and from the information that they have, they are indicating that there are 15,000 people on St. Croix that do not have health care that are underserved.
Mr. Chair, can I finish? Yes. Okay, it's very interesting, and I want you to give me some information, because right after we receive testimony from you, we have the St. Thomas East End, and I want to get a statement from you that is going to clarify the difference. Do you know, do you have your total that you're paying in rent? I know you have 5 different locations. You own one. One is $5,007. What's your total monthly rent that you're paying?
For all of the locations?
Yeah, monthly.
About 15,000 a month.
15,000. And your board is comprised of 51% users just for the HRSA 330 grant?
That is correct. That is correct.
Okay, thank you very much, Mr. Chair.
That's a mandate by HRSA.
I didn't hear it.
Can you repeat what you just stated, CEO?
I'm sorry, I was saying that is mandated by HRSA, that 51% of the board members be patients of the health center.
Thank you very much, Mr. Chair.
Thank you, Senator Fonseca. CEO Webster, well, I get the financial person. In respect to your program income, what's the number of staff for each program?
What's the number of
What the number of
employees
staff
that's
for your
paid on
program?
program?
Sorry, what the number of staff for your program income, first of all? That's the first question. What that number?
I don't have, do you want the number of employees paid from program income?
Yes, yes, definitely.
I don't have the exact number. I would say about 80, 85 people.
Okay, you can get that to us. Also, we're gonna need the personal listing, because on this listing that I have in front of me on page 8 of 8, it does not list all the positions, because I do not see the CEO listed here. I do not see your position listed here. So if we can get a copy of the personal listing, that would be appreciated. Okay, and finally, for your program income also, I'd like to know or get a listing of each fund, how much for each fund. Okay? And that's all I request of you. Our next senator is Senator Carla Joseph. You are recognized for your 4 minutes.
Thank you so much, Mr. Chairman. A pleasant good day to Fredericksted Healthcare, Inc., and I really commend you on the good work that you're doing in the St. Croix district communities. The chairman asked for some pertinent information that we will definitely require in looking at your fiscal 2024 budget request, and for you to be able to defend and provide us with the documentation so we can make an informed decision on this matter. Now, I wanted to revisit the post-audit report, page 6 of page 8, under the federal grants. Do you receive any indirect costs associated with these federal grants?
There's only one of our grants that we received that for, our CDC grant, about $20,000.
Okay. And I was looking at the report for, do you have it under your program income, or I don't even see it under the federal income, your indirect costs associated? I'm looking at page 4 of 8. Where do you capture it in your expenditures? I'm trying to see where you would capture it in your expenditures and what it would be used to cover. And I'm not seeing that. So if you could provide us, even though it's a nominal amount of $20,000, kindly provide us with a breakout of how that indirect cost is used and what percentage is into being used. What is your cost, your indirect cost rate? That's what I wanted to ask. Because you only have one, you're supposed to know your indirect cost rate.
I think it was like 10% of that grant.
10%.
And it's all used to cover overhead. So it's being charged right now for utilities.
Okay, so this covers your utilities. Are you putting it into the utilities under program income? I don't even see it here. I'm trying to figure out where do you drop it. Yes, I see it has 75,000. So you use all of it. You said you put that into program income. That's how you fund it?
The money from the indirect cost covers our overhead.
Okay.
Utilities are paid local and program income.
Okay, and program income. So you braid some of the resources there. Okay, so all of your utilities, but if you said 10% of the 741,625, that would give you, I think it's 74,000 rather than 20, but post-auditor could probably help me with the math.
1 minute.
I'm correct, 74,000 rather than the 20,000 that you indicated, which would be your indirect cost. So So you're supposed to be getting 74,000 from that for your indirect costs based on a 10% indirect cost rate. Is that how you're calculating it?
It was based on one grant. Under the CDC, we received 2 grants for 741,000.
30 seconds.
I'm not hearing you clearly. I'm sorry, Mr. Chairman. Could you repeat that for me, please? And speak into the mic because, we can't hear you that well over here.
So I'm saying for our CDC grant, we received 2 separate grants from the Center for Disease Control. One was 441 and one was 300,000. Only one of that grant, we were charged indirect fees. We do not charge indirect fees for any of our other grants.
Okay, and you get these grants directly?
Time.
They're drawn down into our account.
No. I'm just saying they're not a pass-through grant from the Department of Health locally. They are direct.
No, it is not.
Okay. I also, Mr. Chairman, I have one final question relative to the budget, and I wanted to ask you: do you have any outstanding accounts receivables?
So I do have our balance sheet as of July 31st and our accounts receivable on the books, and this is net after we've reserved bad debt, is 709,353.
709.53. And payables?
I do not have any accounts payable, but as I share, 260,349.
200. Just call the numbers quickly. Just number it.
260. 349.
349. And that's your accounts payable as of when?
July 31st.
Okay. Thank you. Thank you so much, Mr. Chairman, for the leeway.
Thank you, Senator Joseph. Point of information, Senator Fonseca.
Yes, thank you, Mr. Chair. How many nurse practitioners do you have on staff?
We have 3 nurse practitioners on staff.
Okay, what are the salaries for those 3 nurse practitioners?
The starting salary is 95,000. I want to believe.
Excuse me, not the starting salary. Can you give me the current salary?
So, each of them have different, they range, I want to think they're about 110,000.
You have one that's making less than 80,000?
No, we do not, but if we do, I want to believe the one you're talking about is a part-time NP. She doesn't work with us full-time. So because she's only there like 2.5 days a week, she definitely would be less than 80,000.
Thank you, Mr. Chair.
Okay, thank you so much. CEO Webster, we also going to need a listing of the accounts payable balance that you stated to Senator Joseph. We need a listing of those individuals, okay? Also the accounts receivable included also in that. The committee will stand in recess for 2 minutes.
The committee is back on the record. All right. I believe that the last speaker was Senator Carla J. Joseph. Okay, we're seeing St. Croix now. All right, very well. Let me just ask very quickly before we go to the next speaker, because I think I heard Senator J. from Bavoni, the young lady from Bavoni, asks a question about your receivables. I think, yeah, your receivables, and I believe that you share that your receivables is some 709K. Is that accurate?
Yes, that's correct.
So those are outstanding receivables, or that's like receivables within the current month?
That is the outstanding accounts receivable to date.
To date for fiscal year 2023, correct?
Yes, that's correct.
So I'm asking the question because I'm trying to correlate it to your uncompensated care. So is this tied to your uncompensated care?
So the uncompensated care is factored out, and those monies that are uncollectible are either recorded as bad debt or as a reserve.
Okay, so
no, it is.
Let me ask it different. For FY 2023, to date, what is your uncompensated care numbers? Is that tied to your receivables of 709K?
So it's backed, uncompensated care is recorded and then backed out into a reserve or written off as bad debt.
Okay.
So for fiscal year 2023, the average uncompensated care was $5,068,000.
So what numbers make up your, what activity rather make up your receivables?
Receivables are unpaid monies for the services that we provide, that we bill to our patients, our insurance, Medicare, and our patients. What is not paid remains on the books as receivables.
So what's the difference between that and uncompensated care? That's the same thing as far as I'm understanding. No?
So the uncompensated care, after you are paid, the portion that you are not paid is considered uncompensated.
Right. So you said 5 million, but it's still a receivable, correct? No?
It is a receivable that I'm saying that I have reserved.
I'm not speaking about. I'm not. So let's make sure we say that I'm not confusing you because I don't want to do that, right? So I'm saying in fiscal year 2023, thus far, what are the amounts that you have billed for services and you are not paid? That would be considered your receivable amounts. I could understand you backing it into your reserve or whatever. I'm not sure what that is in the ensuing year. However, in the year that's in front of us, what is that number? Because you shared that the 709,000 that is your receivable is inclusive of services that were not paid for. So I'm still, I don't understand. So let's try it again.
Our accounts receivable is recorded, and then we have reserve or allowances for bad debts or any contractual discounts.
Okay.
So it is reserved, and a net number is left on the books. So our books does not show uncompensated care unending. It either has to be written off the book or reserved as uncollectible.
Okay.
So I'm giving you what's on the books now.
Okay, so we're having two different conversations. Your bad debt is written off. What is your bad debt policy?
Our bad debts are written off once every year for any bills that are 365 days old and uncollected for our self-pay patients.
Right, so within fiscal year 2023, I'm asking you, what is that number? and it's clearly higher than 709, but you share that it's 5 million. So I'm unclear. The 709,000 reflects a particular period that is not. What's your fiscal year? What is your fiscal year? Let me just ask that first.
January through December of every year is our fiscal year.
So your fiscal year is not aligned with the GVI. So it's January to December. So you're on the calendar. So as of January 1 to our current, what are we? We are now in August, so you may not have your July numbers. So let's say June. What are those numbers? What's the number associated with billings that you have not received payment for? That's what I'm asking.
So as of July 31st, I had receivables on the book at $4,412,000. I have bad debt for $2,249,429.
Okay.
And contractuals for $1,273,000.
So the $4,412,000 is as of when?
July 31st.
Okay. What's the period?
So the accounts receivable is unending. There's not a period for that.
Yeah, but
it is what is.
Okay. Well, I hear you when you say that your accounts receivables are unending. You still have to know what your receivables are for that particular year. So the year that we are in, you should be able to put all of your receivables in buckets. What did your receivables look like in 2022? What they currently look like in 2023? And on and on. So I'm basically asking you, is it that you're saying that I want to be clear on understanding what your true uncompensated care number is for FY 2023. Because if you have all of it in one bucket, you have to be clearly, based on your financials, you should be able to clearly show what bills have not been paid for that particular year. So that's where I'm seeking clarification.
So I can provide that from our next-gen system. All of our revenue for our services is in a separate system from our financial system, and I can give you what that is by peer mix. It is combined here for a total as of July 31st that I have in front of me.
Okay, so if you're saying it combined from when? From when? It's up to July 29th. From when? How many years now?
It would be 2 years on the books because we've written off mostly everything as of December 31st of 2022.
So then between fiscal year 2020, between calendar year rather, 2022, well, some of 23, some of 21, fiscal year 21, fiscal year 22, and then some of the 709,000, we back that out, that is some $2.9 million, give or take. That's the total for that 2-year window. So then when this year comes, then the number will be higher. That's what you're saying? That's what you're projecting out?
Be higher, and we are getting ready to then write off any balances as of December 31st, 2022.
Okay, so let me ask a question. Do you have, and this, I guess this question is for the executive director, and that is, so we have Medicaid, those who have presumptive eligibility, correct, Mrs. Webster?
We have Medicaid, yes, and we do presumptive eligibility. That is correct.
So let me ask you, as far as your presumptive eligibility as individuals come into the clinic and they fill out the applications and you do what you have to do with the Department of Human Services, how would you rate your reimbursements coming back from the Medicaid program?
The reimbursements have been very well. Since COVID, they changed the federal match from, it used to be 55-45 to now 87-13. So the reimbursements are definitely much, much better than they were in the past. And the payments are much better than they were in the past. There was a time when we would be waiting for payments over a year. And right now, it's probably about 2.5 months, give or take, with payments from the Medicaid office.
All right, thank you. So what we would need to get from you to the chair is of this 4,412,000, we need to see a breakdown of the years that make up this 4,412,000, and I suspect that in that 4,412,000 is this 709. That's a correct assumption, Ms. Reimer? Ms. Reimer George?
Yes, that's correct.
Okay, so can you please share with us the breakout of this 4,412,000? Forward it back to the committee. Thank you for your responses. Senator Novelli Francis Jr., you're recognized for your 4 minutes.
Mic check 1, 2. Thank you very much, Madam Chair, and good afternoon to everyone. Good afternoon to the Fredericksted Health Center, Ms. Ray Webster, as well as Ms. Reimer George. First of all, I want to thank the Fredericksted Health Center for all of the excellent work that you continue to do here on St. Croix and providing again for indigent community. I've visited a number of your facilities. I'm very impressed with the work that's being done there. So you spoke about this $40 million in funding that you receive, as well as that your expenditures, also a total of $40 million or thereabouts. So you're just a net zero, no profits or anything you're expected to gain as a result of your operation?
Well, it's a budget, and we do project our budgets to be balanced.
To be balanced. Okay, very well. And in respect to the conversation about the I guess your payer mix, and do you have any self-pay? Do you engage in any self-pay clients?
Most definitely, yes.
You do? What does the number look like in the totality of the revenues coming in? How much of that is self-pay?
So I was sharing on the medical side, it's about 25% of our patients. On the dental side, it grows to 35% of our patients.
Excellent. And how are these individuals paying? Cash, credit card? Or how do you receive that payment?
Both. Most of them pay cash. Most of them pay the minimum, which is a nominal fee of $25 on the medical side and then $50 on the dental side. So most of them pay cash, and some may use credit cards.
And in respect to your banking accounts, have you provided the financial balances to our post-audit division on your accounts?
No, I don't think it was requested.
That wasn't requested
No.
for your accounts? Okay. Well, we'll check on that. I know other agencies, they're asking for the balance sheets to be provided there. So what is your revenues to date? What have you collected to date?
Our revenues to date as of July 31st is $12,927,000.
And have you been able to compare this to the same time last year to look and see what it looked like?
The same time last year, we were about the same. It was $12,716,000.
Okay, so you're even out. What about, how do you cover insurance for your autos and infrastructure? You have your own insurance, you're part of the government insurance. How do you cover for your autos and your infrastructure, your buildings?
We purchased the insurance from a private insurance company.
You're not part of the government insurance or anything like that?
1 minute.
Your own situation. How do you measure effectiveness of the Fredericksted Health Center? Do you do KPIs and track those KPIs? Do you have a strategic plan? Do you have an evaluation assessment? How do you measure success?
So we definitely do strategic plans. We also do pay patient surveys as well as we do staff surveys. And as I shared during my testimony, we have a quality improvement committee where
30
we constantly
seconds.
look at the various clinical measures and seeing where we are with that.
Okay, and real quickly, as my time wind down, do you have any liability or judgments against the Fredericksted Health Center?
We have a case that is pending, but outside of that, that is only one, and we are covered by the federal torts claim, and it's in their hands at this time.
Okay, and you spoke about this $15,000, 15,000 individual that don't have access to
Time.
healthcare. I wanted you, Madam Chair, if I may conclude.
Yes, Senator.
Thank you. In those 15,000 that don't have access to health care, is that outside of those clients that you see that still remain, or is this inclusive of those individuals that you see?
These are outside of who we see and everyone else, Department of Health and the private offices. These, according to the federal government, are people who have not had any medical visits with anyone.
Wow. Okay. Very well. Thank you for your response, and continue to do the good work that you're doing. And I'm hoping that we could definitely continue to fund you at the levels that would make you continue to be effective. Thank you very much, Madam Chair, for the time. Thank you for your response.
Thank you, Senator Francis Jr. Senator Diane Capehart, you're recognized for your 4 minutes. And if the senator isn't in the room, we're having a hard time seeing in this district. All right, so Senator James, you're recognized for your 4 minutes.
Greetings to the people of the U.S. Virgin Islands. Thank you, testifiers, for being here. Based on the 2022 budget testimony, it was referenced by the Fredericksted Health Clinic that you are actively trying to recruit for behavioral health providers, including psychiatrists and therapists. How is that coming along? Have you been able to get anyone on board?
We have a psychiatrist that provides services 1 week a month. He lives in the mainland. He comes to St. Croix and sees our patients. We really feel or would like to have a full-time person here on island at our facilities, but we haven't been successful in that as yet. But we also were able to hire 2 licensed social workers who provide counseling. So we have a part-time psychiatrist and 2 licensed social workers full-time.
Thank you for that. And how many patients is this individual seeing? The one from the U.S. mainland who came down, who comes down once a week or whatever? How many patients?
I don't have that number, but generally in a week, he might see 5 a day, give or take, and it's only 1 week, so that's like 25, maybe 25 to 30 for the whole week.
So is this person on contract?
Yes, he is.
And is that factored into the budget?
Yes, it is.
So under professional services and contracts?
Yes, that's where that should be.
Okay. And as far as your recruiting efforts, because you say you're actively recruiting for behavioral health providers, do you have the means, the funds, or is it something that has to be funded? Is it just a wish list, and then eventually once you get that, then it will be funded? How is that?
So that is the challenge. It's particularly in behavioral health, where their salaries are as high as $300,000, and we're not in that $300,000 area. So whenever we've met several people that we've interviewed, we've liked, and they were interested in coming, but when we got to the salary discussion, we couldn't afford them.
And right now, what is the starting salary that you are offering them?
We were willing to work with like around 200, 220,000, but we could not get to 300,000.
Understood. And do you partner with any nonprofit organizations or any entity out there to assist you with catering to those with behavioral needs? And if so, does it come with a cost?
We collaborate with several nonprofit organizations, but there's no cost. When we can, we refer patients up to the Department of Health. I'm thinking, and I'm not thinking on anyone else that provides behavioral services. There is like the village that provides substance abuse services, and we do refer patients there as well as they refer patients to us from the village.
Okay. Thank you for placing that on the record, and thank you for your efforts, because we can't put all that strain on you, but I'm happy to see that you and your team are trying. And as far as the vans, I know it was mentioned that you have vans, and that was used to provide medical and dental services. How are the vans coming? How many vans do you have?
So we have a couple of small vans that we go out in the community and do outreach services with, particularly HIV testing.
How many vans?
There's probably, I think, 3 small minivans, and then we have 1 large medical van where we can do both medical and dental. We have not been able to utilize that as much as we'd like to. We are in discussions with Department of Education to go into their elementary schools and provide services, and we hope to get that really going this school year, this new school year.
And I'm assuming with the budget that you have before us, you're asking for the right amount of money to be able to maintain the vans and deal with that initiative, Department of Education.
That is correct.
Madam Chair, with the indulgence, if I can just ask one last question to Fredericksted Health Clinic.
You may proceed, Senator.
Thank you. That's the school-based dental sealant program? No?
So we do not have the school-based health center anymore. We had shared that last year, that that site is closed, but we do go into the schools and offer dental services, educational services, teaching children how to brush their teeth and so forth, how to floss and whatnot. We do the sealants at our facilities when the kids come to us, but when we do have the van and have this partnership going with education, we probably could do sealants in the class, with the van that's parked on the school property.
I can't speak for this entire committee or body, but I'm hoping that when you do come to some understanding or agreement with the Department of Education, when it comes to our children, whatever we can do, I'm hoping that you come back to this body and see what we can do and have that discussion, because it's very important. And once again, thank you to Fredericksted Health Clinic for all that they do. You always come down here prepared, and we appreciate you. And you deserve more. Thank you, Mr. Chair, for the time. Madam Chair, for the time.
Thank you, Senator James. Senator Carrion, you're recognized for your 4 minutes. All right. Well, like I said, we were switching screens, so my apologies for not seeing the senator who stepped off the floor. So, Senator Joseph, you're recognized for your point of inquiry.
Thank you so much, Madam Chair. I just want to go into cost sharing. Is there any cost sharing regarding any of your federal grants or even your payments from Medicare or Medicaid, as well as the private insurance in your staffing and as well as other services?
No, there's none.
Okay, thank you.
Thank you, Senator Joseph. So if you can please provide to this committee all of your available funding sources, the general fund, the federal grants, what you've received in fiscal year 2022 for your for the Medicaid reimbursements, and what you've received thus far in fiscal year 2023 for Medicaid reimbursements. And the Medicaid information is very important to us because we do recognize that in the past, the reimbursements against the Medicaid program was 55-35. So the obligation, the government's obligation, of course, was a lot higher. Now that we're seeing 87-13, we have to look at our budgets and do some reevaluations because of the 8713. We do also recognize that you serve a population in the St. Croix district that really needs the medical attention, and a number, or if not the majority, of those individuals are their payment is through the Medicaid program, and then you also have a number of those individuals who are self-pay, for that matter, who you are based on your information as it relates to your uncompensated care, that they are not making those payments, and that's the responsibility of the GVI. So we need to get clear information to help us to make an informed decision around your 2024 budget, please. Okay, and that information is going to be sent to you, Senator Carrion and Senator Cape Hart. So we're going to go to Senator Carrion, since I already called him first, and then we'll go back to Senator Cape Hart. So Senator Carrion, you're recognized for your 4 minutes.
Thank you, Madam Chair. Good afternoon to the members of the Fredericksted Health Clinic. This might not be directly budget related, but I was concerned to see that you're missing some of the board of directors. I think you have 3 vacancies. What's the plan in regard to that?
That is correct. We have been advertising. We advertise in our lobbies and out in the community. Board members are trying to recruit board members. Basically, the board should be a 15-member board. Presently, we only have 12 board members. So if you know anyone...
You have an opportunity now to do your pitch.
Yes, this is an opportunity. Anyone out there that is interested, we do have 3 vacancies on the board. The board needs to be representative of the community. Presently, we don't have a Hispanic member on the board, so we're particularly interested in trying to find a Hispanic person.
Beautiful. With regards to your exhibit, I see that you mentioned that FHC FY24 request for federal funding is about $1 million less than FY23. Are your federal funding in jeopardy by any chance?
Well, that's not correct. I'm not sure where you're seeing that. No.
Okay. So everything with regards to federal funding, you're good?
Has been on the same level, yes.
Okay. What about when was your last audit?
We're presently in the middle of that.
And you're auditing which year?
2022.
2022. And the one prior to that, any findings?
Clean audits.
Clean audits. That's very well. Now, vacancies. You mentioned that on the government side, I heard there's no vacancies. What about on the federal side in general? What vacancies do you have? And you are submitting to this committee a complete listing, right?
We will. We shared that we don't have any on the local side, but we do have on what we pay with program income, and that's specifically physicians, medical providers, dentists, dental hygienists, nurses, primarily the patient care staffing, we are short-staffed in.
So is there a number figure, the total amount that you have in vacancies?
I don't have that with me, but we will definitely submit that to you.
Would you say it's more than 10?
That would be a fair number.
Very well. Budgetary challenges. I know you're having some issues with the building. Have you anything included for capital outlay? And apart from that, any other budgetary challenges that you have?
We do have a program income that we have set aside for reserve.
1 minute.
Such emergencies like this. I had shared that we have filed a claim and we're waiting to see what the insurance company will do. And other challenges would be just expansion, some of the services that we're trying to do, particularly services for the homeless. We provide a homeless clinic And there we're
30
doing that out
seconds.
of funds, our program income funds.
And in regards to your program, your training, I saw that there's amount that is budgeted for training. What are your plans in regards to training, and what's the amount that you have budgeted for that?
Ms. George will look for how much we have budgeted, but training is ongoing for our staff. Every opportunity we have to help them to improve their skills, whether it is the nurses, whether it is line staff, registration, billing, coding, any opportunity that we can improve the skills of our staff, we take those opportunities to do.
Time.
So hi, we have 150,000 budgeted for travel, and as Ms. Webster shared, it is for ongoing travel and conferences that the staff attend.
You just have trouble, you have something budgeted for training per se.
So travel usually covers the conference.
So everything
and-
is included in there, so travel and training costs. Okay, thank you very much. Thank you, Madam Chair.
Thank you, Senator. Senator Carrion. So thank you for that question, Senator. I'm going to ask through the chair that we be provided with the travel or training programs and the associated costs for FY 2022 and what is projected to complete this fiscal year. All right. Senator Diane Capehart, you're recognized for your 4 minutes.
Thank you, Madam Chair, and good afternoon, CEO Webster and CFO George. Good afternoon. So I wanted to ask on page 6 of the post-audit report, you mentioned that you received American Rescue Plan, which is the ARPA funding. Can you tell me what projects that you have or you've completed with that funding?
So the monies from the American Rescue Plan, we used it to pay our staff. It was a 2-year award, and so it was completely for salaries and fringe for the staff that is at the clinic.
So none of that monies was used for any recovery projects or nothing like that? It was all salaries?
We received a couple grants from through the American Rescue Plan, but the one that ended in 2023 was for salaries. We had ones that we used to purchase solar panels and repair our buildings after the hurricanes. And we recently received another one towards the building that is going to be started construction at the Princess site.
Do you have a grant writer?
And us.
No?
Us.
Just you
And
ladies.
we also have
Well, yeah, there's a lady that would
Coachella out of
So
Chicago.
when you write the grants, who manages the grants? Because that's a next thing. When you write, you could write, and then you need special, individuals who have that training, that knowledge of managing the grants. So you do your grant writing and managing of the grants?
That is correct.
We do have a part-time grant writer as well. But yes, once we receive the grant, we manage it in-house.
Okay, I just have to commend the federally qualified health centers for all that you do, and especially branching out and having many other sites. From the last time I know myself working in the Fredericksted Ingeborg Nesbitt Clinic, where in the perfect world you had Medicaid office, you didn't even have to worry about presumptive eligibility. So you're telling me that the health centers, they get monies for uncompensated care from Medicaid? You do?
No, we do not.
You do not?
No, we do not.
So you don't do presumptive eligibility?
Yes, we do presumptive eligibility.
So you do your own cases of presumptive eligibility? Because, forgive me, Ms. Webster, because between listening to the testimonies that was provided earlier, I know the individuals that come to your health center, they're either on Medicaid, Medicare, self-pay, correct?
Correct.
So you have a pay scale of how you determine if someone doesn't have insurance, correct?
Right, so when the patient presents.
1 minute.
We are speaking with the patient to find out whether they have insurance and whether they're covered by Medicaid. If the person does not have Medicaid and has no other insurance, the Medicaid office has trained our staff on how to enroll these persons through presumptive eligibility.
30 seconds.
If it appears they qualify. Once that is done, then the services are reimbursed us through Medicaid for that visit until the Medicaid office decides whether this person really qualifies or not.
Okay.
But the uncompensated care, there's a whole, there are other people that do not qualify. And that's the uncompensated care that I was referring to, that I was saying Medicaid does not pay for.
Okay, thank you for that clarification. Madam Chair, I have one more question, if I may.
Of course, Senator.
And the population that you served, to include the homeless population, the services for the homeless, is that written into, like, the services for them, is that written into your state plan? Or is that just an added cost that the health center acquires?
It's an added cost that the health center has acquired.
Wow. Okay, thank you, Madam Chair.
Thank you, Senator Capehart. I think Senator DeGraff has a point of information, and then we're going to go to Senator Carrion.
Okay. Thank you, Madam Chair. I think, Madam Chair, when you stepped out, I had asked FHC regarding the $1,941,946 ask for 2024 personnel services as an increase of $46,946. If you could send through the chair the breakdown as to all of the employees that received those wage increases of that increase from the $46,946. Okay?
All right.
Yeah, for them through the chair.
Okay, thank you, Senator DeGraff. So, do you have any unionized employees within your organization?
No, we do not, Senator Fred Gregory.
Okay, and so basically all of your employees have received salary increases or about to receive salary increases for FY20, your fiscal year 2023.
That is correct.
All right, so, and that is to the tune of some $464,000, about?
Yes.
All right, so that supports the increase in your personnel services. All right.
If I
go ahead.
Senator, I just wanted to share in reference to your question about the union. Our employees actually voted the union out several years ago. And I just wanted to share that because I think it's a compliment to FHC, our organization, and how we treat our employees.
Absolutely. Thank you for that. And let me see if we have any other questions. We do have some through the chair requests that will come to you, but we're going to go to Senator Carrion. Senator Carrion, you're recognized for your 4 minutes.
I went already. Madam Chair, I went already for my 4 minutes, but I could ask a question.
Wait, hold up. If you went already, we're not doing a second round, Senator. Do you have a point of information? Let's play fair. Go ahead.
Yes. CEO, is there a reduction in your federal funds?
No, there has not been.
So you won't not expecting one for FY24?
So, let me share. We do have a Ryan White grant, which has, over the years, been reduced. I think when we first got it, it was at $250,000, and over the years, it's reduced little by little to now I think it's down to
reducing.
$231. But outside of that, the CDC grants have stayed the same, and the HRSA funding has stayed the same.
So I was
So we-
asking to find out the impact, if any, to your programs that you offer with that reduction, if you could share with us.
Right.
Thank you, Madam Chair.
So with the reduction, we've supplemented it with our revenues that we have collected through program income.
Thank you.
All right, thank you for your response, and we're about to wrap up, but let me just ask a quick question based on a PowerPoint. Do you have a PowerPoint, in your PowerPoint, do you have a document that shows how many individuals you're currently serving? You serve in 22, like a scale that shows, a chart that shows.
Yes.
Yes. Can you direct me
Yes.
to that,
It
please?
actually, it is, after the pictures I showed the dental opening, I should have numbered them, I'm sorry. But they're pictures from the dental opening. It's towards the front.
Okay, I
And
found
it shows our growth over the years. It shows that we peaked in 2019 at about 12,000 patients. However, due to COVID, we've seen a drop in patients. We've beginning to see an increase again, and here at 2022, we ended at just under 10,000 patients.
10,000 patients. Okay.
Yes, the page behind indicates the visits, and the visits are, a patient may come back to the health center 3 or 4 times. So again, we peaked in 2018 at just about 44,000 patients, and here we ended 2022 just under 40,000. I want to believe it was 38 something visits.
Visits, okay. All right, that's important information because I did note, I kind of saw it and then didn't remember where I picked it up from, but I did note that we saw a drop in your visits as well as your patients during the COVID time, and now in 2022 we started to see a progressive uptick in both areas, to include your visits and your the number of patients. So let me ask you, so you are seeing a significant increase in your revenues because of the 85, what is it? 8513? 8713.
That is,
Yes, go ahead, sorry.
no, I answered your question. You said we're seeing an increase, and I said that is correct.
An increase in your income, correct?
Correct.
And how is that aligning with your expenses? Because now remember now, it was 5535, and now we've moved to 8713, correct?
That is correct.
So we should be seeing, this is a significant difference with regards to the matching requirement of the GVI, of the government, if you will. So how is that aligning with your, are you seeing, let me ask it a little clearer, are you seeing an increase in your, where can I find that? I need to be clear on that. Increases in your expenses, because now your uncompensated care should be, we should see a reduction in your uncompensated care. Are we seeing reductions in your uncompensated care? Because when I did the calculation, based on the numbers that you gave me, I'm seeing it's around $1.8 million per year. And this year, we are what? Well, we have like 5 more months to go in fiscal year 2023. And let's just say if we double the number, we're looking at some 1.4 million, 1.5 million, give or take. So that's the way we have to calculate this as we work on our budget. Okay? So
the individuals who
Go ahead, I'm sorry.
have uncompensated Medicaid or generally the uninsured patients who Medicaid doesn't cover. So those individuals still, come for health care, and Medicaid, they are not eligible one reason or the other, whether it is that their income is more than the 11,000, I want to think it's 11,700 or something to that effect. I don't have the exact number, but I know it's less than 12,000. If a person makes more than that amount, they don't qualify. And as we know, that's not a lot of money. I mean, it's too much to be eligible for Medicaid, but most people cannot survive on 12,000 annually. And there's lots of people in our community that are there, and those are the majority of our uninsured individuals. And then even some people that have private insurance, although they may have private insurance, they still have challenges with their co-pays. So again, there is part of where some of the uncompensated comes from. But with Medicaid, Medicaid covers those who definitely qualify.
Right, so I totally understand that, but I'm saying now you have 8713, so you're seeing an uptick in the reimbursement amounts that you're getting from Medicaid. Before, the number was a lot lower. It was 55%. So you now have 87%. Correct?
Correct.
Okay.
Correct.
And then when I looked at your payer mix. So you have Medicare, individuals on Medicare for medical your payer mix is 15%. Your commercial is 17%. So the commercial, I suspect, there's one in blue that I'm having a hard time. That's it uninsured? Yeah, it's in blue. That's at what, 25%? I think that says 25%.
Yes, that's uninsured is 25%. That is correct.
Okay, good.
And with Medicare, I'd like to share with Medicare, Medicare pays a flat fee, which is not the cost of the services, right? Mm-hmm. So Medicare's flat fee is $120, give or take. Mm-hmm. The medical visit is more than $120, but that is all that Medicare will pay. So again, you have uncompensated, for the person that comes in with Medicare.
Okay, understood. So you have 25% that falls under the uncompensated care for medical, and of course, naturally, dental is more. So what is that dental number? Because it's in blue, so you're having a hard time seeing it.
35%.
35%.
35% of our patients.
So this is what we need to get from you. We need to see your payer mix for 2022. Give me your payer mix for 2021, 2022, and your projections for 2023. That'll help us to figure out whether we're on track here. All right? So that's the other piece that we need. And I believe that exhausts my questions. Colleagues, we do have the folks from the East End Medical Center that's patiently waiting, so I don't have any other questions. Senator Blyden, you're recognized for your
point of information.
Thank
you so much, Madam Chair. CEO Webster, I know the last Senator spoke to the federal grants, and you stated the one grant that have been decreasing year over year, but you did not basically say why. Is there a reason? Did they explain why the funding was decreased over the years?
No, it's not just for FHC. This is just nationally across the board. This grant that I was speaking to is the grant that we get to provide care to persons with HIV and AIDS.
Correct.
And you would think that that would be increased. However, that has not been the experience. And as I said, it's not just at FHC, it's just nationally across the board.
Okay, very well. But you have utilized those funds though on an annual basis, even though it has decreased. Have you been spending those funds?
Most definitely.
Okay.
We spend every penny, and then we add program income dollars to support the services. And that is very important to us, to our board, and to our staff, and we do what we can to provide the services to persons with HIV and AIDS.
Thank you so much for your responses. Thank you, Madam Chair.
All right, thank you, Senator Blyden. I'm not able to see the senators in the room on St. Croix. I'm going to ask the testifier, the Mrs. Webster, to please provide us with a 30-second close with regards to your 2024 budget ask.
I would like to take this opportunity to thank the members of the Finance Committee or the Committee on Budget and Appropriations for your time here this afternoon. I thank you for the compliments for the services that FHC provides to our community. I again would like to remind you that our request is not close to the services that we provide, to the cost to provide these services to our community. We are constantly expanding as we see the needs. And someone asked before whether that was in our mandate. It is not in our mandate, but it is our commitment to the underserved community. And we ask you to assist us and continue to provide these services. Thank you.
Thank you, and I want to take this opportunity as well to thank you and all of the hardworking individuals, the doctors, the nurses, the support staff at the Fredericksted Health Center for filling a very, very important gap that we have here in the territory, and particularly in the St. Croix district, because we know that you serve more individuals who are in need of medical services, who cannot afford those services than the other island districts. So we want to thank you, and we're going to close this meeting, this segment of the meeting. So the Committee on Budget, Appropriations, and Finance stands in recess for 2 minutes. The committee is back on the record. Madam Clerk, can you please read Block 3?
Block 3, St. Thomas East End Medical Center Corporation. Invited to testify is Dr. Tess Richards, Acting Executive Director, St. Thomas East End Medical Center Corporation.
Thank you, and good afternoon to the family of East End. Can you hear me? Can y'all hear me? Good afternoon to the family of the St. Thomas East End Medical Center Corporation. We're going to ask you to please put your name and title on the record, and we're going to start with Dr. Tess Richards.
Good afternoon. I'm Tess Richards, the Interim Executive Director at St. Thomas East End Medical Center Corporation.
Good afternoon. My name is Donna Street. I'm the Revenue Manager for the St. Thomas East End Medical Center.
Good afternoon, Stephen Mayers, Chief Financial Officer for STEAM CC.
Thank you. You may now proceed with your testimony.
Good afternoon, Chair of the Finance Committee, Senator Donna Fred Gregory, members of the Finance Committee, other members of the 35th Legislature, viewing and listening audience. I am Tess Richards, the Interim Executive Director at St. Thomas East End Medical Center, hereafter referred to as STEAM CC. The team with me today is Mr. Stephen Mayers, our Chief Financial Officer, and Ms. Donna Street, our Revenue Manager. First of all, thank you for the opportunity to present testimony on our budget this afternoon. I would also like to thank our Board of Directors and the staff at STEAM CC for all of their hard work, perseverance, and most of all, support during the difficult times that STEAM CC has been facing. This has really been beyond challenging, but what I have learned is that the staff at STEAM CC is extremely dedicated and extremely passionate about the work that they do. So thank you, thank you, thank you to STEAM CC staff and to the Board of Directors. I also have to say thank you to this legislative body. To be honest, preparing to come for you was a bit unnerving at first, especially being new, but as the team started to work together, pulling numbers, running reports, looking at our data, we started asking questions and brainstorming. And we realized, okay, we don't do this well, or we do this one really, really well, or we don't do this at all. So this exercise was really very good for us and for our team, and it taught us a lot about our center's financial position and all of the many factors involved in improving it and securing our financial future. So it went from being unnerving to being something I think that we're actually looking forward to. You know, we can only see what we see from the inside, and having an outside perspective on the things we may not see will help us to learn and help us to grow. So your questions, your input, your suggestions, your recommendations about what we're doing right and wrong, all of that's good for our team. So thank you, thank you, thank you. I think we'll come out stronger because of today. Okay, so STEAM CC is a federally qualified health center, or an FQHC. We've been serving the community for more than 30 years, but in order to really understand our mission and some of the challenges and obstacles we face each year, it's crucial that you really have an understanding of who we are as an FQHC. Having a good understanding of STEAM CC as an FQHC and what that means for the community is really important in understanding our budget request and our budget needs. So the purpose of FQHCs is to make sure that everyone has access to medical care. So essentially, STEAM CC bridges the gap for people who would not otherwise have access to care. What that means is that while we offer services to everyone, our main focus is to make sure that the underserved population of the St. Thomas St. John District has somewhere to go for their health care. So the population that's uninsured or underinsured can still receive high-quality care because of STEAM CC. As an FQHC, STEAM CC is required to follow the mandates and guidelines set forth by HRSA. So HRSA is the Health Resources and Services Administration, and they are our governing body. They have lots of reporting requirements. They have requirements about services that we are required to provide to the community that we serve as well. So let's take a look, and that will be that very first slide that you have. So I apologize for the PowerPoint not being up for you all to see, but I've heard that you have the slides, and that's what I'll be referring to, okay? So STEAM CC is a primary care center. We take care of all of your basic needs, routine physicals, well-child checks, vaccines. We take care of pregnant women. We perform routine women's health care like cervical cancer screenings and breast exams. We do sick visits, asthma and allergy care, skin testing. Our behavioral health team does individual and group counseling, and our dental health team does oral exams, dental cleanings, emergency care, fluoride treatments, et cetera, et cetera. But we need more providers. We need general medical providers, behavioral health providers, and dental providers in order to meet the needs of the community. And we need to be able to offer competitive salaries to those providers to not only bring them here, but to keep them here. And just think about it. Like, look at where we're located. Such a great spot, right there in the mall, lots and lots of parking. You can get your physical or your teeth cleaned. You can go shopping, get your car registered. Perfectly convenient spot. So we truly have the framework, the foundation, and the location for a great center, and we are already doing really, really great work. But we need a cash infusion to be able to get out of this crisis and just soar. Okay, so let's talk a little bit about the community we serve, what we do, and who we see at STEAM CC. So who are our patients? We see about 7,000 or so patients every year. The majority of our patients at STEAM CC are female. The breakdown is about 64% female and 36% male. And while we do have more females in the territory based on the last census I read, it was only a difference of about 5%. So that means that our men are just not seeking care. What this told us is that we need to reach out to the men in our community and bring them into care. Therefore, we need more funding to be able to do so. The next pie chart right next to that shows us the breakdown of adults versus children. I would also like to see a shift here. So if you look at the raw data, it looks that about 40% of our patients are children and about 60% are adults. And while we are seeing more adults, it doesn't reflect the true adults versus children percentages that's in our community. Our under 18 group, according to the 2022 kids count, is about 20%. But at STEAM CC, it's 40%. That means while parents are bringing their children in for care, they're really not seeking care for themselves. So we need to focus more on bringing adults into care. The next graph reflects what we do and what we are treating. We have so many people in our community who live with high blood pressure, diabetes, obesity, and asthma, and that is certainly reflected in our patients at STEAM CC as well. If you look at the graph, about 20 to 22% of our adult patients have high blood pressure, and about 36 to 39% of our adult patients are overweight or obese. And that only reflects the people who are coming to care. We know that there are many people who do not seek care, who likely have some form of a chronic disease. That's why it is really important that we have the resources to bring our community into care. The next pie chart is something that is really very important, and is actually an area of growing need within our territory, and that is behavioral health. With your financial support, we plan to put more of our resources into behavioral health. And from a revenue perspective, having a complete behavioral health team is very beneficial. We'll touch on the impact behavioral health has on our revenue over the last few years in a bit, but for now, I'm putting on my doctor hat. As a community and as a nation, really, we need to understand and embrace mental health a bit more. Our community is suffering depression, anxiety, substance abuse, various psychotic disorders, and none of us are doing enough. And aside from the disorders I just mentioned, depression, anxiety, bipolar, schizophrenia, we also have to begin to incorporate mental health and mental well-being into all of our patients who are living with chronic disease. Into the obesity clinics STEAM CC plans on developing, to the victims of intimate partner violence and sexual assault. And we will provide that mental health support and education once we're funded. This is so important because I'll tell you, our children in particular are suffering. Last week I mentioned the expansion that our behavioral health team is working on to go into the government agencies, the long-term facilities, and the schools. And our behavioral health team is developing that program right now because your mental health is so important to us. And once we are in a better financial position, we will expand our mental wellness services even more. So, all of the tables and graphs we just talked about were included to provide some insight into who we see and what we do for our patients every single day. We also wanted to give you an idea of some of the more common diseases we treat because they reflect a lot of the chronic medical conditions throughout our community in general. And if we cannot support the demand for primary care services and see enough patients because we do not have enough providers and enough resources, they end up at our hospital. And not just with the day-to-day chronic medical condition that they live with, but with a complication from that condition, which in many cases, like high blood pressure and diabetes, is actually a medical emergency. This creates two issues. One, the most important one, which is a sicker population. And two, this then becomes a financial burden for our hospital. And as an outpatient preventive care facility, our job at STEAM CC is to have enough providers to see the patients who are well and keep them that way, and take care of the patients who have chronic medical conditions and keep them stable and out of our hospital. We are one community with limited resources, so we have to work together with our healthcare partners. So why am I talking about chronic disease right now? This is a budget hearing. Well, it's actually really important that we talk about this at a hearing about budget, because without a sufficient budget, we cannot take care of the people who need us. And if we cannot take care of them because our budget cannot support the services the community needs, we end up with a lot of sick people and more of a financial burden on our healthcare system. But once we have the funds that we need, STEAM CC will provide that care to our community. We want to be your medical home because we want our community to be healthy. Now let's take a look at our program income, our payer mix, our patient visits, our compensation rates, and self-pay numbers, just to give you an idea of the many factors involved in our revenue. Let's start with payer mix. When you look at our patient population over the last few years, we have an average of about 15% with Medicare, 10% with commercial insurance, approximately 49 to 50% with medical assistance, and about 25% who are self-pay. So 1/4 of our patients are self-pay. And together, medical assistance and self-pay are our biggest payers, representing about 75% altogether. Now let's look at our program income. Just for an overview, STEAM CC's budget is made up of program income and federal and local government allotments. Those are the main constant sources of our revenue. We also receive other grant funds based on availability and eligibility, of course, but our main ones are our federal allotment, our local allotment, and our program income. So our external funds are just those, the federal government and the local government. The rest of our budget actually comes from program income, and that is the piece that comes from the blood, sweat, and tears of all of our STEAM CC staff and all of their hard work. At this point, our program income reflects about 46% of our total revenue, which really is just not enough. One of our goals is for our program income to increase so we can sustain ourselves just a bit better. Back around 2019, our program income was about 53% of our total revenue. And at a minimum, we would like to get back to at least that 53%. But to increase our program income, we must put several things in place. Revenue generation, revamping our revenue cycle, and expanding our services. And I know we talked about those in pretty good detail last week, but I did need to mention them again today because they are such an integral part of our current financial state and, of course, our budget request. So as you look at that first graph, you see the self-pay is about 25% of our payer mix. But as far as program income is concerned, self-pay is only about 7 to 8% of the actual income, not the 25%. Even though 25% of our patients are actually self-pay. Only a very small percentage of our collections actually come from our self-pay patients. We'll talk a little bit more about self-pay in a minute, but let's look at some of the overall patient numbers first to give you an idea of what we see each year, and then we'll focus again on self-pay, okay? Okay. I'm sorry, my stuff just got cut off here. Okay. So if you look at our, I'm sorry, I need to get to my slide now because I don't have my PowerPoint. Slide. I'm sorry, my pages got all mixed up. I apologize. Okay. So if we look at our collections page, here we are. Okay. So the first graph we'll look at is our patient.
Before you go ahead,
count.
just give us an idea as to what page you're on, please.
So it's supposed, I can give you the slide, and that's the problem, is that the slide and this are very different. So it's the patient count distribution chart. If you're in the testimony that was submitted, it will be about page maybe 15 for you. Because like I said, what I have and what you have are going to be different.
We're having a hard time following because I think you're ad-libbing.
Right, because I was planning to go based on our PowerPoint.
You have to follow the testimony. Okay. Yeah, because we're not following.
You're not following my stuff.
Correct.
Okay. So this chart is patient count distribution, is what it's called.
Okay. Okay, so we need for you to follow the testimony that you provided us.
Okay.
Okay, so we're not sure what page you're on.
Okay, so, all right. Patient count distribution. Yes, yes, yes. So, okay, so I guess I did not understand that. I thought that I just presented you all the stuff and then I actually kind of talked about what we're doing, so.
No, you have
That's where we are. Okay, so I don't have the same thing that you all had. I have what I have as we tweaked. Like I said, when we called the other day to talk about the fact that the budget that was submitted to you and the budget was not something that we prepared, so we were told, okay, you can kind of tweak that on the floor, and so that's what we're doing right now.
No. You could tweak the numbers.
Okay, gotcha.
But your testimony we have to be able to follow you because I do not know where you are.
Okay, gotcha. I understand now. Okay.
So tell me what page you're on. We got to get back to the page. We have to follow where you are.
Right. So do you have that testimony?
You got to read your testimony.
Right. So like I said, that's not what I did. I printed out my stuff after we tweaked it. After I was told we could tweak, I didn't realize that I had to read that and just tweak numbers.
Okay.
So that's why this is going to be difficult to do. I don't have that. Yes. Well, I'm sorry that you're confused. Like I said, I think that having
where are you? Because your slides align with some of the information that's in the testimony.
Mm-hmm.
So based on what you've embedded in the testimony, what slide are you on?
Okay.
So, you see what I'm saying? Where are you?
Right.
Correct.
So that's what I'm saying. So what I printed out is not the same testimony that you had. I added my ad-lib stuff in here. So my page is 15 of 55, but that's not going to be what you have.
Okay. So we have a problem.
Okay. So if I can print another copy, I can just go by based on that. If
we have to follow the
for you.
testimony.
If that'll make it easier for you. I thought I could do explanations.
One
I'm
second.
sorry.
No, you have to follow a testimony because that's how we follow. That's how we do our
Understood.
highlights, to ask our questions.
I see.
Etc. The committee stands in recess for 1 minute.
Okay, understood.
We're back on the record. We're going to ask the interim CEO to start from page 12 of her testimony. That's where the written narrative is, so we can follow. So just for our colleagues who are on St. Croix, we will begin on page 12. You may proceed.
Okay. So the graph below shows the charges per year from fiscal year 2019 to fiscal year 2023. The data is also broken down by medical, dental, and behavioral health charges and collections to compare revenue generation and collection in each department. I'm sorry? Oh, okay. So that's what I was asking, if I could say that. Okay, I see what you're saying. So in 2019, our charges, total charges, were around $7.6 million. In 2022, those charges rose to $7.9 million. However, in 2019, we collected more money than we did in 2022. We'll get into that in just a minute. For our medical department, we collected charged about $6 million in 2019. In 2022, about $7 million. And then in our dental department, $1.4 million was charged in 2019. And then that dropped down to $950,000 in 2022. Now, if you look at page 13, it says collections per department. And you can actually put them side by side if that makes that easier for you. So 2019, we charged $7.6 million. We collected $5.6 million. Let's fast forward to 2022. We charged $7.9 million and collected $3.5 million. There's a considerable gap between our charges and collections. One of the main reasons for that is our payer mix. When you look at our patient population that we discussed a few minutes ago, a large part of our population is self-pay. 1/4 of our patients are self-pay, and medical assistants and self-pay are our biggest payers, representing about 77% of our payer mix. On page 14, we have our payer mix and our program income. Looking at these two graphs, it's very clear that most of our patients do not have money for medical care. We saw 7,166 patients last year, and 6,573 of them live below the federal poverty line. Despite their inability to pay for their care, they deserve to receive good care. That's what we do every single day. So if we look at our program income, which is the chart on the bottom of page 14, you'll see that 81% or so of our program income came from medical assistance in 2020, and 71% of our program income came from medical assistance in 2023. In 2020, 6% came from self-pay, and 10% or so came from self-pay in 2023. So for right now, what I'll do is we'll have Mr. Mayers actually go through the details of our budget, if that is okay with you, and then we'll circle back, talk a little bit about our sliding fee discount program, and then we'll finish our testimony, if that works for you, Senator Gregory.
Is it in your testimony?
The budget he's going to talk about, he's just going through the budget that was sent to you, yes.
Okay, so we're going to ask it, let me ask it a different way.
Okay.
Is the presentation that he's about to provide written and provided to the senators?
So this is these are the numbers that we are tweaking.
Yes or no?
So no. So
then,
but I do have to, can I explain what I mean though? It's not the exact same.
1 second,
Okay.
please allow me to speak.
Sure.
I thought that when we took the recess, that we were clear that the presentation needs to be what is written and in front of us. That's what we have to have.
Okay, so this is what I'm saying. He's going to read it, but the numbers will be different because that's the part that we were told we could tweak today on the floor.
He's reading what?
He'll read the same thing that is here in the testimony. I can give him this to read.
He don't need to tweak any numbers. We'll ask you the question.
You'll get the numbers?
Read your
Okay.
testimony as it is
Okay.
presented.
This is the testimony.
Thank you.
Sure.
You can't tweak the numbers in your testimony.
Okay.
In your in your ad lib, you have to tweak the numbers in your testimony. If you, like I said to you when we were off the floor, if you requested $5 million, if the executive budget came down with 5 million and you're requesting 6 million, then you say that in your testimony, and then you justify why you're asking for an additional million. But we can't tweak it on the floor. We are all trying to listen and hear what it is that your ask is. So we have to have this written so we could go back and read.
Okay.
And understand,
Understood.
okay?
Understood.
So we need to be clear. So are you starting on page 14?
No, that is page 17. We're finished now. We're going straight to we just read page 14. That's the one that we did with payer mix and program income. We finished that. The reason I didn't do the other ones is because we already did that information when we talked about the graphs already. So now we're going to do strictly the budget, and the budget starts on page 17. It says...
No, we're having a hard time here.
Okay, I'm sorry. I don't understand.
Financial obligation. STEAM CC recognizes and responds to the needs of our underserved population.
Then she didn't give me the whole testimony. And that's 14. That's what you have as 14? I'm sorry, but you just gave me something. That was not 14.
Is it on back and front?
Yes. He has it at 16. Okay, I found it. Thank you.
Okay. So let's start. So can you, though, just finish your testimony? You said, where did you end?
So,
where did you finish
because I had a
off?
complete misunderstanding of what I was going to be doing, it's a little bit more disjointed than my actual presentation was. I was talking about visit counts and visit distribution, payer mix, program income, and how all of those things played into our revenue. But not realizing that that was not the right thing. So now stopping that, I guess, makes it sound very disjointed. So the last thing we talked about was our charges versus collections. That was the last
What page are you on?
chart.
What graph is that page on? Of the testimony?
That is 13 and 14.
Right. So looking at these two graphs, it is very clear. So that's what we need you to put on the record, your testimony that's before us. And then you said GVI FY23 budget overview and breakdown.
Correct.
And then you probably meant 24, but and then we'll hear from your CFO.
Okay, so you want me to do the budget part? Okay, I was just going to have him read the budget part.
We're having a...
Okay, so I finished all the rest of the graphs because I talked about some of them already, and you said you didn't want me to go into the visit counts and stuff. So I just did charges and collections, which is page 13 and 14, and then 15 starts our budget breakdown. So that would be the next thing in my testimony.
Please complete your testimony. Your page 14
Yes.
is where you ended. You did not provide the testimonies where you made reference to looking at these two graphs. It's very clear that most of our patients do not have money for their medical care. We saw 7,000. Did you go over that yet?
I did.
Okay, so...
And I did these before, so I didn't want to repeat them for you. That's
wait.
why.
Allow me to get my thoughts together,
Okay.
because every time you respond, you continue to confuse me. So you said, let us begin with our operating budget of 10,759,816? Yeah, this is where we've fallen off here. We have touched on what our FQHC is and why we exist. That's the last page, page 15. Top of page 15. Yeah.
Oh, it's over here on the back.
Okay?
Okay, so
wrap that up, and then we'll go into...
Okay, and then
Okay, got it. Thanks.
Got it. Okay.
You may proceed.
So we have touched on what an FQHC is and why we exist. We reviewed who our patients are, provided examples of the services we provide, reviewed some of the chronic medical problems we manage, and we discussed our payer mix. Now that we have a picture of who we are, what we do, and why we must continue to exist, we would like to spend the rest of our time discussing our operating budget for FY 2024, some of the initiatives taken since the new team started in March, as well as some of our challenges that we are hoping to work on together with this body, as well as with our healthcare partners within the territory. Let us begin with our operating budget, which is $10,759,816. This is made up of program income and federal and local government allotments. Those are the main constant sources of money. We also receive other grant funds based on availability and eligibility. As part of our overall budget, Our external funding sources are federal government, about $1.5 million, and the local government. The rest of our budget comes from program income, and that is the piece that comes from all of the blood, sweat, and tears of our staff, the hard work of STEAM CC employees. This table shows the decline in program income over the last few years. It also shows an increase in our payroll expenses and a decline in the net assets. At this point, our program income reflects about 46% of total revenue, which is just not enough. One of our goals is for our program income to increase so we can sustain ourselves a bit better. Back in 2019, program income was about 53% of our total revenues, and at a minimum, we would like to get back to that 53%. To increase our program income, we must put several things in place, including increasing revenue generation, revamping our revenue cycle, and expanding our services, to name a few. We would like to share some of our goals and initiatives with you so you get an idea of our plans and why our budget request is what it is. Should I go with the budget now? Is that okay?
Good afternoon to everyone, to committee, all members of the Committee on Budget, Appropriations, and especially the Chairman, Honorable Senator Donna Fred Gregory, and members of the 35th Legislature of the U.S. Virgin Islands. Also, the viewing and listening public, colleagues, my warmest greetings. My name is Stephen Myers, and I am the Chief Financial Officer of St. Thomas East End Medical Center Corporation, STEAM CC. First, I want to talk a little bit about first, I should say, STEAM CC recognizes and responds to the needs of our undeserved population. Our mission is to help our patients. STEAM CC also has memorandums of understanding with outside vendors. Sorry, let me go back a little bit and say our mission is to help our patients meet their medical and dental health financial obligations. As an HQFC, we are required to provide financial assistance to patients without insurance who qualify for our sliding scale fee discount program. For those patients who cannot afford to pay in full for their services, we offer a payment plan. STEAM CC also has memorandums of understanding with with outside vendors who provide services to our uninsured and underinsured patients. These services include blood work, mammograms, pap smears, prostate screening, diagnostic imaging, for example, x-rays, ultrasounds, CT scans, etc., transportation, and medications. Our budget request reflects funds we set aside to assist patients who are unable to pay, not only for their visits at STEAM CC, but also for the consulting services for which they are referred. The components of our budget are as follows. We have personnel salaries, I should say. At present, we have 70 salaries for our 70 current employees, full-time employees, I should mention, and the projected hires or providers have been budgeted at $5.6 million. This includes our providers, clinical support staff, billing and business office staff, administrative staff, as well as projected new hires. That's one component. The second component are employee benefits, or fringe benefits as they are more commonly called. Employee benefits are offered to employees to express our appreciation to our staff and to show them we are invested in their health and future. The center's budgeted 2020, or 2024, I should say, benefit rate is approximately 25% of our, which equals $1.3 million. Our benefit package includes life, disability, health insurance, employer FICA payments, pension contributions of the employer, unemployment insurance, and workmen's compensation insurance. Costs associated with employee benefits are anticipated to increase by a minimum of 2% for each year. Contracts, that's the third category I'm going to describe, is contracts and consultants. Contracts and consultant services have been budgeted at $1.3 million. Professional services include our annual audit, legal fees, bio-waste disposal, lab services, pharmaceuticals, radiology, and our electronic health record system. The balance of costs is primarily payments to provider staff of approximately $0.2 million, which includes a part-time obstetrician, gynecologist, one part-time dentist, translator services, and on-call services. This category is expected to experience an inflationary increase of 2% over the next 3 years. The fourth category I'm going to describe of our expenses is supplies. The cost of supplies utilized during patient care, including items used in medical and dental services delivery, lab reagents for our point-of-care testing, immunization supplies, and basic office supplies has been budgeted at $0.5 million. Expected pricing increases for the next fiscal year have been included in each category. These inflationary factors range from 2% for general office supplies to 7% for pharmaceuticals. Inflation factors have been projected to continue over the next 3 years. We have touched, oh, sorry, I'm in the wrong page. The next category I'm going to describe is our travel and continuing education, which has been budgeted at $20,000. This cost is approximately 27% attributable to the administrative staff and approximately 73% attributable to patient care and business office staff. Examples of business purposes include education and/or industry updates in reimbursement, patient care, quality assurance, and ERISA requirements. Travel industry associations, for example, our annual participation in NACHA, which is the National Association of Community Health Services, or centers, I should say, conventions, another example. Costs will be controlled through review of local seminars, teleconferencing, and webcasts, instead of out-of-territory conferences whenever this option is available. Our facility expenses, that is a significant portion of our costs, and these include our rentals, Team CC rentals of our office, for office purposes, office space of $1.1 million. This also includes land that we are renting at this, or we're leasing at this time for future construction. We have a communications budget of $60,000, utilities, mainly water and electricity, of $240,000, repairs and maintenance to our current facilities of $55,000, machine and equipment rental of $72,000, for a total of $1.5 million. Other services we have budgeted at $145,000. This amount includes recruitment, which is budgeted at $30,000. Recruitment costs include engagement of a recruitment agency, posting classified and journal advertisements, candidate interviews and telephone listings. Promotion expenses, there's also a promotional and events amount budgeted at $50,000. This promotion expenses include patient mailings, patient newspapers, or newsletters, I should say, health promotion materials and events and outreach. Staff uniforms have also been budgeted for. Bank charges, postage, and dues and subscriptions are also included. The other category we're going to look at briefly is insurance. Insurance costs have been budgeted at $33,000. These are insurances for our building contents, director's liability, valuable papers and bond insurance, etc. We'll take a quick look at our projected expenses overall. STIM-CC employment costs consisting of salaries and benefits along with provider services are the source of the largest expense outlay to the corporation. In fact, I have to mention that is close to between 65 and 70% of our expenses as projected. It is crucial that STIM-CC be able to continue funding these positions as they are needed to maintain high standards of care. So our projected expenditures are as follows. Personal expenses, $5.6 million. Fringe benefits, $1.3 million. Provider services, $1.4 million for a total of $8.3 million. Other expenses, supplies, $0.5 million. Other services and charges, $0.4 million. And our facility costs, meaning rent and maintenance of our facilities, $1.5 million, for a total budget presentation of $10.8 million. The budget presented today will help STIM-CC get to a better financial position. In so doing, we will be able to bring on more providers, resulting in better access to care for our most vulnerable population. STIM-CC needs funds to hire staff, expand the range of services offered, and extend our hours as an option. Approval of this budget will afford us the opportunity to grow as a center and optimize patient engagement and experience. Thank you for your support, and we look forward to your various inquiries. Thank you.
That completes your testimony?
Yes.
All right. Okay, so colleagues, we're going to go to another 4-minute round. And just very quickly, could we get a breakdown of what's your actual rent that you're paying at
for facilities?
Your facility is Tutu Park Mall, correct?
That's correct.
So what's the actual rent? Because I know that you have $1,107,000, and I suspect that you have other expenses in there for rental.
Yeah, but most of it is the rent.
What's the amount?
The lease is $73,000 a month. That works out to about $900,000 annually.
So you're almost paying $1 million annually.
Correct. The other $200,000 represents the lease of a portion of land that we hope to use for.
So that's an annual rent?
Yes, ma'am.
For the lease of the land?
Yes, Senator.
So you're leasing undeveloped land right now?
That's correct.
Okay. And when do you anticipate that you'll be able to begin construction on this property that you're leasing?
We are actually trying to get out of that lease right now. We're in negotiations with the corporation to try to get out of that lease because we don't think that the land is actually developable right now, able to be developed.
Oh boy. I miss Mr. Savanero, Bovoniero. I miss Wrongly Field. I miss that meeting because I was away. So I would look forward to hearing more of what that means. I note that you indicated that under your insurance that you have bond insurance. Is it bonded employees or you guys have, let me just ask you, what is your bond insurance? Are you bonded, your employees bonded?
We have some insurance for mainly for board members.
Right, so that's your director's liability.
Directors and officers, correct.
So that's your director's liability, but you also have valuable papers and bond insurance. What is the bond insurance for?
We do have some insurance, Madam Chair. I have to we do have some insurance with I think it's Tunic. I haven't had a chance to read through any of the intent of the details, so I can't give you all of the details at this point. But I know that we have some insurance with them.
So have you floated bonds?
Excuse me?
Have you floated bonds?
No, not at all.
Okay, so we need to get a clear understanding of what this category...
not financial obligations insurance, no.
Okay.
Not that, no.
All right. Okay. We're going to go to a 4-minute round, and we're going to start with Senator Blayden. Oh, before we do that, the budget that you present before us today, I know that your fiscal year, let me just make sure that your fiscal year is January to December as well?
No, we are March 1st to February 28th.
Yes,
but all
sir.
of the data that you have in the
One second. So your fiscal year is
March 1st
March 1st
to February 28th or 29th, depending on the year.
March to February.
But we provided data in the GVI fiscal year. Okay.
1 second. We got to make sure we're getting this right. March 1 to the end of February, depending on the year.
Yes.
So you are presenting, so what fiscal year are you in right now?
2024.
So you're in fiscal year 24.
Correct.
So now, colleagues, we have to start aligning how these fiscal years look, because I sat in this committee for, this is my 3rd year, and I did not realize that the fiscal years for the health centers were different from the GVI's fiscal year. So that presents, it requires us to now make sure that we are aligning our funding appropriately, because I don't know that we are. So we have to look back at that to make sure that what we're doing makes sense. Okay, so you are in a new fiscal year. So then the question I was going to ask is, did your board approve your fiscal year 24? But our answer is yes, because you're well into fiscal year 2024.
Correct.
All right, so then what's happening with us, as we contemplate your fiscal year budget, we are behind, or we're ahead? We're behind.
Yes.
So next time when you come, the discussion is really on your fiscal year. We should be discussing with your fiscal year 2025. So you having a little pattern going on or going this way. Yeah, we figured it out. That's what's happening. So your padding is moving south because we provided you with dollars for fiscal year 23, but we are now having but you are actually in fiscal year 24.
Correct.
We need to right fit our fiscal year discussion with you. Okay?
So,
making sense?
May I say something?
Yes, of course.
Okay. So what I was saying was that when we did our charges and collections and everything, that reflects your fiscal year, because we figured we're coming to this body to ask for money. So when we say FY, and it's in the testimony, when we say FY23, we wanted to give you the data that reflects your fiscal year rather than ours.
Yeah, but you know we can't do that, right? We shouldn't be doing that. We have to align. We have to treat you based on your fiscal year expenses. We have to see what your fiscal year expenses are, because you're overlapping.
Right.
So your fiscal year basically comes on in the second quarter? Second quarter of our fiscal year.
Correct.
October, November,
That's
December.
correct.
No. not the second quarter, moving into the fourth quarter. Sorry, the third quarter of our fiscal year.
It's the end
So
of the second.
that changes the game. So we need to have a clearer understanding of what these numbers look like. So we're going to ask you to please provide us with the information that supports your actual fiscal year. Because we don't have an issue overlapping and giving you what is necessary, and you come back and you say that it's short, whatever that discussion is. But we need a clearer understanding of what your fiscal year is. Okay, so that's a very, very important question that you answered this afternoon for us with regards to the fact that your fiscal year does not align with the fiscal year of the central government.
Correct.
Okay? So, Mr. CFO, we on the same page?
Yes, ma'am.
Absolutely. Thank you for that. So what we're going to do is we're going to go to the first senator, and that's Senator Marvin Bladen. You recognize Senator Bladen.
Thank you so much, Madam Chair. Good afternoon.
Afternoon.
Director Tess Richards and your supporting team there with you, and thank you for your testimony. Listen, I'm just going to go from the post audit. Let me ask you in respect to your lease at the Tutu Park Mall, square foot. What the square foot for those leases? Do you know?
Yes, 19,000.
How much per square foot? I'm sorry.
How much
How much
per
are you paying
square
per
foot?
square foot?
I can do that.
Based on the contract.
I'll have to do that. It's 19,954 square feet.
Yeah, I want to know exactly how much you're paying per square foot for that, and also when it comes to the Hartman land that you're paying $203,000 for. That's on an annual basis, correct?
Correct.
That's correct.
You say you're in negotiation to cancel that lease. How far along are you?
We've had one formal meeting with them, submitted the first set of documents they requested, and they have now asked for a second set of documents. So
Okay.
we're in the process of gathering those so we can submit them to them as well.
Okay, very well. And also, in respect to the mall, it's a 3-year contract. What year are you in right now of that contract?
So it's different for different pieces, different parts of the mall. We have 2 parts of the mall that are actually due to be up this year, one in the end of September, one in November. And we actually spoke with the mall on Monday about further compressing some of our spaces.
What the plan for the end of the year when it leases up for the 2 spaces? What the plan moving forward?
So we spoke with them on Monday, and we'd like to get rid of some of those spaces. So that's our plan, is to try to compress as much of the space as possible so that we can get rid of that lease.
Okay, very well. Look forward to seeing those plans.
Okay.
Let me ask you in respect, does the director still have a credit card?
There is a credit card that the director and the CFO can use, and to control how the spending is with those credit cards, we then have to submit a report to the board every month for them to review. Yes, it still exists.
What the spending limit on a card?
I believe it's up to 50,000 now.
$50,000?
Yes.
Okay, very well. And is there any parameters in terms of what it can be spent on?
Not that I've ever seen, no.
Okay, very well.
Okay, go ahead. Go ahead.
Okay. Let me ask you in respect to your operations, billing and collection, we know plays a critical role at the STEM-CC. So let me ask, in terms of the Medicare cost report, are you familiar with that?
Yes.
Yes.
Are you preparing to contract out that service? Contract out that service?
At this particular stage, in fact, it is in fact being done by outside, by a third party for us.
What the cost? What the amount for that contract?
This year it was 9,500.
1 minute.
For the year?
Yes, it's done once a year. It was 9,500 we paid for
Okay.
it.
Are you familiar that in 21 audit they were denied to be able to bill for that service? Are you aware of that in the 21 audit?
No, I'm not.
Okay, you need to look into that. Okay?
Will do, sir.
That
Will
way
do,
you
sir.
don't have to find a way to recoup that funds. In terms of
30 seconds.
in terms of grants, how much funds have you had in federal grant?
For this year?
Yes.
This year, the only federal grant we have is our 330 grant, which is about $1.5 million.
1.5 million?
Correct.
And how much have been expended from that grant thus far?
We spend approximately, or we draw down approximately 127,000 every month.
Okay, very well. In respect to your vacancies, who's dealing with personnel? Who's speaking
I
for
can answer.
personnel? How many vacant positions do you have?
We have 14.
How much of those 14 are considered critical positions?
Well, I would consider the critical ones to be our revenue generators. So I would say 4 is a need and 5 would be best.
4 in need, 5 will be
We
best?
need at least 4, but I would prefer to have 5.
And what's being done to fill those vacancies?
We are actively recruiting. We actually brought one provider on that started yesterday, which we're very excited about. One will start later on this month. I have an interview with another medical provider on Friday, and we're waiting for another provider to get her medical license. We have a dentist coming on the end of this month, and we're holding an interview with another dentist sometime in the next couple weeks.
And being that you're speaking of dentists, and we know that the hospital no longer has dental services, and that's an opportunity for the center to really increase its services to the people because of the need.
Correct.
You know, so I look forward to the dental space being fully utilized, and you onboarding more dentists in the near future. I basically want to say, in terms of STEM-CC, you guys have a lot dealing with right now, and I look forward to the team coming to some type of resolve in respect to the services and in respect to your team, because your team is very important also. So I look forward to meeting with the committee chair and having more discussion in terms of the operation and how we can move forward in basically bringing things to light. Thank you so much, Madam Chair.
Thank you.
Thank you, Senator Blyden. Point of information, Senator Fonseca.
Yes, thank you, Madam Chair. I wanted to follow up on 2 questions that the senator from NORDA asked. Okay, so you have a $50,000 credit card with Banco Popular. That's what it is, Banco Popular?
Correct.
Okay, what's the balance on that credit card now?
The balance at this point is $40,000.
4,000 or
40,000.
40,000. Okay, and then the senator had asked you about the rent. You said you were paying $1,107,000 rent, and you was giving him the square foot. What was the square foot, the total square foot number?
19,954 square feet.
954. That's $55 a square feet. Wow. Thank you, Madam Chair, for the time.
I don't know what that really means as far as the square footage, but I guess the follow-up question is the space that you have. You're paying almost $1 million annually to Tupac Mall for your space. Are you utilizing all of the space there?
I think the space is excessive. We have already shut down one area because we found it to be excessive, and we are trying to shut down 2 more areas because this team doesn't feel that we need that much space.
So are you in negotiations with
Yes.
The management of Tupac Mall to reduce your expenses?
We are. We spoke to them on Monday about cutting down some space. The same space we talked about that the lease is up in September for one and November for the other of this year. So we're hoping to get out of those leases.
All right, very well. I'm happy that you are doing what you have to do, because for many years we've heard, we don't have enough money, but we also have to make better decisions when we are cash strapped. right?
Agreed.
So thank you for
Absolutely.
that. I think I lost my paper. Senator DeGraff, you're recognized for your 4 minutes.
Thank you, Madam Chair. Good afternoon, colleagues. Good afternoon, testifiers.
Afternoon.
You get a lump sum budget from the government?
No, we get monthly allotments.
So monthly allotment.
Correct.
So the last allotment you got was in February.
No, monthly.
Oh, monthly allotments?
Right. Correct.
Okay, so for Act 8617, the 23 budget, you are still getting those monthly allotments. So you getting February ended your or began your fiscal year.
March 1st.
March 1st. So you started you're in 24 fiscal year. Are you still getting the money monthly for the 23 up to September?
Correct.
In addition to your budget that was already approved by your board.
Correct. You mean our federal allotment? So right now we're getting a federal allotment and we're getting our government allotment, the local government allotment.
Okay. Have anyone received any wage increases from time you took over or from last year, 23, 22 budget?
So all of the staff got increase in their salary in October of 2021. And then we had 2 or 3 employees whose wages increased because of Fair Labor Standard Act issues. Not an actual raise, but bringing them where they should have been to begin with and where they were promised to be.
Okay, so they still wait for a raise then?
But yes, everybody got a real raise in October of 2021.
Yeah, but those for Fair Labor Standards don't count.
I'm going to have to ask
No, I don't.
to hold the senator's time.
Okay, sure.
The live streaming appears to be down, so we have to go stand in recess. The committee stands in recess for 2 minutes. The committee is back on the record. The site is back up. Thank you for all those that text to share with us that it was down. Senator DeGraff, you may resume.
Thank you, Madam Chair. Okay, so you're saying in your expenditures, you say personnel is 5,565,408. How many personnel do you have? How many employees?
So it will be 74 that we're looking at. That budget is for 74 employees, correct?
74 employees.
Correct.
Fringe 1,000,003. What percentage are you using for fringe?
It's about 25%.
Oh,
correct?
sorry.
Is that what you used?
Yes,
Sorry.
that's correct.
25. Okay, yeah, I get that. And your facilities, which is your capital outlay, is a 1,000,005.
Where are you seeing 1 million?
The capital out, sorry, Senator DeGraff, the facilities numbers you'll be looking at, that includes the rental and the associated costs.
Okay, got it. And in regards to the land project on the highway, you see you're trying to get out of that.
Correct.
I think a part of the monies that we are giving you were going toward paying that monthly or also for that land. You're getting out of a lease, or because you were looking to own it?
The lease was for the next 70 years at that $16,000 per month. So we were trying to get out of that lease.
So how much have you paid into it thus far?
Not very much. We owe them about $240,000, something like that.
You owe 230.
Correct.
Okay.
Somewhere around that.
Wow. Yeah. So and you say your operating total expenditure is 10,000,007.
Correct.
Okay. So and you're serving how many people now? You're still serving the same amount because 10,000,007, 74 employees. So you're still serving the same amount, but since you're downsizing, basically, are you going to serve the same amount of people, or how many less people are you looking to be serving?
So, yes, we serve about 7,000 a year. We are right-sizing our non-clinical staff, but when we hire, we are going to hire clinical staff because we hope to be able to support more of our community and see more patients. So we're not
Okay.
downsizing that number at all.
Okay. And in regards to fringe, all of the, what all you say you're paying in fringe again?
We do health health insurance, local and federal taxes, and then there are some people that are in a retirement program.
And that's paid up?
The retirement program is paid up, correct.
Okay. Okay. Hey, thank you for the time, Madam Chair.
Okay, so let's talk about the fringe, because I find that your fringe percentages are very low compared to what we've seen overall with other agencies. So your health insurance, what percentage of your health insurance you cover for the employees?
Our health insurance is about, we've had bills as high as 80,000 a month, and we've had amounts at 60,000.
No,
So
that's
say
not what I'm
average
asking.
$70,000 per month that we pay for health insurance.
The employees pay what portion of their health insurance?
I think it's 15%.
Right.
Okay,
Good
that's
question.
15.
I think I had that. I think we pay 65% of it, but I would have to verify that.
Okay, that's important for you to know.
Yes.
Your FICA is usually what, 8, what FICA is 7?
7.65.
7.65, I think.
So you see you don't pass 25%, right?
Sorry.
Go ahead.
Sorry. No, go ahead. No, the reason why our fringe percentage is not that high is because we do not contribute to, let me put it differently. Our current arrangement, Madam Chair, is that we match whatever it is that our employees pay into or forward through retirement program, which is not going to be anything like what we would have paid if we were in GRS, for example.
No. You go into your pension, but we're talking about your overall associated fringe benefits that come onto the employees' checks as well. Correct? So
No.
FICA.
The FICA is only paid by us. I'm sorry.
By the
The FICA is
employee.
paid partially
Right.
by the employees. But let me say it differently. The FICA is paid by us, the employer. The local taxes are paid by the employee.
No. The FICA, the employees
The
pay.
7.65% is paid by us.
And the other 7.6 is the employee.
And the other 7.6 is the employee.
I'm going to say by us, I mean the employer.
Employer.
Correct.
And then the unemployment insurance is paid by.
Unemployment insurance, the employer pays.
Okay.
Okay.
And then what portion of the employee's retirement, what's the balance between the employer and the employee retirement plan?
The employer, we match 100% of whatever the employee contributes. That is our current plan.
Okay. So on average, what is that percentage?
I could give you numbers. The percentage I have to calculate. We pay about $20,000 a month. That's the current amount that we pay.
Okay, so this is what I need y'all to do. Y'all need to provide us with a clear breakdown of your associated fringe benefits.
We have a breakdown in the detailed financials that was sent to you. But if you want,
When you say...
I can read it in summary for you.
Go ahead.
Madam Chair, I just need to make one quick comment here. An original budget was submitted to this, to OMB, something that the executive director was trying to explain is that we've tweaked it because we're a new team and we wanted to look at it, seriously and not have too much fluff in there. We're an organization with some challenges, and because we have those challenges, we have to always deep dive into our numbers and make sure that they make sense and that they're reasonable. And so we went through and we looked at first our employees. We reduced the budget. The budget that we are actually submitting is amended from 12.2 million. What we're proposing is in fact about 10.7, 10.8 million. And so we've made a lot of adjustments. But one of the challenges that came about was that we needed to rebalance the budget. And when I talk about rebalancing, Madam Chair, I'm referring specifically to the fact that we had, in our initial proposal, we expected to collect over $7 million in program income. We've never collected more than $4.7 million in program income for a long time. So it didn't make much sense to be presenting that to you. So what we've done instead is that we've refocused the budget to say that we can provide from program income $4.7 million, which would be a big increase for us because we only collected $3.6 million last year. And so we're challenging ourselves to increase our program income so we can help ourselves. But it means that the balance of the $10 million had to come from somewhere else.
Correct.
And so the federal grant is only $1.5 million. So the other $4.7 million is what we're asking from the GVI budget for our FY calendar year that corresponds to yours. $4.7 million. That's what we're asking for in this amended budget.
So I saw when you gave your presentation, first of all, let me just congratulate you for actually looking at your numbers and your expenses and trying to align your revenues against your expenses. But our responsibility is to get from you what is your uncompensated care amounts. That's what our responsibility is.
Correct.
In as much as we can meet that, that's what we try to do. So before I go to the next senator, what is your uncompensated care amount? I didn't even know a fiscal year to ask you. I'm going to ask you for 22, since 22 is done. Okay. What was your uncompensated care amount for fiscal year, your fiscal year 2022?
Okay.
What are you, actually you're in 23. So actually you're in 24.
We're in 24.
So what is your uncompensated care amount for your 2022 and your 2023? What do those numbers look like?
Our calculation of our uncompensated care for FY 2022 is $1.86 million. And for 2023 is $1.6 million. I'm telling you this to say, and I'm preempting your question, one of the questions that you asked earlier, so I just to move the process along. You asked about whether accounts receivable is uncompensated care, and I liked your argument, so that's why I want to bring it up again. Fortunately for us, our accounts payable is very much in line with that number, just coincidentally, by the way. So it's about $1.9 million of accounts receivable at this point. So these are the numbers that we look at based on our historical numbers that I just mentioned.
So our responsibility, based on the law, is to try our best to meet your uncompensated care expense.
Correct.
So what's not compensated, we should be looking at what that looks like and trying our best, based on our revenues, to meet that. We are aware that we're now seeing, 8713 on the Medicaid program. So that also means that you should be seeing an increase in the amount of dollars that you're receiving from Medicaid for those individuals who qualify. but you have to, and it seems like you've already started, you have to right fit your expenses. It is clear that you have expenses. You reach it, your hat higher than your hand could reach, right?
Absolutely.
So I see that what you're doing is you are trying to right fit that, but we can't give you an accommodation based on your wanting to right fit that. Our responsibility based on the law is to meet you at your uncompensated care in as much as possible. That's basically what our job is here. And that's why it's important for us to know what your expenses are, whether or not you are managing responsibly to make a determination as to whether or not what we should or should not do. Okay, but I have to go to the next senator.
Okay. Sure.
I think I did ask you a question that you didn't answer. You didn't finish. So you said your uncompensated care for 22 was 1.9 million. For 2023, it's what?
This is 1.6 for 2023.
Okay, 1.6. 1.6 for 2023. Yes. And how much money? Well, see, we don't really align. That's the issue. So what was that? What did we provide you in your budget for FY 2023?
I don't
2.1.
know. I couldn't answer. Oh, you mean in terms of how much money
The-
provided
the-
to us?
how much the
Oh,
government-
2.1.
Okay, so, it's important that we bring this out because for many, many years, as I've sat here, the discussion has been that the GVI isn't doing their part as far as providing meeting the uncompensated care needs. But as we flesh out a conversation earlier today with the previous health center and this health center, we have more than met the uncompensated care need based on what our requirements are as per law. Yes, sir.
Madam Chair, I have to add one important part to this. Every year, the auditors come and they help us to do our bad debts.
Mm-hmm.
And so they write off a portion of that receivable. That is also uncompensated care. That needs to be added to the receivable figure that we have today. So what we have done in essence is we've looked at uncompensated care over a number of years and say, where are the loopholes? Where are we not getting paid? That kind of thing. And I think the doc was the one leading that exercise, which we will share with you, because we want to make an argument that says that it's a little higher than what I'm calling here, which is the figures that I present to you, because I am not including the bad debts figure.
Well, the bad debt is part of the uncompensated care annually. So that's why you're able to write them off, because we provide the funding within that annual year. So that's why you're able to easily write them off. So you can't add it twice, because then you're asking us to pay uncompensated care twice.
So if I may, I think the reason he's saying that is because the number we gave you is just self-pay. That's just the uncompensated care of our self-pay. So that's not including anything else. That's just our self-pay, nothing else that's been written off as bad debt. Those are just the people who walk in who are on our sliding fee discount program or who don't qualify for medical assistance.
So what is your program income?
So question
Your
again.
program income.
From which year?
Or most recent year?
The years that we discussed in 22, 23.
Sure. Okay, let me just, 23. Let me give you 23, Madam Chair. Our program income is, just after a quick calculation, $4.7 million for FY 2023.
So you answer my question for me. So your program income is 4.7, your uncompensated care is 1.6, your sliding scale makes room, gives, you have like self-insurance, if you will, somewhat. You have some self-insurance going on there because you lower the scale moves depending on what, the type of patient that you're
Correct.
seeing. So your program income covers, so you would have to give us that clear breakdown so we could really understand what's happening with your health center, okay? But I really like your synopsis. I really understand what you're trying to do, and you're being very honest and open with what your expenses, what your uncompensated care is, but you just missed the sliding scale and the fact that you receive program income, and then you receive an additional, how much money in federal dollars?
1.5.
Another 1.5. So in total, you have 2, 4, 5, 6, an additional $6.2 million that you receive. Correct?
Correct.
All right. Okay. So we're going to go to the next senator, and that is Senator Ray Fonseca. You recognize. You have 4 minutes.
Yes, thank you, Madam Chair. And, you know, I also want to echo that there's a high degree of honesty that I'm getting from your testimony. And I think that's why the OMB director and the governor authorized, I think you got an additional $1 million in a grant from the government, more or less, right? $2 million, okay. Congratulations. Okay, so page 21 of your testimony, you stated that STEM CC is required to follow the mandates and guidelines set forth by the Health Resources and Services Administration, HRSA. So my question to you, Madam Director, so based on all that has transpired, do you still have a commitment from HRSA to provide the 330 grant funding?
We do.
Okay. Is East End listed as troubled, a standard performer by the feds? How are you listed now?
So because we were transparent and reached out to them rather than them kind of backdoor finding out that we had crisis, we reached out to them, said, we're in trouble. What do we do? What I was told by both our project officer and our Region 2 administrator is, we're not putting flags on you right now. We want to be here to support you.
So you're not troubled?
They have. Well, I think they're looking at us as potentially high risk, but they are not.
Okay. Thank you very
but they
much.
are supporting us.
Okay,
they're
thank you
supporting
very
us. But I do need to say one more thing.
No, on the
Okay.
chair's time.
Okay. Because that's
okay,
not the complete answer. Okay.
If
sorry.
the chair would allow, yes. Okay, the HRSA grant, I looked at the compliance manual, it's 94 pages. On page 73, and this is very important, it talks about the board's authority. And it says that the health center governing board must assure that the center is operating in compliance with applicable federal, state, and local laws. And the governing board must review and approve the annual program budget. So based on what you're telling me here, the budget has been tweaked and things. Has the board approved this current budget that is now before the legislature? Has the board approved that budget?
So we reviewed this new budget in detail with the board about 2.5 weeks
No.
ago.
That's
So
a yes or no question.
Yes.
Has the board? Yes, the
Yes.
board has approved it. Okay, good. So on page 7 of 8, you have the medical director vacant and the executive director vacant. So what position do you occupy right now, Ms. Tess?
I am the interim medical director and the interim executive director. It's listed as vacant because there is no permanent staff in those positions.
Well, you see, that's I can see what you're saying, but okay, so you're now being paid as the interim executive director. Do you plan to hire a medical director? What's going on? Because you have a position here where you want to get 4 more medical directors. 4 more health providers, 4 more doctors, 1 dentist, and a psychologist. But so you're now paying out of the medical director budget. Yes?
Yes.
Okay. I want to get to a very serious issue here. Apparently, there's about 4 employees that have not been paid the employer contribution. And the employees are calling in and saying that they're being told to hire an attorney to get their reimbursement. What's going on with those 4 employees that have not been? Apparently, they've been part of the GRS, and the employees have gotten their share, but as far as the employer share, they haven't got. So what's going on with that? Tell me what's going on with that.
So we are actually still trying to uncover all of the information about that. All of those decisions pulling out of GERS, et cetera, was before either one of us was in these positions. So we are still trying to get that information ourselves because we do take that very seriously for our staff.
So do you plan to pay these employees, or you going to have them hire an attorney to sue you? Tell me what are your plans? I want to know directly if you're going to pay these employees this amount, because apparently the 14% was an employer contribution at the time when there was a GERS employee. The employer pays 14%. So if you take them out of the GERS, it's my understanding that you have to compensate that. So you plan, yes, to pay them?
So like I said, we're looking into this situation, but until we have all of the information surrounding what happened, how things were pulled out, et cetera, it's really hard for us to make that decision. But we absolutely are going to do the best for our staff. This is very important to both of us and to the board.
Madam Chair, can I finish my question? Okay, so is that reflected, that amount reflected in an accounts payable? Do you know approximately how much? Because, see, we're trying to get a full view of your total accounts payable. Is that reflected? Do you have an estimate? Can you tell me?
No, that is not in our accounts payable.
Do you have an idea of how much you'd owe?
You do?
Yes, we do.
Go ahead.
Yes, Senator, we do know. We have the numbers.
Tell me.
The initial estimate that I got, calculations that we did, was $373,000 for the 4 employees.
Okay, thank you very much, Madam Chair, for the time.
Thank you, Senator Fonseca. Getting late, so forgetting names. My apologies. There was something you wanted to say that the senator asked that you answer. You responded on my time. If you wanted to add something else, you can feel free to do that.
I don't remember. No.
Yes. So that's a yes, because they're well into they're well into fiscal year 2024.
Correct.
So we are discussing 24 when their 24 budget is already online. You understand? So we have to figure out how to fit and realign how we're doing this for the future. No problem. Senator Joseph, you're recognized for your 4 minutes.
Thank you so much, Madam Chair. A pleasant good day to members of the St. Thomas East End and Medical Clinic Center Corporation. I really want to commend you for the hard work you do, especially to reaching that population that really needs that care, and some of our indigent patients. And you do provide a valuable service. I want to get back to the amount of the uncompensated care. Mr. Myers, you mentioned you had $1.86 million for 2022 and $1.6 million for fiscal year 2023. Okay, and for the 1.86, you just rounded to 1.9. So for fiscal year 2022. Does that represent the match included with 13% from Medicaid?
Senator, no, it does not. This is the numbers we're looking at were the numbers I called out were for the self-pay portion of the population of our patients.
So now tell me about the 13%, the 87, 13%. We are responsible for the Medicaid 13%, correct?
That's correct.
How much does that equate to for fiscal year 2023?
2023, okay.
This is our complete AR for Medicare.
Medicaid.
Actual revenue. Madam Senator, the Medicaid figure that I have here is for FY 2023 is $2.9 million.
2.9.
Okay, sorry. That's 2.9 is our revenue. So 13% of that would be approximately 10% would be, just give me 1 second here. It looked like it would be about $500,000. If I'm doing a quick mathematics here.
Okay, so your revenue,
or medical,
your program proceeds, you call it program proceeds for your Medicaid, correct?
Correct.
And you're saying the total amount is 2.9 million that you've collected.
That I've billed.
That you've billed, okay.
Yes,
and you have received all of this.
I'm only going to get 87% of that.
87%.
So this 13% would be your responsibility.
Will be our responsibility.
Correct.
So that's what I'm trying to get from you, what that 13% look like, and if you had rolled it up into the uncompensated care.
Not the figure I've given you so far.
Okay.
So I would have to add that to that. That would take us to about, let me just do some quick calculation if you don't mind. I want to give you exact numbers. 10% would be 290.
Yes.
290. So if we say we add another 3% to that again.
Let's just round it to 500,000.
Let's say 500,000. So then we would be at 1.8 plus the 500,000.
Maybe 400.
Let's
Okay.
say 13 times 3, 39.
I'm just trying to get past the
closer, 300 exactly.
To satisfy the chair, I was just trying to get past the 2.1. So that's why I was in such a hurry.
Okay. So we have about 377,000 that we have to pay for the 13%, correct?
Correct.
Okay, we'll just estimate, and you didn't roll that up. That's what I was trying to get, if you had rolled it up into the uncompensated to just find out. I'm glad that you've kept it separate. That's very good. Then I wanted to shift to your personnel. Are all of these personnel, and I'm looking at the post-audit report, is from page 6 through page 8. Are all of these personnel covered at for the full year, including your vacant position, the associated cost?
The personnel listing that you're looking at is a gross pay. So it does not include the fringe benefits.
Yes, I understand that. It's a gross pay.
Yes, ma'am.
Okay.
For 1 year.
For 1 year. Correct. Okay. And there is no matching or braiding of the sources of funds to pay the employees, meaning specifically somebody from accounts payable, they'll be getting a portion. And then because they do work on some of the program income side, a percentage of that is going towards their salary that comes into from the program income.
Let me just say, Madam Senator, in our particular circumstances for FY 2024, we really only have this federal grant, the 1.5 million we talked about earlier, and that 1.5 payroll, I'm getting mixed messages, but we have been told that payroll only for the executive director, the CFO, and the medical director are the only payroll that can come out of that fund. So only those people we can cater for. Sometimes we hear that, sometimes we hear more people. But what I'm saying in essence is that in those particular circumstances, so we've spread it out. If you look at the details, you'll see that we have most of the people either going to be paid out of program income, which is limited by the 4.7 that we talked about.
Right.
And then so the rest of it that we can't accommodate there, we simply put it in the listing for the GVI allotment. That's why our GVI allotment is 4.7 million.
Okay, Madam Chair, I just have one final question. What is your cash on hand? Do you have an amount of cash on hand right now as of the ending of July?
As of the end of July, what I can tell you is that we really don't have any cash. funds that come in are spent right away. As I speak to you, for example, right now we're waiting for the government for the GVI allotment so we can make payroll next week.
Oh.
These are the kind of challenges that we have.
And how, Madam Chair, I did say one final question, but just let me ask, if you would allow me, what does your payroll look like biweekly?
Oh, when I joined about 4 months ago, the payroll, the net payroll was about $173,000. The last one we had was a little under $120,000 based on the adjustments that we have made so far in the last couple of months.
Okay, thank you. Thank you so much, Madam Chair, for the leeway. Thank you.
I had a request, but I can't remember what it is. I'm going to go to the next senator. It'll come back to me. I think Senator Francis Jr., you're recognized for your 4 minutes.
Dr. Tess Richards, testimony this afternoon. I wanted to ask you, Interim Executive Director, how many current employees do you say you have? Is that 74?
We have 70 now, but we have budgeted for 74 because we want to hire for some more providers.
Very well. How many employees were recently terminated?
18.
What was the salaries of those employees? Start at the low range and what was the top off?
The lowest person was probably $33,280, and the highest salary would have been $125.
Very well. And currently you're sitting in 2 seats?
Yes, sir.
You're the executive director and also the medical director. $212,500 for the medical director, $134,800 for the interim executive director?
No, I get one salary. I only get
And how much is that salary?
I only get the medical director salary at $225.
$225.
Correct.
You get it $225, correct?
Correct.
So, okay.
And just for point of clarification, that salary is split between the 330 and the program income. So that's why you see it split on that form, 120 and 105.
120 and 105, you said?
Correct.
Okay, very well. You spoke about, I made some recommendation to you the last time that you came before us in respect to trying to slot in some of those terminated employees or those put into some other government agencies that could fill that role because we're so short in the medical side of the house.
Yes.
Have you been able to get any of those terminated employees slotted in government anywhere?
I haven't gotten anyone hired, but I did reach out and speak with the Department of Health, and they're having their human resources person contact the staff if they need people. And we also sent correspondence to the staff to let them know that if they need our support, they need references, that we'd be happy to provide that for them.
Okay. And going back to the terminated employees, how much of a savings do you achieve as a result of those 18 employees that was terminated?
It's about $60,000 every pay period. And when we tabulated that, including their fringe, it came to about $1.95 million for the year.
Well, and I noticed on your listing as well that there's a dental hygienist for $103,000, one for $80,000, and one for $29,300. What's the variation and the difference in pay for the dental hygienist there? Is that an error?
That's an error. That was probably the initial budget that you received.
And you spoke about electronic medical records. You're paying $500,000 for the electronic medical records. What company are you utilizing for that record, medical records?
It's called Greenway Intergy. The actual contract is for about $300,000, and then we get other bills for things that they do throughout the year. And again, that's one of those companies we're trying to change our lease, or our contract rather. and find another vendor for that.
Is there any possibility or any exploration of looking at the medical expense that's being utilized by both hospitals? Have there been any discussion on how do you try to, streamline the medical records and get them more in line with what's happening nationwide and being able to have a tracking wherever you go?
Yes, we have been speaking with Director Francis, and we are actually going to be a part of that pilot program. So we've been having multiple discussions with her.
Very well, look forward to that. And in your testimony, you also spoke about the establishment of an obesity clinic. What's the cost of that obesity clinic, and what is the game plan in putting that together?
So there wouldn't be any extra costs. We just need the providers. What it involves is holding classes at our facility, so there's no cost to that. We wouldn't have to pay the provider any extra. So it really is just a matter of marketing, having our outreach team go into the community and bring people into the center and have our classes. There would be no extra cost.
Very well. And the property, the Hartman property that you lease, how much have you expended in that property thus far, in that lease?
It was about $230,000 is actually owed to them. I haven't tabulated what they paid in that first couple years, but we do owe them a significant amount of money because they haven't been able to be paid. We are also actively trying to get out of that lease.
And your attempt to get out of that lease will gain you'll get back your money, or you'll be a total loss?
No, it will be a loss. It will be a loss. We're not going to get any of that money back.
And we're paying a little bit over $200,000 on an annual basis, and we have been leasing that property for several years.
Correct. Initially, the rent was about $4,000 a month. Then it ballooned up to $16,000. And if we continue with the rent, or the lease rather, it'll be $16,000 every month for the next 50 or 60 years, because that's how the contract is written. So we're trying to get out of it to save that amount of money.
Very well. So based on your recommendation, have you spoken with the Department of Justice or anyone else in respect to either recouping some of that cost that went into it, or is just going to be a total loss? I mean, I'm concerned about, funding have gone towards this lease for all this time and now just walking away from it.
Well, that's something that we can certainly discuss. But at this point, we really were focusing more on getting out of the lease and hadn't actually thought about being able to recoup anything, because the lack of development isn't anything on the part of the Hartman family. It's because we just didn't we weren't able to proceed with our plans. But we'll certainly talk about that piece with our board.
Very well. I heard my time called loud and clear. Thank you very much, Madam Chair, for the opportunity.
Thank you, Senator Francis. Let me just make a little joke. That was the third time we called time. Okay? But we definitely appreciate your question, because I need to ask. You kind of spark a little nerve there when you ask about the Virgin Islands Department of Justice, or I guess the Inspector General. I saw the board member, the chair of the board, but I'm not seeing him anymore in the chambers with us.
Mm-hmm.
But now that you have taken over, the leases, et cetera, that were approved for the
Land?
vacant land, as well as the mall, did they go through board approval?
That is my understanding.
Okay, so there is culpability not only from the previous executive director, but there was a board in place that functioned and made decisions and met. So we need to make sure that we keep things in proper perspective.
So if I may, I know
of course,
it's time.
Of course.
I don't know how much transparency there was, or how much explanation there was about all of the contracts, the leases, et cetera. It was very challenging for us to find them as a team ourselves. So I don't know how much involvement there was on the part of the board as far as executing these contracts and understanding what was going on with the contracts.
Okay, so that brings me to this question. What is your approval threshold with your boards? So if you're currently serving as the interim CEO, correct?
Correct.
And how often does your board meet?
Once a month.
So your board meets once a month.
Correct.
And it means that once per month, you have your leadership team. So before the board meets with you and your team, you meet with your team.
Correct.
And there are things that you have to take to the board for approval.
Correct.
So what is that threshold? Meaning the threshold as far as the amount of money that you can make a decision to expend without board approval.
So right now, I think because of how difficult things have been, any check that gets signed at all, regardless of the amount, has to be signed by a board member. So they're aware of every single dollar that we are spending
And
right
what was
now.
the policy before?
I believe it was $25,000 or more is what had to be approved by the board, but that's no longer the case. We are really being very, very specific
but you
about
see what you
what's
said?
spent.
$25,000 or more, you believe?
I
give or
believe that's what
take.
it was.
But the board saw the movement into a new building, and the board saw a lease of a vacant land. Are these new board members?
We have some new board members now, subsequent to all of the changes that have gone on. We have some new board members, but it's difficult for me to answer those type of questions because I don't really.
Right.
I wasn't a part of those kinds of decisions. So
Absolutely,
I'm sorry,
and
I can't
that's
answer
totally
that.
understandable. I just wanted to bring out a point that there's a threshold. Now you guys have made some different changes, but if the board meeting every month, then what should happen is whatever that threshold is should have been going to the board for approval, and the board could see just like all of us that there was land leased, and the board could see just like all of us that y'all moved into to the Tutu Park Mall. So again, my position is there's culpability all around. Okay? I believe that Senator Francis was the last speaker. But I have to go back to this. I really like your CFO, by the way.
We do too.
Yeah, Mr. Mayers, you are on top of your game, and you are here for the fight for STEAM-CC, and that's very appreciative. But you said something earlier. When I asked for uncompensated care is uncompensated care. When my colleague, my other female senator from Bavoni, asked you said that the numbers that you provided was only for self-pay. Uncompensated care is uncompensated care. So the 13%, what I need to get from you for fiscal, I want to go back because I asked you for it for fiscal year, I think I went as far back as 21, 22, 23, because we're now in 24. So we want to see 22, 23, and your projections for 24, because you're in 24. What is that total number?
For
the 13%, with everything that is not paid.
With the 13%.
Inclusive, no.
Oh, sorry.
Let me finish. What is that total number? You're getting, for instance, this fiscal year.
Right.
Let's use last fiscal year because we are on off fiscal years. This fiscal year, fiscal year 2023.
Right.
You submitted how many reimbursement requests to the Medicaid program?
Okay, for the Medicaid only, our FY 2023 is $2.878 million.
2.878. Of that number, how much did you get?
Of that number, we expect to get 83%.
No. We ain't talking percentage. I need a dollar.
Oh.
Raw numbers.
Okay, let me just.
What was the amount that you received a reimbursement from the
Medicaid program.
Medicaid program, and do they owe you any outstanding amounts for fiscal year 2023?
Madam Chair, I could calculate and tell you that number. I don't want to do that. I'll let you. I'll find the actual number that we received for that for that year, and then I'll get.
No problem. So we're going to ask you to bring us back to send all that information back to this committee, because it helps us to make an informed decision. Okay? So
yes, ma'am.
you don't have to give it to us today and we have raw numbers. We really want to get a clear understanding so we could look at the detailed data, so we could understand the information that's being provided, so we could make that decision.
Fair
okay?
enough. Yes, ma'am.
So 22, 23, and your projections for 24.
Okay.
Okay? Senator DeGraff, you're recognized for your point of information.
Yeah, thank you, Madam Chair. And in that conversation with the previous senator, you mentioned something about 4.7 when we were calculating the 13% or something like that. What was the, or maybe I misheard, but I was just trying to figure out what was the 4.7 about.
I mentioned 4.7 in two respects. The first respect, Senator, was that we needed to get to that 10.7 million that is our actual total budget.
Right.
And so because we challenge ourselves to increase our program income to 4.7 or thereabouts, we also need to, we're challenging this organization to provide us with the additional 4.7 we needed. The 1.5 in the middle of all that is the figure we're getting from the federal government. So 4.7 from us, 4.7 from you, and the 1.5 we get from the federal government.
So that's in
I really like
addition,
him.
addition to what we're giving you the 2.1. 4.7
is it total? So an additional 2.6 is what we're asking.
Of the 10.7, really?
Correct.
Okay.
So the 2.1 number they give us an additional 2.6, just one time.
Just once.
Okay.
I want to stress it's just one time.
Just one time.
All right. We'll be just fine after that.
And if I may, Senator DeGraff, the other 4.7 you may have heard, that was our revenue generation for 2022. So that's probably where you heard that as well. Yes, sir.
Please provide us that information, because I want to make sure that you are, in fact, getting your reimbursements from the Department of Human Services.
Definitely.
For those fiscal years. And any other fiscal years, outer years, that you've not received those funds, please provide us that information.
Okay.
Because we want to make sure that, because you're asking us for the funding, and we have to make sure that the agencies that are responsible for giving you your Medicaid amounts, the agency actually, that is actually occurring.
Yeah.
Okay, fair enough.
Okay, so you got to go back and check and see, what did I bill? What did I get? And of course, you may bill, because you have presumptive eligibility, correct?
Correct.
So some people may be unqualified, or whatever the case is. So you got to give us all the information so we could really understand what's happening, and we could really understand or know that you're getting your due back from Human Services, Medicaid division, once that patient is in fact eligible. Okay?
That's fine.
Thank you.
All right. We're going to send you correspondence requesting the information. The personal listing that you provided, is that inclusive of all of the employees that are at CMCC?
Yes.
So you didn't break it down by just the ones that you charge to the GVI, correct?
No, they're all there.
Thank you for that. I think we have that information. Did you all provide us with a breakdown of your other services category, which is your contracts and all those other items?
Yes.
Okay, so
April
we'll look at
21st.
that.
Okay.
I don't have any further questions. There was one question regarding the audit. When was your last financial audit conducted?
We just completed it earlier this year.
And I do believe that we were
It's FY22.
22.
We finished
We finished
FY22.
at 22.
And FY23 just ended in February of this year. So we'll start that audit this month.
This month.
And so you start the audit for FY23 this month?
Yes, ma'am.
So basically your audits are in fact up to date?
That's correct.
And I do believe that we received a copy of it, but if you can, please, if you will, please send us a copy of the last audit that was conducted. You could send it to the committee. We'll ask likewise of the Fredericksted Health Center. So include those in the correspondence that we'll send you, and we look forward to getting the information. I think that was it. I'm going to ask you to provide us with a 30-second close. Dr. Richards.
Okay. Thank you. I just wanted to express our appreciation for your support from both this committee as well as the members of all of the 35th legislature. We appreciate your support. We appreciate you understanding our budget request and our budget needs, and we hope that you'll look upon our request favorably. We will be submitting the documents you requested by the end of the day tomorrow.
All right. Thank you so much for your responses. Thank you for being very honest and upfront with us in the discussion. That's really the only way that we could really help.
Right.
So we will true up the information and make a final decision. And of course, if we need any additional information, we will reach out to you to get that.
Sure.
Okay.
Thank you.
Colleagues, we have exhausted our day. And of course, we meet again tomorrow. The Committee of Budget, Appropriations, and Finance is for, what's today's date? August 2nd, time is running, is hereby adjourned.